Europe and around the world. She's a professor and she has done a lot of work on migration, of course. She has previous roles in EUFA and, of course, works. She's really important person on migration around the world. Now she's president of the Global Society on Migration, Ethnicity, Race and Health. As we have discussed already in the previous 2 days, one major problem in One Health is that One Health is for all people, not only for people in each country, but for the migrants as well, who are facing the problems with One Health in some cases with more severity than other people. So we have to keep in mind when we take measures for anything in public health, and especially, for example, in One Health, to consider the problem and the necessities that we have and of course any requirements, and to try to work on that. So I would like to invite you, Bernadette. Thank you again that you are here in Patras, and I hope that you enjoy these couple of days. And I would like to have you for this keynote lecture. Thank you.
Thank you so much, Apostolos, and it's a real pleasure to be here today at the One Bridge. And I'd like to congratulate, first of all, the One Bridge conference, and really it's very important as a concept as well, and also to put this particular topic on the agenda, which is really important. I have to say that I have a lot to say, so I'm going to speak very quickly, and I'm sure that you'll have a lot of discussion after that. I think that what I'd like to start off with is, let me see if it works. Okay. Not moving. So could somebody help me with the slides? Okay. Okay, now it's working. Thank you. So what we say is that planet Earth is really multicultural. And if you don't like that, you might need to move to another planet. And given the current climate injustices, we just might have to. But there may not be another planet to move to. So what I'm going to talk today about is the world today, where we are, A Tale of Two Cities, the Lancet Commission, and also the aims and the rationales that we have, our approaches, the expected outcomes, and why we must walk and chew gum at the same time. I know that sounds very ominous, but I'll come back to that. And also, one of the things that I would also I have a separate presentation on the One Health Lancet Commission. I won't have much time to go into that, but just to give you an idea about it. So let's start with the world. The world order or disorder. I think that it's very clear that there's a lot of political and financial uncertainty and disruption. This is not really new. But what is very alarming is that global health financing, and which means that financing in health has reached a 13-year low. There's redirection of funds from health to defense, military, and this also exacerbates the global health disparities. And we also know that what has happened with the Trump administration is the fueling of an anti-migrant rhetoric, and the US has also slashed, restricted, and stopped development and funding. This has had an impact also on multilateral organizations such as WHO, IOM, and their downscaling. We also see that there's a global leadership vacuum, particularly in the area of research and science, to uphold scientific integrity, which is grounded in evidence and equity. And institutions across the world must really collaborate. And I mentioned this on Monday as well, that partnership and collaboration is no longer just a luxury. It is no longer, it's the only option that we have. Okay, and when we talk about climate change in particular, and we talk about migration and displacement, I like to liken this to wicked problems. Now, wicked problems was a concept that came up about 50 years ago, and it was mainly for problems that were very complex, and basically where we had incomplete data, there was no end to the timeline, very many different actors, there was no solution, or if the solutions were there, they were very costly, etc., difficult to define. And today, what we find is that wicked problems rarely occur in isolation. And some of the wicked problems that we're looking at is climate change, conflict, data privacy, urbanization, racial inequality, food security, poverty, pandemics, and I could just go on. And the other thing is that these are all interconnected, and we have to stop looking at each of them separately. We have to try and look at them in combination. And if we look at three of the global health priorities, for example, you can see from the images, I've not written what they are, but you can guess, and you can see it's climate change, the pandemic, and conflict. And what these have in common is they introduce new sources of risk, increased health burdens, increased mobility, there's a push and pull. And this means that the differential risk, the differential exposure, and differential consequences occur for individuals as well as for society, and which means that migration really emerges as well as an independent determinant of health inequities. It's not the same as the social determinants. You can say it's not either or. If we look at some of the statistics when it comes to migration, migration is no longer something which is only restricted to borders, and that's why we use the term displacement. Because when we think of migration, we think only of refugees. And refugees are a small group of migrants, they're a subgroup. But a lot of the migration, particularly related to climate change, actually occurs within countries, or it occurs in countries that are close by, and people move back. So they're displaced. And the question is whether this displacement occurs over time. So a lot of this, and I'm sure the students will also talk about it later, we see temperature rise, sea level rise, precipitations, extreme events. But this affects incomes, livelihoods, and leads to movements. So in the climate change context, migration is not entirely negative. It's a way of adaptation, and this is important. So now, of course, the challenge, and the COP is just, is talking about it. The IPCC is about how to keep the climate change below the levels that would trigger larger, disorderly cross-border movements. But in the meantime, what is needed is both the global climate action, but very importantly, country-level adaptations, and also not to get lost in the numbers, because we can get lost in the numbers and say, can the movement of people be attributed only to climate? And that is very hard. And I'll come back to why that is a bit hard. We also see that climate changes, there's a lot of climate injustice. There's geographical injustice. It's not the same all across the world. We know that different places are affected differently. There is a certain settler colonialism, indigenous exploitation, gender inequality, intergenerational climate injustice, economic inequality, racism, language, literacy barriers, and immigration status. There's discrimination against the disabled, chronically ill, elderly, and other forms of inequality. And this list just goes on. And today we talk about slavery, and maybe in 100 years, people will talk about climate change the same way. So what is important is that tackling this is also the greatest global health opportunity of the 21st century. And so we mustn't really look at it only as gloom and doom, but a real opportunity to actually invest and to make sure there is some action. So, and it also ties in with the Sustainable Development Goals, as you know, number 13, which is climate action, and number 10 is to reduce inequalities. Now a little bit about Lancet, and the Lancet, as you know, for all of you, because we're all scientists and also most of us working in health and health related, and on the issue of migration, the first Commission report came out in 2018. Then there's been a World Bank report, there's a WHO report, and we recently also had a series in Europe looking at inequalities. And there's a new commission that I'm going to talk about. So the first commission, we have 46 authors, 20 global institutes, institutes. And it is very challenging when we work across disciplines. And I think this is one of the big issues with One Health, isn't it? Because everybody has their own discipline, language, terminology, concepts, theories, and then you're trying to work together. And working together to bring it together means that, of course, there are a lot of discussions, analysis, and basically, in short, what we found and we recommended is migration is a global health priority, and we need to have recommendations for maximizing the health of all, and particularly people on the move. And that's why it's both migration, those who migrate and then are stationary, but then those who are displaced as well. And then you have to ask the so what question. And the so what question, so what about migration? And I think that what is very important, it is our reality and our future. It's not something that you can press the delete button and it will go away, because people have moved. And also, if we look at the past, we know that Europe has come off migration. So it's one of the things that has got a negative, side to it, which has become really a political rhetoric. And in health, we have to move away from that and also move others away from that and say that it's not only the well-being of migrants, as said by the UN, but also of communities in countries of origin, transit, and destination. And so the Lancet Migration was born, and this is what Lancet Migration really does. It's transforming evidence into action. It's really working together with multidisciplinary research. It's looking at evidence-based advocacy, drawing in public engagement, and then, of course, ultimately, we do hope that there is an impact on policy. So this is the global collaboration, and I'm very pleased to say that in the years since the publishing of the report, we have tried to really foster this across. I will focus a little bit on Europe, because we are in Europe, and we have this love-hate relationship with migrants and the whole migration issue. And I think that what one has to do is really come to terms with how it's not a problem to be solved, but it is how to be managed and how we can really change that. So we had the series that was published last year, and what we did in the series, looking at Europe in particular, is that this is about also reconciling migration with the principles of equity and compassion that underpin European values. And it's also because that we do have a large number of the global migrant population. What is very interesting is that 70% of those who are here are actually migrants within Europe. They're not migrants coming outside of Europe. So it's also a very important, myth that most of the migrants are coming from outside of Europe, and that's not also true. And I will not go into all the details of this particular series, but just to say that we covered very important topics like priority setting, the universal health coverage, life course immunization, migrant-sensitive healthcare, participatory approaches, racism and its impact on child migrants, and enhanced capacity building. So where am I going? Why am I telling you all of this? And that is because one of the things that led to, you have the Lancet Countdown on climate, health and climate change, and you have the Lancet Commission on migration and health. Usually what happens with Lancet commissions is the Lancet asks or focuses on topics that they think are very important for health at that particular time. And then the commission report and recommendations are submitted, and hopefully it has an afterlife. There are only 2 standing commissions, because these are topics that one believes are not finished, and one is climate change, the other is migration. The others are all reports that are submitted. And from that came the nexus. So the nexus between climate change and migration is the tale of 2 cities, where migrant health and climate change and health, different groups of practitioners, researchers, and policymakers. And before you had the ONE Bridge, we talked about and wrote about building bridges in the 2 fields of research. But it's hard because they have long histories. They have diverse scientific disciplines. And then you have the issue, should we have something called climate migrants? And I leave it to the students to discuss this, because it is a conceptual trap. And some might say, yes, we need to have, because we need to have focus. And The next question is, how do you define them? And are you sure that you will not leave somebody behind? Because one of the other things is that we mustn't leave anybody behind, because migrant health inclusive systems tend to be largely theoretical and less operational when it comes to the health of people on the move. So what is the intersection between migration and climate change? We see that there's an increasing intensity and frequency of natural disasters. We see that there are changing migration patterns. And migration patterns are not new. You always had seasonal workers, and you had seasonal workers and seasonal patterns of movement within countries that were very normal, and it goes back centuries. But the new challenge is also competition for scarce resources, changing demographics, increasing vulnerability of groups, and there are, of course, push and pull factors. So what are our main challenges when it comes to the nexus? The challenge has been no data, no problem. There are a few studies. So there are differential health risks and outcomes to climate change must be recognized. And this means that there could be a differing level of physical exposure determined by where people are located, their occupation, the urban development that leads to risks, and failure to provide access to critical infrastructure and services, which means disruption of continuum of healthcare, social characteristics that influence resources, and of course we know that there are health system and governance issues. The second is the complexity, and that's where the wicked problem framing also comes in. It's multifactorial, and it's very hard to measure and say what is the attributable risk. But climate threat is basically the climate change is basically a threat multiplier, exacerbating the existing socio-political and economic vulnerabilities. And of course, the research methods, there are some limitations, and there are also, of course, ethical dilemmas related to that, which often results in inaccurate responses and results. But we have lots of colleagues working on these. So the gaps that are methodological, ethical challenges that movement, displacement, migration has there are also traumatic experiences, so they require careful consideration. And yes, if we do say that this group of people is in this particular category, do we have protection mechanisms for them? And of course, we always talk about in research anonymity and confidentiality to protect participants and to facilitate their trust and facilitation. So the areas of research for involving is exposure modeling of populations, who, what, why, including the specific types of migration, multidisciplinary research that we need, and also relying on just quantitative data, though everybody's very excited by all the models and what they can predict, et cetera, is also contextual understanding, because we're dealing with human life, and we're also dealing, I'm not even talking about one life yet, but we're also dealing with the environment, and we're dealing with, everything that happens around us. And also, we have to look at how health systems can be responsive. So it's not our differences that divide us, it's our inability to recognize, accept, and celebrate the differences. So the new commission, which I'm co-chairing, is the Climate Change Migration Health Commission, and it's dealing with two of the heaviest burdens in the WHO region, because Europe is the fastest warming continent in the world, and migrant health inequalities also remain a systemic blind spot. So we're really bringing these two things together. There is structural failure in Europe to prioritize the well-being of migrants and climate migrants. This commission demands urgent action. So what we need is really looking at, and we have this study that from Norway where we looked at who's affected, the vulnerable groups, and they're not just migrants, but they're also other socioeconomic disadvantaged groups. And when we say vulnerable, it means that there's something wrong with the groups, but actually they're underserved populations. And there are adaptation challenges that we see, which is household, working conditions, income, education, resources, awareness and perceptions, and also access and inclusion. But what everybody needs to focus on, and there's less focus on that, is solutions. So what do we do? Should we just stop people from moving? Should we change their lifestyle? So there's lots of work going on in finding good solutions, better integration, building climate resilient communities, and of course in healthcare where it's integrated surveillance, and I'm sure you talk a lot about that. So we have this publication in The Lancet, which is announcing our commission. And basically, we're looking at 4 areas in our commission, looking at the global context, looking at the impact of climate change and patterns of migration to and within Europe, the health needs of migrants in Europe and the impacts of climate change on those health needs, and the European responses, which is really looking at a social determinants of health approach. So what we're going to do, and the Commission report will be published hopefully by the end of next year. We have 4 working groups, and it's really advancing the conceptual understanding of the nexus. It's identifying the key research and policy gaps, and really looking at lived experience of migrants through the Migrant Voices panel. So, I won't go into the details of the working group, and you'll have the slides so you can look at the publication. But our approach is to address responses. And this is something I think that Apostolos, you will recognize, because this is from what we produced in the joint action, is downstream and upstream. And usually the responses, particularly in healthcare, is to look at the downstream, access to healthcare, quality of care, and attention to vulnerable groups. But it's some of the upstream. It's the missing data that we need. It's the governance issue, and it's the intersectoral action on the social determinants of health that need action. So I'll try to, I will talk a little bit about the One Health Commission, but I would like to begin to say, so what is it that we need to do? So as researchers, we need to increase collaborations with countries, with migrants. We need to diversify our research methods, which means, letting go of our babies and beginning to look at how we work with other disciplines and other methods, broaden the scope of health topics, and using modeling and forecasting to identify areas and populations at risk. Governments must fund research activities better connecting climate change, migration, and health, so they don't remain in the silos. We need to mitigate health crisis emergency preparedness in particular, and we've seen that, whether it's heat, whether it's flooding, whether it's typhoons, it's happening all the time, and we have to be better adapted. The health system has to be better, more robust in order to deal with those, and we need to adapt health challenges posed by climate change using evidence-based practices, make sure that the universal health coverage really covers everybody. Multilateral organization must put research and action agenda for climate change, because it's not sufficient only to have conducted the research, but it is also implementation of the recommendations. We have to continue to advocate for universal healthcare. It's far from achieved, and looking at how to translate findings and advice into practice and policies. And very important, in order to discuss, to make sure governance and leadership is important, and we need the leaders and champions. So I'd like to just end this part by saying you really can't know you can't really know where you're going until you know where you have been. So we know where you have been, and we have to look forward, and we have to keep that momentum. So thank you very much. And now I will, if you can help me to find the next presentation. It's going to be very short, but, and I have to thank the co-chair for the Lancet Commission on One Health, Andrea Winkler, for sending me her slides, because when I realized this was One Health, it's very important, to talk a little bit about the One Health Commission. And I think it'll also be with you. So yeah, that's fine. Yeah, thank you. So I'd really like to acknowledge all the colleagues, who've been working on the One Health Lancet Commission. So the One Health Lancet Commission, the vision of this Lancet Commission is healthy socio-ecological systems achieved and sustained through an equity-oriented, inter-transdisciplinary and multi-sectoral One Health approach to advancing health among humans, other animals, so they do bring that in, plants, and other biotic and abiotic elements, and the environment at large. Very ambitious, and it has taken them a very long time to publish this, but I think very, very useful. So it synthesizes the current state of knowledge on One Health and appraises its added value for addressing global health and sustainability challenges. It offers a systems-based understanding of health interdependencies among humans, other animals, plants, and environment. It's a roadmap that proposes concrete avenues for operationalizing, implementing, and institutionalizing One Health across sectors. So quite a bit, and you can see that it was published. So the way they've divided the report is the following. The purpose of the report, key messages, what is the Commission, the foundation of One Health surveillance, infectious diseases, antimicrobial resistance, non-communicable diseases, health promoting synergies, a One Health approach to equitable, sustainable, and healthy food systems, and of course, the how-to, the avenues for operationalization, implementation, and institutionalization, and of course, recommendation. So I won't go into the evolution of the One Health, the Lancet One Health Commission, but suffice to say that it has taken a long time. And this has been a process. So it's not just when the Lancet One Health Commission thought, or was really launched, which was in 2019. So it has taken some time, but also going back to what has been happening before that. So it really traces, and I heard some references also to Workov, and of course we know that there has been a lot that has happened since then, and it was finally launched this year. Okay. Okay, so I think this is a very important figure because it puts it all together, and it's like the socio-ecological systems approach. And you can see, you know, health is shaped by dynamic interactions. And this is really showing the dynamic interactions between natural ecosystems, health, human, social, cultural, political, and economic systems. And also that they are complex, adaptive, and interdependent. So changes in one part of the system affect the whole, and that climate change, biodiversity loss, and pollution are interlinked and have cascading effects across species and geographies. So One Health brings this holistic and systems thinking to understanding these relationships, and therefore says, you know, really moving away from the silos and bringing them together. So here's the exciting part. So what were the key messages from the One Health Commission? So One Health is a collaborative, interdisciplinary, and multi-sectoral approach that addresses global health and sustainability challenges. It is rooted in the understanding that the health of humans, animals, plants, and environments is deeply connected. So it is something that was implicit, and we've all known it, but it's really making it explicit. So this socio-ecological interconnection is central to One Health, but also central to climate change, biodiversity loss, and pollution that threaten this balance. And the impact is felt unequally across populations. And that's where we also see the health inequities and migration, particularly in the European context, being a very important part of that. So considers these risks and calls for urgent action through climate mitigation, conservation, and ecological restoration. So now it looks at expanding the scope of surveillance beyond disease detection to include the broader determinants of health. And I think that is where it takes it to the next level. And the approach supports resilient ecosystems and promotes environments that sustain health and well-being. Okay, that was it. So thank you very much. And this is from Andrea Winkler and the Lancet Commission on One Health that I hope that you now have and will use in your discussions and work further. So thank you very much.
Thank you, Bernadette. Thank you for this amazing talk. Are there any questions? Yes, of course. Give me 1 second. Yes. Here, those people.
Roberto Spurio, University of Camerino, Italy. I have a provocative question, especially in light of the presence of next generation of scientists or researchers. So you talk about a wicked problem and very complex combination of factors. So I'm afraid humans are not able to tackle it. What about artificial intelligence? and asking the support of next generation of technologies to tackle this problem?
Absolutely. I mean, I have to say that, artificial intelligence is part of human development. It is something that humans have developed and it's here to stay. And I have to say that artificial intelligence is not either or. I think the issue is, again, how do we manage the artificial intelligence? What can we get artificial intelligence to do? And a lot of what we talk about in science in terms of modeling or in terms of actually running some of our research, generating some of the evidence is possible, and it will make it easier. However, we cannot rely entirely on artificial intelligence when it comes to issues of context, of empathy, of understanding. That has to come from us. So artificial intelligence is a tool for humans to manage. And so as long as we can't just give over all our tasks to artificial intelligence, so we have to be smart and work smartly with artificial intelligence. You could ask, for example, support in terms of going through, instead of going through millions of x-rays or millions of things, ask them to do it. But that capacity to decide what needs to be done, to determine the research questions, to then run it and to see if it matches, that has to be done by us. So there's no shortcutting. And this is why I say it's very dangerous to ask artificial intelligence to do the job for us entirely, because that's not possible. So I hope that answers. So it's not an either or issue at all, but it's a question of how we are smart enough to manage it.
Thank you, Bernadette. Any other question? I have a question. I'm not
Provocative one or not?
very provocative. I'm not so optimistic like you are. I know you for a long time, so I think that you are very, very optimistic in general terms, even in an issue that is really, I'm not quite sure that it's getting better. So my question is that so far we have seen that the improvement through governments are not how can I say, adequate to solve the problem, even in some cases to approach the problem. We can see the migration is rising, of course, because all the problems that you said have increased. And now we have One Health. We are talking in this conference about One Health, which is just a new approach of the things that we already have. The problems that we already have, it's not new. These are not new problems. These are just problems that we had in the past. We try now to approach them with a different way. I'm not quite sure, and I would like your opinion of that. How feasible will be to approach One Health and include another very important issue, that is migration. I mean, these are, of course, two different things, to my opinion, but they need to somehow take under consideration the migration requirements, etc., in each country, and of course include their own health as well. So how visible will be for the governments to do that, and how optimistic you are that they are doing that?
I think that, I always believe that we have to be optimistic, because if we're not optimistic, then we will be completely paralyzed and not be able to move forward. So, but I'm also a realist, and a realism is, I would say I was more realist than being entirely optimistic. And I think that what is important is prioritization. What we need to do is we also need to look at resource allocations. And by saying that, instead of allocating resources in parallel, if they are allocating resources which will cover an entire basket, then it is much easier. So we go back to that principle. And this means that we have to begin to rethink. I mean, everything has been organized according to disease so far. So we have to break that concept and saying we have to move away from this disease focus and look more at a more holistic approach. In that, already from the climate change community. The climate change community, and particularly climate change and health, migration is seen as a positive. It's seen as an adaptive measure. So if we bring that in, then I think it would be seen very differently and say, okay, people moving is positive, and we have to make sure that in the move we don't lose things, whether it's the environment, etc. So it's also the narrative. So some of it has to be in how we, both the scientific community, the society as a whole, and also looking at the civil society frames this for the governance and say this is going to be very important, and I think changing the narrative is what I think is the most important thing.
Thank you, Radit. Yes, Manuela. Wait. Because they need to hear from the hybrid one. Please introduce yourself.
Emanuela Mangriplis, Greece, Agricultural University of Athens. I have a question. I'm an optimistic person also, but also I can see the difficulty behind all this new concept, a very important concept, but new concept. I will bring two areas that I find very challenging, and I don't know how we can go beyond that. One Health means we all work together, we all have in a multidisciplinary way. One Health, and that's between countries also. Just like we have social inequalities, we also have country inequalities also. Therefore, the way they gather the data, the way they work with one another. So therefore, how do we integrate that in order to have all these aspects and therefore promoting and protecting all these areas that One Health wants to? And also, what I see is, although we're talking One Health, multidisciplinary, very often we tend to see that they want to make degrees of One Health, where one person will have all the information. Therefore, I think it's a concept that we need to introduce and clarify as well, because we're starting to lose track on what One Health actually means.
I couldn't agree more with you. I think you're raising a very important issue. We can't let One Health become yet another silo, because that's the danger, and sometimes we do that because we want it simple, and that's not the whole concept of One Health. And I'm not saying that we can't have, I always say that particularly when it comes to science and when it comes to academia, you need building blocks. And the building blocks will have to be in a particular area. It can't be, you can't have the entire world all being generalists. So you do need those building blocks. And that's why, we say we have a bachelor's degree, you have a master's degree, and then you have a PhD, and there's a process in what we do. So I think the issue with One Health is that it is not a vertical area, it is a horizontal area, it's cross-cutting. So which means that it's not that we have to do away with, say, microbiology or do away with veterinary sciences, or those will have to continue, but we also need a way to coordinate it all. And so it will be a bottom-up approach, and then it has to also be a top-down approach, going back and feeding into it. So what would be necessary is the students who are studying, and this is to the next generation, let's see what they say, but it's bringing those elements in. And I think that is the big challenge, because rather than, so I completely agree, one person with One Health, no, it has to be, a coordination and then come back to that level. So I hope to see that in our lifetime. If not, then we have all failed. So I hope we can manage to make that happen.
Thank you, Bernadette. Thank you again for your presence here and your talk, and in general, your thoughts about that, because I really agree. So now we have to go to the next keynote lecture, which is online from Professor Thomaidis Nikolaos, who is a professor of analytical chemistry, Department of Chemistry, National University of Athens. He's adjunct professor at Yale University, School of Public Health, visiting professor, East China University of Science and Technology. It's a guy. And his talk is The Hidden Pollution, the Role of Impact of Disasters on Ecosystems and Human Exposure. professor who was planned to be here, but he just came back from United States yesterday, so he couldn't be here, so he will be online. Nico, are you hearing us?
Can you hear me?
More or less. Can we hear him better?
Can you hear me more now?
Yeah, that's perfect, yes.
Okay.
How are you?
I'm fine. Just arrived from the States and my head is spinning. So I'm not able to drive, and I do apologize for not being there. I would love to be there, but unfortunately I have to deliver the talk online. And first of all, I would like to thank the organizing committee and the chairman, Professor Vandarakis, for the invitation to deliver this talk. And I will try to demonstrate in the following minutes another threat of the health of the ecosystem and humans, which is the hidden pollution, the chemicals in the environment, and their effect. I'm sharing my my power presentation. Okay, can you hear that? Can you see that?
Yeah, it's perfect.
Yes.
Thank you.
Yeah. Okay, so few words about the group. We are a big group of many professors, postdoctorals, and researchers and PhDs and master students, where the main aim of the group is to develop methodologies based mostly in mass spectrometry, in order to identify new substances in three pillars of our research. One is the environment, the second is biological samples and life sciences research, and the third pillar is food. All of them have one ultimate aim: to deliver back to the society the products of research in order to improve the life of humans and the ecosystem. And we have been an accredited laboratory for many years and consulting in public and private organizations. And we are using high-end technology, mass spectrometric, where we can see here that we have a range of instruments that can tackle in any analytical problem at the moment, either targeted determinations or untargeted determinations, and I will briefly explain what do I mean by that. First, I would like to demonstrate which is the problem. The problem in the environment is that we have many sources, mostly point sources, where we dispose in the environment thousands of chemicals, tons of chemicals every day, and most of them are from human sources. They are industrial, domestic, and agricultural chemicals that are delivered in the environment. And based on if there are existing legislation, we divide them into main categories: the priority organic pollutants, where we do have environmental quality standards, and the huge number of substances called emerging contaminants, where we do not have regulation, but we know that potentially are toxic in the environment and humans. And of course, this iceberg shows the difference between them, but if we delete priority organic pollutants, the same exists for emerging contaminants. The known emerging contaminants are only the tip of the iceberg, and there is a hidden pollution where we try to identify based on the methodologies I will show you. And the ultimate aim, of course, is that we would like to deliver in the EU legislation framework new data in order to develop new tools and new legislation for better management of the chemical products within Europe and beyond. And of course, the ultimate aim, as I told you, is the protection of wildlife and human health from the harmful effects of chemicals. And at the same time, EU has some initiatives, some important framework directives like the Water Framework Directive, the Marine Strategy Framework Directive, the Biodiversity Strategy for 2030, and of course, a recent regulation about wastewater treatment plants and the upgrades that are needed in order to tackle with the problem of micropollutants. And in any case, in our group, we try to have a holistic approach in the problem where we develop the methods, apply them in all departments of the ecosystem, among them humans as well, and we try to identify priority pollutants, emerging substances, and of course, then give data in order to make studies on sources, fate, removal, metabolism, and transformation. And of course, the ultimate aim is the risk assessment. But you understand that this range of diverse chemicals include polar compounds, semi-polar compounds, non-polar compounds, with different properties, with different, physicochemical fate in the environment. Therefore, we need orthogonal techniques. We need orthogonal techniques and methodologies. And for that reason, we have developed several complementary methodologies in order to determine what is known, what it is suspected that exists in the environment, or to develop tools to identify new substances without prior knowledge. And in order to do this identification, we have developed also a range of workflows and algorithms. And between them, it is the semi-quantitative analysis of tentatively identified substances, because we need to have a quantitative information of the detected substances in order to perform risk assessment. Very briefly, the methodologies. When we talk about target screening, we mean that we have the standards in the laboratory and we perform a very confident identification, and at the same time, we have been able to deliver quantitative results. And when we talk about suspect screening, we mean that we have developed libraries, mostly with in silico identification points. And when we tentatively identify a substance, then we have developed algorithms in order to semi-quantify them. And of course, we have the pure non-target screening workflows where we don't have a prior knowledge, but based on specific questions we pose on the data, we identify substances and then semi-quantify. This is done in order to have a holistic view of the risk and the toxicity. Of course, you understand that time, effort, the number of false positives increases from target to non-target screening. But at the same time, we have to understand that in order to tackle with all these chemicals in the environment, we need to have some protocols in order to explore what we call the chemical universe in the environment. And to do so, we need generic sample preparation protocols and smart validation tools to have a representative set of validation data for transforming these methodologies in the regulatory framework. Very briefly, the generic sample preparation protocols have been developed for water and solid samples. And the aim is to cover as much as possible of this polarity and molecular weight chemicals in the environment. I will not go into detail. But what is the major obstacle to understand the chemical domain of these analytical methods. Just to give you the essence of the problem, we're developing non-targeted determinations, meaning that we are aiming to cover everything. But at the same time, in order to be used in a regulatory framework, we need to define the scope of the method. Therefore, we are trying to develop methods or tools to characterize which are the chemicals that we are prioritizing from all the peaks we are detecting. And we're covering several analytical methods in order to cover as much as possible in the polarity space. And of course, at the same time, we are searching databases that are developed by us or are we are retrieving information from open regulatory databases like PubChem, for instance. All these tools are posing restraints, are posing several questions in the list of the substances we are prioritizing, and we need to know these, let's say, obstacles or the barriers in order to report with confidence the results to the regulatory bodies in order to push for legislation measures and measures to tackle the chemical management problem. I will skip the technical details just to give you an idea of what we are doing at the moment. We have targeted determinations covering more than 3,200 substances, meaning that we have methodologies for all these standards we have in the laboratory. This is called wide scope target analysis. And of course, all of these methodologies are validated. We have developed at the same time a wide scope suspect screening approach where we build with algorithms what we call MS-ready lists, libraries that can be used for screening with mass spectrometry. And of course, we have developed guidelines within an organization called Norman, how to use these methodologies for regulatory purposes. Just an example to understand how important it is to push for new methodologies and techniques. In order to cover all the chemical universe, you need different ionization sources, tools, and we are using electrospray and chemical ionization at the same time. And the heated electrospray is very important because here you can see that compared to the common electrospray source, we can detect, for instance, at higher sensitivity, more than 10 times higher sensitivity of PFAS. And there are few PFAS in the narrow branch area, where are the most labile and most toxic substances. And these substances cannot be detected with the regular electrospray source. So this means that we need new tools, new instruments all the time to tackle with the problem in the environment. And of course, another advancement is the use of ion mobility spectrometry. And this technology can separate in space, for instance, substances that have the same molecular weight and exactly the same fragments, because they can differentiate the compounds with their surface. So this is a very nice example to understand what I mean. Atenolol and practolol are two beta agonists with the same molecular weight. In samples that we have atenolol and we don't have practolol without the ion mobility, we cannot say which substance it is. They have the same retention time, the same isotopic fitting, the same qualifier ions. You cannot say which. We know that we have atenolol, but we cannot say. If we have Timson, then again the collision cross section is different, and then we can be able to identify atenolol with certainty. The same exists, for instance, between O-dysmethylvenlafaxine and tramadol, two completely different substances, but with the same the same M to Z ratio. And they cannot be separated in the best chromatographic conditions, but they can be easily separated and identified with ion mobility. And most importantly, ion mobility gets rid of all of the background noise ions. For instance, norfentanyl, when in wastewater, metabolite of fentanyl, cannot be determined without TIMS, without ion mobility. Even if we detect the M+1 ion, there are no isotopic pattern fitting, no qualifier ions. So we are not certain that they are, but that it is there. But if TIMS is on, we have the mobility dimension, then it is very easy to go down to nanogram per liter levels and identify and quantify norfentanyl in wastewater, which is very important in order to give hints to the community that it is used from humans. And of course, a big step forward was the development of semi-quantitation tools. I will not go into this technical detailed slide, which means that we have developed algorithms based on these 2,500 standards that we can quantify the tentatively identified suspect screening substances. And of course, this methodology has been validated within Norman in 15 laboratories. And now we developed algorithms and methodologies to perform exposomics, meaning the screening for xenobiotics in human samples like brain, placenta, semen, of course, blood and urine. And with these slides, I will now switch to the environmental problem that we are facing when we are analyzing samples in big monitoring campaigns. I will start from the Black Sea. We have been able to be part of a monitoring campaign of Black Sea from 2016. We are now analyzing the fourth campaign, and through all these years, we have been able to identify several pollutants, more than 300 pollutants. Most of them are industrial chemicals, plant protection products, and pharmaceuticals. More than 100 pollutants have higher ecotoxicological risk to the Black Sea ecosystem, and the stressors are big rivers like the Danube, Dnipro, and Dniester. And the most alarming situation is what we see here in this slide is that, for instance, we know that DDT is DDE is the metabolite of DDT, and this is biomagnified. We know that from their properties. PFOS, the major compound from PFAS class, is also has biomagnification properties. We start from 2.1 nanogram per liter in Danube, and we end up in 200 microgram per gram in dolphins. But the most alarming is this polar metabolite of atrazine, D-isopropyl atrazine, which is detected at a level of 3.6 nanogram per liters in Danube, and it ends up almost 300 microgram per gram in dolphins, which means that there are compounds that are biomagnified. We didn't know that. And switching now to a disaster happened in Black Sea, we had the opportunity to have samples before and after the disaster of Nova Kakhovka Dam near Zaporizhzhia, where in 2023 there was one of the worst environmental disaster in Europe for decades. The disaster of the dam ended up in a massive release of water and sediment into the Black Sea through the Dnipro River Delta, and this reservoir contained wastewater, industrial wastewater, and runoff water from agricultural areas. And you see the picture before the disaster and after, how it was. And we had the opportunity to have analyzed the area before and after the disaster. These are the results of the recent analysis after the disaster. And of course, several chemicals are present between them, one that is coming from the war, one explosive. And the most important observation is that we have detected a lot of plant protection products and industrial chemicals versus pharmaceuticals. And this, the most polluted point was sample 9 in the Dnipro River Delta near Kherson port city. And when we compare between 2020 and 2013 analysis, we can see that in 2020 we had a lot of pharmaceuticals. A lot of pharmaceuticals are detected. But in 2023, pharmaceuticals are the third class. The first class was industrial chemicals and plant protection products are coming from the disaster of the infrastructure of the area. And of course, pharmaceuticals are less because people are less there. And this is the ultimate effect on the environment after the disaster, that a lot of chemicals that are, let's say, are restrained in infrastructures, agricultural settings, or industries, then are released in the environment. And another natural disaster is Daniel. Storm Daniel struck the northeastern Mediterranean Sea in September 2023. It moved from Balkan Peninsula towards the shores of Libya. And you know that this was the deadliest storm in the last decades. You know the stories in Greece, but also the disaster in Libya, where more than 4 million people killed. And going back to Greece, the most impacted region was Thessaly. You see here that the heaviest rains existed in Pilion, Volos area, and Pagassitikos Gulf. We had the opportunity, with collaboration of a research institute in Athens, to have samples from all this region. And we did the sampling campaign a few weeks after the disaster in collaboration with the Hellenic Center for Marine Research. And from the analysis of seawater and sediments, we have found a lot of compounds in the seawater, which is not very common. More than 230 substances detected in seawater. And most of them are pharmaceuticals, metabolites, plant protection products, many plant protection products, industrial chemicals, and of course, surfactants, personal care products, illicit drugs, and coffee and tobacco-related substances, of course, from the disaster, from the destruction of the infrastructure, wastewater treatment plants, and homes and everything. And of course, in the water, the mostly impacted region is Xiria Stream and Volos Port, where sediments show a long-term effect of chemical pollution. Few examples. For instance, losartan was detected. We had the opportunity, of course, to have analysis in the area prior the disaster. So we can compare. For instance, 2022, 2020 versus 2023. And we had, for instance, losartan was only detected in after the disaster, which is very important because sartans in general have high ecotoxicity. We found in seawater cocaine and benzoyl and their major metabolite. And we had in the water phase 18 out of the 24 PFAS that are regulated in EU. And most of them surpassed the annual average environmental quality standards. And we had also the opportunity to have PNIOS samples through over the river and the Lake Karla channel, where we have found also a lot of pesticides that are exceeding the environmental quality standards, regulated PFAS as well, 100 times more than EQS, and 8 veterinary drugs due to the mass deaths of livestock and destruction of livestock units. You understand that these cannot this disaster impacted also groundwater. And we had also samples from groundwater, the area you see, where we have found a lot of pesticides as well, but also metabolites of pharmaceuticals, meaning like, for instance, desmethylcitalopram and O-desmethylvenlafaxine, metabolites of these pharmaceuticals that are human derived pharmaceuticals, also hypertensives, meaning that we have wastewater inputs in the groundwater system from the destruction of wastewater treatment plants or the overflows. And of course, a year later, death fish appeared in Pagasetikos Gulf, which has some impacts after the event. The anoxic seawater conditions developed in the area had this effect, and where we have been able to analyze also chemicals in the fish samples of the area. So these methodologies have been applied in several departments, remote departments, like, for instance, Antarctica or the North North Atlantic ecosystem and Baltic Sea. I will not go into details. We have found impacts of the human activities in Antarctica due to climate change. Remote areas are approached by humans, and humans released pharmaceuticals, personal care products, whatever, in the environment. And I'm skipping this to save some time in Baltic and North Atlantic system to go directly in what is the message today. We have been able to have samples through these European projects like APEX from the European specimen banks. The aim of the project is to have to understand if predators have higher levels of emerging contaminants versus their prey. In this project, we have been able to identify and quantify more than 250 pollutants, micropollutants, most of them pharmaceuticals, industrial chemicals, and of course pesticides and plant protection products, and a major part of them was metabolites. But we know that, for instance, PFOS is biomagnified. Therefore, we have expected that, for instance, in otter samples, we had higher concentrations than their fish, their prey. We had the opportunity to analyze time trend samples from PFAS from Germany and UK, and we have seen a slight decline of PFOS concentrations through these 20 years, but there is a background concentration that will not change in the following years. And from all the classes we have detected, the concentrations of chemicals, micropollutants, is higher in predators than their prey, which means that there are many, many substances, chemicals, that are biomagnified without have been registered like this. This means that we need to change the chemical legislation and be more strict in the chemical industry in order to promote protection of the ecosystem under One Health conditions. And of course, I will skip this. We now run a very important biomonitoring studies at the European level, focusing on the terrestrial environment. We had the opportunity to have more than 500 samples from 6 European countries, analyzing from soil up to predators or the food chain. And one of them is a pan-European study, the owl samples. Per country, we have different species, but there is a one pan-European study focusing on owls. And the first analysis results show that we have a range of chemicals in the species from soil to predators. For instance, these two species of apex predators from Germany, the barn owl and the wolf, the Eurasian wolf, where we have found 53 organic micropollutants. You see the range of industrial chemicals, PFAS, pharmaceuticals, plant protection products, surfactants, and personal care products, and the distribution among them, almost equal, a lot of PFAS, as you see. And it is quite interesting to see the difference between the chemicals in owls versus wolf. In owls, you see a lot of PFAS in the liver, where you find the classical range, linear carboxylic and sulfonic acid PFAS, where in wolves we have found two different classes. Higher abundance of pollutants in owls than wolf, which means that owls are very sensitive to this pollution. And with this, I would like to close my talk. We participate also in PARC. PARC is a huge project of 200 participants, public bodies, aiming at the end of this 7-year study to give to authorities a framework of better chemical management in order to protect public health and the environment at the same time. So with this, I would like to thank you for your attention, and I'm open to questions.
Thank you, Professor Thomaidis. Thank you, Nico, for this very extensive talk on a very important issue like the pollution that you mentioned. Any questions? Yes. We have questions from Mr. Chiotelis.
Good morning, Professor. Thank you for your fruitful presentation. Indeed, very interesting, all the data that you presented. I would like to ask if you're aware or if there are any published researches that are relating the fertility of human beings. I mean, the
Yes.
number of spermatozoons affected by the pollution of chemicals in recent
Yes.
years. Thank you.
Yes, there are evidence, there are published results that are correlating reduced sperm and infertility with PFAS, for instance. And there is evidence that PFAS also are correlated with polyovarian syndrome, and definitely what we are calling as endocrine disrupting substances, which includes also several synthetic phenolic compounds, are related to infertility. Those classes, PFAS and endocrine disrupting compounds, are also focus of PARC project in order to determine how much these class substances are affecting human health.
Thank you. Any other questions? Nico, I'm just going to ask you your opinion about the role of sewage epidemiology in One Health issues. How can it play a role on that?
Yes. Sewage epidemiology is a tool that has been, used for more than 20 years for several public health issues, including chemicals, not only microbial or biological parameters, and it is established during COVID pandemic. Sewage monitoring is very important because it is very cheap and gives real-time evidence of human exposure. There are biomarkers that we can monitor from wastewater samples in order to see the exposure of the population to several chemicals, not only biological parameters. Therefore, I believe that wastewater-based epidemiology will be a complementary approach to the human biomonitoring studies, which are, of course, more accurate but more expensive, and they have, of course, intervention to humans.
Thank you very much. Any other questions? No? I think we are okay. Thank you, Professor Nikolorethomidis. Thank you again for your participation.
Thank you very much, Professor Vandarakis, for the invitation.
Thank you. Now we have our surprise. We have invited our experimental lower secondary school, and we have the students here. They are going to discuss about climate crisis with their own way. I would like, first of all, to thank Ioannis Chiotelis, the principal of the school, and of course, Konstantina Marazioti, the biologist. I'm really grateful to you for our
All right, I'm happy to welcome you all back after inspiring talk by the youngest members of our community to the next session. My name, unlike written in the program, is Uli Klümper. I've replaced Yannick. I'm from the Technical University of Dresden. You might have listened to my talk yesterday. And it's my great pleasure to host this session. And as first speaker, I'd like to introduce Emanuela Magriplis, who is an associate professor in nutritional epidemiology and public health at the Agricultural University of Greece in Athens. Well, all right, stage is yours.
Thank you very much. I'm very happy to be here, and thank you for the invitation in this very important conference, and challenging as well on how to bridge all the science and all the information on all disciplines in order to achieve One Health at the end. I find that my task today, as I was discussing during the break, is quite challenging because it's putting different areas and integrated in order to provide a main concept on how nutrition fits into the whole thing when it comes to climate change and how it impacts it all. Therefore, if we see that from the little circles where we have the climate in the middle, nutrition, health, and agriculture, these kind of coincide and one goes into the other. And therefore, although we face a convergence of crisis, okay, where we have the climate distress, we need to realize that this is not on its own. It also affects nutritional distress as well. So it actually increases further the crisis that we see today. We tend to think about nutrition and malnutrition completely different to what it is when it comes to the climate change. So I will first have just a small parenthesis to open, because malnutrition is not only undernourishment, it's also the overnutrition, therefore exceeding the amount that we require. But we tend to forget one concept that is shown in this specific slide when it comes to the hidden hunger. Hidden hunger is nothing else than having nutritional deficiency, therefore less vitamins and micronutrients overall, despite the amount of energy that we're consuming. So therefore we can have enough energy in our diet, therefore calories, or even overexceed and therefore have overweight and obesity, but still lack nutrients. And why am I defining this? Because you'll see that with a climate change, this can actually get even worse, okay? So therefore, you see that we have 2 billion people that are afflicted by micronutrient deficiency globally. Therefore, we're talking about the hidden hunger, irrespective of the under or overnutrition. And there's 17% of global population that lacks specifically in zinc. Why is this very important? Because this is one of the nutrients that you'll see that is affected by the climate change. And it also is a leading and severe development in the immune system as well. And not only the immune system, but also fertility, and even how insulin acts in our body. So therefore, it's a specific and very important nutrient as well. So we should not only be failing to meet the current nutritional needs, but it also has climate stress, is also actively therefore degrading the nutrition quality further of our food. I also want to present you with the information that we have. You see as you see it from the left-hand side, we have the actual undernourishment. The darker you see the map, the higher the undernutrition that has been found in the specific areas globally. On the other map, it's the food insecurity, how people feel. And even if they're well nourished at this point, how do they feel they will be in the future? Therefore, it's the food insecurity that is increasing, despite the fact that there's not as much as undernutrition. Especially when it comes to North America and South America, you'll see that although we don't see North America, a lot of undernutrition, we do have large amounts of food insecurity. Let's see what happens specifically in our Mediterranean region at this point, where we have the Europe's climate nutrition frontier and frontline. We have the Mediterranean diet, which is the birthplace, of course, of the Mediterranean area, which is one of the healthiest diets that we find. Okay? And everything, when we relate to nutrition and health, we talk about following a Mediterranean diet. It's high in fruits, vegetables, whole wheat products, and of course, pulses. At this point, we have the diet is a climate hotspot, and this providing a real-time view of the direct pathway where we have climate, food, nutrition, and health. Why? We have a 20% faster warming rate compared to global average in the Mediterranean area in Europe. And in Europe, we have a higher temperature, 2.2 degrees increase compared to 1.3 degrees increase globally. Simultaneously, we see that this has affected agricultural productivity by 7 to 9%, especially in Southern Europe. And overall, we also have a 50% increase in extreme weather events affecting the crops further over the past decade as we see it. And as Professor Thomaidis also said, where we had very intense climate areas like the Daniel, the flood. So we have from extreme weather to routine disruption, we have droughts, we have prolonged water scarcity in Spain, Italy, and Greece. As well, we also have the flooding and the storms. So from the one hand side, we have the droughts, and the other we have floods. So an extreme amount of rain pouring altogether, where the ground cannot maintain it. Okay? We have the heat waves, where we have high livestock mortality, and we see it very much in a high rate here in Greece at this point, especially in Thessaly, not only during the flood and during the event, but afterwards because of all the sickness that has evolved as well. And I'm leaving the example at the end where you'll see specifically that in Italy, there's a breadbasket experience, which I will follow right after with a specific slide. Where we have is the key statistics where olive oil production variability in Greece is plus minus 40% from one year to the next. There's an adherence to the Mediterranean diet that has declined by 25%, and it's not only because we're not preferring the specific types, but we'll see the areas and the barriers that are actually, it's not only if I want to have it, but what decreases the probability that I will actually consume it as well. And of course, the fresh vegetable consumption is also decreased by 15%. So let's go see. No more risotto. I found this. This is not my idea. This is not my slide, but it was very interesting. This is what happened in Italy, where we know that Italy produced about 50% of the Europe's rice. In 2022, with a worse drought that was seen there, the past 200 years, this caused a reduction in the productivity of rice by 30%. Right away, you understand that not only do we not have the amount to eat, we have to find it from elsewhere, and also this increases the prices as well. Therefore, we need to be comprehensive and see the different areas that can affect the whole area of our nutrition, where and how the climate and the climate change at this point actually influences it as well. So we have food production system that we need to talk about, and we need to consider the food systems-based livelihoods, the supply chain distribution, food quality and safety, lower nutrient content of the crops, and I will give you a specific example when it comes to this as well, and of course, changing the disease and health environment. All the health crisis that is out there, it has to do with our environment as well. Not only I'm sure you have heard about the obesogenic environment because of all the weight increase at the last years. Now we're also talking about that morbidogenic environment as well, where that means an environment that increases morbidity also. There are 4 pillars to food security, and these are cracking under the climate stress. We have availability, access, utilization, and stability that we need to consider at all points. Therefore, when it comes to access, the price volatility and the inflation are also affected. When it comes to utilization, the core of our new understanding is the nutritional value that is declining. And this is where I want a little bit to take time to introduce to you as well. This is the pathway from climate stress to cellular health. Therefore, we have CO2 production and use from the fertilizers as well, excessive. The soil degradation and altered plant physiology, which is the consequence, and of course, the nutrient dilution, and this affects the human health when it comes to NCDs, impaired immunity, like we were saying, increased stunting, which is the chronic malnutrition in children, and of course, mental health diseases that our students actually also introduced to us earlier today, right before the break. So how does this, and what do we consider? We have, for decades, we thought that the primary concern was in order to have consume enough energy. Today, we see that we also need to assess the new pathogens, the altered plant physiology, hidden hunger, and food safety risks, because we have a displacement effect with the new information and with the new climate issues that we see today. So therefore, the great nutrient collapse is with a more CO2 that is produced, and this is just one area. We have to consider more, but I'm just giving you one example at this point, is making our food even emptier, less of a quality. Why? Because although we have a greater photosynthesis amount and therefore more carbohydrates and therefore more sugars that are produced in some plants, we have a decreased amount of protein between 6 to 14%, depending on the type and the amount of CO2. A decrease in zinc concentration by 3 to 10%, and also iron decreases from 5 to 8% as well. So this is the CO2 paradox. Although it increases photosynthesis and carbs, it decreases other nutritional value, and therefore further triggering more micronutrient deficiencies. And with the CO2-driven projections by 2050 is 175 million new people will become deficient by then. 122 million new people will be at risk for protein deficiency as well. And so therefore, this is the map distribution. This is an example for the human impact where stunting, immune depression, like we said, and severe maternal health risks and premature births as well will be also affected. Therefore, we know the double burden, but now we need to consider how this is affected also by the climate drives. What is a double burden is what we eat, and we need to consider vitamins and minerals into the undernutrition, micronutrient deficiency, and the overnutrition, where we have the excess calories coming from UPF, not only because these are widely accessible, but because we also have the other fruits and vegetables that are not widely accessible, and of course, they're more expensive as well. And they also tend to lack more nutrients. Therefore, a lot of information that we need to consider when we're actually analyzing all the information out there. So, this is a small summary of everything I already introduced to you at this point. Therefore, we have the climate shocks, crop failures, household economic stress, and the shift to cheaper, shelf-stable, and UPFs, ultra-processed foods, that is very in at this point, and it's widely researched as well. And of course, the coexistence of undernutrition with overnutrition. Is this all though? Of course not. It doesn't stop there. Other than the nutritional aspect, we also have, with the climate change and the increase of temperature, crops tend to increase their content in aflatoxins. Therefore, we have other growths and mycotoxins, aflatoxins, staple crops like maize and groundnuts. And therefore, these are not only less accessible and higher price, they're actually lack in food safety as well. Therefore, another area that we need to take into account. And this just shows you an example of, presently we have 38.2 with a present temperature. If this temperature increases by 2 degrees more, the concentration will pretty much double, and then by 5 degrees, it further increases. Not a complete linear trend in actually doubling the effect, but it's there, and it constantly increases, and this is something we need to take into account. An infographic that pretty much summarizes everything we just went through, where we have the forefront attack on our food, availability is shrinking, access is harder, utilization is compromised, and of course, stability is failing as well. So we have our dish that has to have fruits and vegetables and pulses. Therefore, we're talking about a sustainable diet that is plant-based. But our plants are quite lacking their quality at this point, and they're not as accessible. So we have a desertification effect of our actual plate as well. Okay? So we have the hidden health crisis, where we have a great nutrient collapse that is increasing, and the probability is increasing as the temperature is rising and the other extreme events in the climate are occurring, the rise of hidden hunger as well, and the double burden, where the hotspot is the Mediterranean area, where these all vegetables, fruits are actually prevailing and were being cultivated at large. Building, therefore, climate resilience is important. Nutrition food systems is an important area that we need to target. This is where One Health comes into play in this area as well, where we have the environmental health, the animal health, and the human health in order to consider the One Health effect. And you see, we cannot see them separately. We need to integrate them. And everybody from all the multi-areas and the knowledge and the scientists need to discuss together and not just focusing on their own area. And we should not forget the food biodiversity, because the more maize or the more cotton that we only cultivate because of the extreme climate distress, this just leads to a decrease of biodiversity further, and therefore less nutrients as well, of course, out there, other than the other things that we discussed. So strategies for mitigation and adaptation, just for an example, there's on the farm on the adaptation and on the plate mitigation. So we have developing and deploying biofortified crops and new heat-tolerant varieties that are being looked into, and also fostering robustness, adaptability, and transformability in farming systems to withstand shocks. And of course, aflatoxin and other mycotoxin production. On the plate, we need promoting the planetary health diet, therefore sustainable, plant-based, but in a way that it doesn't have an extreme processing amount, because that leads also to food waste. So we should not be forgetting that part as well. Adaptation reduces global calorie losses, but substantial residual losses remain for most staples, and these should be taken into account. And this underscores that adaptation is crucial but insufficient on its own. So therefore, we look at a multi-sectoral framework, agriculture, health, and environment, like we said earlier, align these efforts with European Green Deal and the farm-to-fork strategy also, in order to develop early warning systems that link climate indicators directly to nutritional outcomes. So therefore, we do need robust longitudinal European data harmonized between one another in order to be compared as well, and to have an integrated nutrition security plan in total. Policy are important. We need the policies. We need the political systems out there in order to be there, and a professional mandate. Nutritionists must become also climate advocates. We need to know that we don't need to learn everything, but we need to be aware that this also affects it. This is why I'm saying climate advocate. And we cannot just treat malnutrition without addressing its environmental drivers, just like we cannot just treat obesity without thinking of the micronutrient deficiencies and a holistic approach to health. Thank you.
Thank you for an inspiring talk. Do we have any questions in the audience? Yes, please, up there.
Thank you for your talk. I'm not an expert on this, but I do find it definitely super interesting. It's maybe a bit of a general or vague question, but I'm coming from Spain. We have huge avocado farming, which is, of course, having its ecological consequences and impacts. But it's also a bit part of this alternative to try to culture things that might adapt to the future climate scenarios. So what would be your suggestion when it comes to this food cropping in our regions to adapt to the new climate, to insist on what we already culture? Yeah, thanks.
Thank you for the question. I'm not in food science, but this area has to do with my nutrition background in public health as well. So I will respond from a very important area that usually I was debating on how to go about the specific topic, because I had various areas in order to choose from. I selected the more controversial and the less at risk, let's say. When it comes to the avocados, and exactly this is an important area, why are we supposed to be having, when we talk about sustainable diet and plant-based, doesn't mean we should be over-consuming everything that is healthy and that actually needs a lot of water in order to be cultivated, just like the avocados. And therefore, these are not sustainable to the climate change, and especially in areas that we're not supposed to be cultivating. So therefore, this decreases biodiversity even further. So decreased production on the foods that we don't actually need to cultivate, and increase those that are more suitable to our areas would be my opinion without, okay, because I'm not a plant scientist. But when it comes to my nutrition field, we should not be over-consuming overall. And this is where I said that it's not enough just having sustainable diets in terms of plant-based, but the amount that we eat has to be balanced as well. Therefore, all this, and not as processed. Therefore, all this almond milk and the walnut milks and all the new patties that are coming up, all these have more processing, more waste, require more amount, and therefore further decreasing or further requiring more crop production, and therefore leading to a vicious cycle. Okay? I don't know if that was a question, but...
Thank you. Do we have any other questions in the audience? Yes, over there, please.
Thank you very much for your speech. It was amazing. Thank you. I want to ask you, as vet, because we know we have a big epidemic in Greece with the sheep, as you know. Is there any strategy? Because a lot of animals are killed right now. So how we can solve this problem?
I'm not a vet, so I cannot say, I'm not going to give my opinion, but I'm going to use the excellent response that we heard from our students earlier. The skill that we require is to learn to follow the instructions. And therefore, there are specific instructions. That was the best response that I've heard. So therefore, there are instructions that are out there. Supposedly, they're clear, and that the owners that have the animals should be following, but they're not, and therefore further leading to the vicious cycle of having the illness, therefore the contamination being spread. Because they're actually, but when it comes to, this is where we need, though, a clear political statement and a clear legislation, and for the ownership in this case, because the other area that is not clear, as you say, is whether we should be using the antibiotics or if we should be using immunization at this point or not. So therefore, they're still debating. So
we will need your help in that case. Thank you.
Pressure is from your side.
Thank you. Maybe I can ask you also one final question. So with regards to these nutrient deficiencies inside of the plants, I mean, climate change is not going to go away. CO2 is not going to go away short term. So what are things we can actually do so that the plants take up more of the nutrients? Because I could easily see certain people arguing for, oh, you want zinc? Eat more meat. And that's probably not the way we should go.
You can get it from fish as well, but no, that's not the way. And I'm not even going to go to the water effects there. When it comes to increasing and decreasing the nutrient loss, there's actually, I didn't go into it because of the time issue, the biofortification. So not fortifying afterwards, but fortifying during the cultivation. And they're looking at the gene expression as well. So therefore looking into epigenetics. And there are areas that they want, because overall with the farm to fork and the Green Deal, the decrease in the pesticide use, in order to increase production, they need to have plants that are a lot more sustainable and they're not as affected easily. And therefore, they're looking into various schemes. But this is, again, question, because a lot of reactions would be, yes, but you're looking at the genes and therefore you're changing the genetic there's going to be a genetic modification. Therefore, are we talking about GMOs? But is that bad? I'm just going to leave it as a question mark there.
Okay, thank you. Then let's all thank Emmanuel again. And then I am happy to introduce the second speaker of today's session, which is Professor Ioannis Kloutsiokis from the Laboratory of Atmospheric Physics at the University of Patras here. All right, stage is yours.
This one. Okay. Perfect. I'm Yannis Pitsouki, as I said, professor at the physics department at the University of Patras. My research focuses on weather prediction and predictability of systems coupled to weather and climate. And today I will present an early warning system that we have developed for the prediction of West Nile virus human cases at seasonal scale. So let's start with the climate impact on vector-borne diseases. Vector-borne diseases are climate-dependent, and climate can affect both the transmission dynamics and the geographical spread of vector-borne diseases through multiple pathways, being direct as directly affecting the vector, the pathogen, or the host, as well as indirect processes affecting, for example, the habitat suitability, changes in land use. For the most important vector-borne diseases that are of viral origin, namely chikungunya, dengue, tick-borne encephalitis, and West Nile virus, we observe that this is a report from European Environmental Agency that it's the climatic factors mostly are temperature, heat waves, rainfall, but also droughts. So we see that climate affects vector-borne diseases in a rather non-linear way, and this is something that we would like to explore here. I think in this conference, I will not say anything about One Health, just mention that West Nile virus is an ideal example where the One Health perspective is essential. And I move forward to the next slide. What is the concept behind the work here? Okay, this work has been inspired by the work that has been done in the recent decades, the progress that has been done in the recent decades in the area of meteorology, specifically in numerical weather prediction. I'll make a parenthesis in the next slide. Those are some papers which were published during the pandemic saying that can we use the suite of tools and all the methodology that is around weather prediction, can we move this into epidemics and make more precise and accurate predictions? This is what I would like to show here today. Now, let's start. Let me say only a few things about numerical weather prediction facts. Meteorology was established as, we say, as a scientific field in 1904. Why? Because at that time we have the closed set of equations that controlling the atmospheric evolution. It took around 50 years to have the first successful numerical weather prediction in a computer. And at that time, the weather services started to establish at country scale. 13 years later, 1963, an atmospheric scientist, Lawrence, came out with a butterfly effect, how sensitive those predictions are to the uncertainty of the initial conditions. This was not considered at all in the operational forecasting, this discovery. Until we will see now a forecast in 1987. This is from BBC. This is official, so I will... Oh, there is no sound. I guess sound should be... Okay, I'll continue without the sound. Just what this operational forecaster said. He's saying that maybe you hear that a hurricane is on the way. Don't worry, go out. It will be a little windy, but nothing more than that. The day after, we see in the newspapers that there was a terrible hurricane and there were 13 people who were dead. So then the approach that of sensitive dependence on initial conditions, 5 years later, in 1992, this was integrated in the forecasting concept. This happened in 1992. The last 50 years, we say that we have a quiet revolution in numerical weather prediction in the sense that we are gaining one forecast day every decade. The accuracy that we had, weather forecast 3 days, weather forecasts in the 80s, is the same that we have 5 days forecast in the 90s, the same accuracy that we have 3 days, I said, in the 80s, 4 days in the 90s, 5 days in 2000. Which are the major steps affecting the predictive skill? First of all, there is a degree of representation of basic physics in the models. Okay, as new knowledge come in, this is integrated in the models, thanks, of course, to the computer power. Then there is ensemble modeling, which considers these issues coming from butterfly effect and its model initialization, which is very important. Every day, we have more than 20 million records to initialize our models. 20 million records. Okay, that's as a number to compare this with epidemiological prediction. Then, in the recent years, we have also the digital and AI revolution of Earth system modeling, increasing further the forecast skill. So this is the concept. Here I will say that I would like to transfer this concept into epidemiological prediction, into West Nile virus prediction. I mean, use a dynamic model in a probabilistic framework together with some AI and statistical models. I must say that this approach was awarded the first prize from European Innovation Council in the field early warning for epidemics, where University of Patras was one of the core partners responsible for dynamical modeling. Now, before presenting the early warning system, I would like to go through some studies underpinning this work. So I will start first. We will look at the data, and then we'll develop the mechanistic model, and then the early warning system, and see how far we can go. So some West Nile virus facts in Greece. We had the first detected human cases in 2010. In 2010, and most of them are found in the region of Central Macedonia in the north, followed by a region of Thessaly just below. You can see that there is a very high year-to-year variability in the number of human cases. And moreover, there are some years, for example, 14 to 17, that there was 0 human cases detected. If we see the map here, from 2010 until today, and on the left we have the years with observed cases. There are around 150 municipalities without any case detected during this period. This is half of Greece. Okay, so in half of the municipalities we have human cases detected, in half we have not. In which areas mostly? On the right chart, we calculated the West Nile virus human cases per 100,000 people. And we see that most of them are found in the north, as we said before, region of Central Macedonia and Thessaly. So we'll focus here on those areas because we have a lot of data there. Now, I start with some, with some clustering and see which are the hotspot areas. On the left chart, we have the mosquito abundance. On the middle chart, we have an indicator of infected mosquitoes, and on the right one, we have the human cases per 100,000 people. If we do a spatial autocorrelation chart, we see that what you see in red are all the municipalities that are spatially autocorrelated with all their surroundings, with all their neighbors. What is the core? Which is the municipality that is found in everywhere in all three charts? It's a central one. It's the municipality of Alexandria, which is mostly covered by drainage channels, rice fields, irrigated land, and on top of that, there are inland wetlands. So have the perfect habitats for mosquitoes to develop. Also, we have the habitat for the spillover of the virus between mosquitoes and birds. Now, next question is how much variability can be explained by climatic variables and which climatic variables. So we built models for each of the three variables. Just to go quickly through the results, we see that, for example, we focus on West Nile virus human cases. We see that temperature of May and summer are associated with more West Nile virus human cases. One, to keep one finding so far. What else? We cannot account for more than 40 to 50% of West Nile's variability by only relying on climatic factors. The numbers you see in parentheses are the explained variability due only to climatic factors. Okay, it's 40% for West Nile virus human cases that can go up to 53% if we also incorporate the severity of human cases in the previous year. Okay, so having seen what data tells us, we move to the development of a causal model. Okay, the mechanistic models integrate the biological and the environmental processes to simulate the dynamics, and they integrate all the available knowledge as we also do in meteorology by developing numerical weather prediction models. Those are called compartmental models because there are, for example, you see the first four are define the health state of mosquitoes. It's larvae, it's mosquitoes, it's exposed and infected mosquitoes. Then there are similar stages for birds, and in the last row we have states for humans. Birth rate on top left, birth rate of larvae and mosquitoes are temperature dependent. Mortality rate of larvae mosquitoes temperature dependent. Biting rate bottom left is temperature dependent. You see, when there is, with increasing temperatures, unlike humans, mosquitoes eat more. The incubation period decreases as a function of temperature. The development of the virus takes less time at higher temperatures. So, as we saw at the beginning, it's a highly non-linear situation that we have to plug in the model and see what will come out. We start first with a global sensitivity analysis framework where we would like to see in this model that there are more than 25 unknown parameters which controls the variability of the output. Considering that the output is the R0, the number of secondary infections. In the left chart, we see that most of this variability of the peak R0 at annual scale is controlled by the birth and mortality rate of mosquitoes. If we change this into a time-dependent sensitivity analysis, we see that on the right chart that those parameters are important until roughly end of July. And then this you see the blue and the right, and then there are two other parameters that become more important, being the biting rate and the transmission probability from birds to mosquitoes. Okay. I continue. So at the first stage, the parameters related to the growth rate of mosquitoes, the birth and mortality rate are more important, while biting rate or transmission probability from birds to mosquitoes are more important afterwards. Here is just a simple sensitivity study where we saw the differences in temperatures, how much they impact the severity of infected humans. We just see that there is roughly a 25% increase in infected humans per degree, together with an anticipation of the peak timing by 1 week. Everything comes earlier because the development of mosquitoes and the virus go faster. Now, we move on now to making this model from box model to make it in 2 dimensions and have predictions at local scale. The question is, can we model West Nile virus dynamics locally using such a model? Here it's modeling, it's not prediction. We just try to calibrate the model in historical data. Yes, we try to make a very we made a very good match by bringing, in this, there is a huge database behind this with environmental factors, demographic factors, factors for mosquitoes, for birds, etc. So the first approach was successful, and we used this model then to make a sensitivity study to see how do monthly temperature anomalies affect West Nile virus spread. You remember, using the statistical model, we saw that temperature of May and summer are very, very important for the West Nile virus that we will expect during the season. Here, we use another model, another approach. It's not data-driven. Now it's causal-driven. It's totally independent to the previous one. We end up, you see, all the combinations of temperature anomalies that impact the severity of infected humans. You can see that number 5, the month number 5, May is almost everywhere, plus most of them it's May and summer months. So we reach the same conclusion in a totally different way. This model is being continuously, it's developed on a continuous basis. We achieved even better results with including some processes inside, like temperature-dependent transmission. In the first model, that was fixed. Host selection, whether the mosquito prefers to bite, doesn't bite at the same frequency, birds, humans, etc., plus some other functions on the right that are relating to the overwintering of mosquitoes. Okay, so having developed a model, a causal model that has been calibrated in historical simulations, now what is the next step? To use this model to make predictions. We plug this model into an uncertainty framework, and we have to run the model in an ensemble way, meaning that we'll fit the model with different number of, we have to deal with climatological uncertainty. Okay. On top of that, we have also to deal with epidemiological uncertainty. So to have the same framework that we use in numerical weather prediction. And here is a very crucial point related to numerical weather prediction. because there we have all the data we need to make this, to initialize our model are there. Here, when we start this simulation in April or in May, there is no way that we know the initial epidemiological conditions. There's no. The data, the virus load inside birds or mosquitoes cannot be detected. So somehow we have to infer this information from other models, including, as I said, the last one, there are persistence models, analogs, AI models, combinations, etc. Then we translate this probability distribution to risk levels, and to use here, since there is an ensemble, there are multiple simulations, we translate these probabilities into risk levels. And we have the different, from risk level 1 means that in less than 20% of the simulations, we had a West Nile virus occurring in our system, while in risk level 4 or 5, at least 60 or 80% of the simulations show a human case, West Nile virus human case. We use this mapping to be somehow in line with the ECDC mapping, where the main difference with the ECDC mapping is that this one is diagnostic. It becomes 5 when there is 1 human case in an area. Okay, it becomes 4 when there is an infected horse. It becomes 3 when there is an infected human. So it gradually goes from 1, there is habitat suitability, to 2 if there were cases the previous year, 3 if there is an infected mosquito, infected horse, and infected human. Okay, for validation metrics, it's just I would say the critical success index. It measures how many hits do you have, how many times you were successful in predicting the hits, but also it takes into account the false alarms and the misses. Okay, so those are results from average results from 2020 to 2024 in the region of, as I said at the beginning, of Central Macedonia and Thessaly. The top chart is the prediction in April. And the corresponding skill, the average corresponding skill, that is CSI 056 in Central Macedonia, 042 in Thessaly, and they improve in August. Why? Why they improve? Because of the assimilation of surveillance data. Okay, I think maybe I'll skip this. Just the figures on the left just show how the skill is related to the risk levels that we have defined. For example, here, the last column is the skill of risk level 5. The column before is the risk of the skill of risk level 4 and 5 together, etc. You see that even risk level 1 has high skill score, but of course it becomes optimal as it should be for risk level 4 and 5. One thing that we should also mention here is, for example, you see in 2021 was a bad without predictive skill in Central Macedonia. It was before, it was around 0.2 up to 0.4. And other bad years in Thessaly was the year 2020, where actually there was no cases, just very few cases. Okay, those just see. So in the previous slide, we had whether we can capture the event. Here we present whether we capture the event at the right severity. whether the number of human cases, just you can see, compared with what I showed you, I just told you that in 2021, we didn't, the severity in Central Macedonia was not very large in the model, and similarly in 2020 for region of Thessaly. For the other years, it was very good, as presented earlier. I think I'll pass this also, and just a couple of slides before I conclude. This is the skill, let's say skill. This is surveillance map. Okay, surveillance. There are mosquitoes that are collected and tested whether they are infected or not. Green areas means that we had infected mosquitoes detected and infected humans also reported in the same municipality. The purple are the false alarms. We had infected mosquitoes, but without human cases reported that year. Red ones are the misses. We had no infected mosquito was found, but infected humans were reported in that municipality. The white are the true negatives, and the pink areas without surveillance. You see that there are some years where false alarms are very high in this model. So something with either with surveillance or with the virus circulation, something is strange. 2021 is such an example. But you can say 2021 was a summer after COVID, so maybe the tests for whether someone died from West Nile virus were not considered at that time. 2025 is another example. Something also was very strange in 2025. This is my last before the conclusions. This is the skill of the early warning system in April and May, and the skill of the surveillance, assuming that we have a model, surveillance model, in the sense that if I have an infected mosquito, then an infected human will appear after 2 or 3 weeks. The main difference between those two is that the model is available in April, the surveillance is available at the end of the season, in September. What do we see? We see that the model does very well, and better than the surveillance in 22, 23, 24. 25, the model predictions were very bad. The climatic conditions showed that there should be a lot of cases. We didn't have a lot of cases. We had it in different municipalities, but the same was also true for the surveillance, for the field data. They couldn't find something, they couldn't make it better. So this clearly shows that the early warning system is well calibrated for this area that I present, and there is something that is still missing regarding surveillance. So the conclusions are developing a model in following a parallel from meteorology for epidemics is something that works. It's something that has predictive ability, and as I presented through those slides. What are the challenges and the gaps that I would like to highlight? First of all, some knowledge gaps related to vector ecology and behavior pathogen vector-host interactions, climate extremes and land use changes, maybe some regimes, or, for example, we find in literature that temperature is expected to increase the number of infected humans because for West Nile virus, because it makes the development of the virus faster, etc. But at the other time, we found some recent publications that extreme temperature affects the fecundity of mosquitoes and these mosquitoes, also the size of the mosquitoes which do not hold the viral load in those mosquitoes is very low. So there are gaps of specifically of biological origin there. Next challenge is the models to be validated correctly. We should have a large data set of high quality and long-term data for vector abundance and for disease. So far, epidemiological data and homological data are, at least until the recent years, they were very, very close to certain groups. Now it seems that they are starting to become more open. And the last one has to do with models. So we have to move towards a seamless integration of validated models acting at different time scales, at different spatial scales, to develop something that is as accurate as possible and inform public health systems. So this, of course, this work is not, I would like to acknowledge also all the colleagues that contributed here, Nikos Stylianakis and the group from JRC, Anastasia Angelou, Areti Papa, Nikos Kolas from my lab, the core partners of the EWA Prize, and I would like then some here to stop with my inspiration during my scientific career, a quote from Richard Feynman, the Nobel Prize winner of physics, that, the way to understand, the way to test whether we know something is to see whether we can make predictions. Thank you very much.
Thank you for that talk. Really liked it, especially since I'm always hunted by the mosquitoes. So do we have any questions from the audience? Yes, up there.
Hello, I'm from Department of Public Health, Western region. There was a difference between the colons in chronic time in years that we got infections in mosquitoes, but we don't have infections in people in population. Mm-hmm. This is maybe because when you're affected by Nile virus, you have developed a long-term immunity that can last for some times. So we see that the difference is between this. Another parameters is that a lot of people may be infected by Nile virus, but will have subclinic manifestation. So we don't know how many people are infected. So we don't know about the immunity in the population. But we may know the people with underlying medical condition, chronic condition, that may cause mortality or morbidity. And especially we know about young people and old people and pregnant women that we know that they have low immunity. So these people can be affected or have an increased mortality or morbidity. So this can be parameters that can, in the future, see how many people can be affected by Nile virus.
Okay,
that's it.
Thank you. There are many processes that we can still add in the model. So this, the immunity and the immunity as a function of the age or the health state is one of them. The vertical transmission from vectors is another. There are many, and thank you very much for pointing out.
So we had another question down there.
Thanks for the presentation. I'm just curious, as you have this influx of data from the municipalities, as I understood, do you provide this resulting data from these prediction models back to the municipalities so they can have a pre-partner strategy? And
Yes.
so,
Yes. Actually, it's not a theoretical study. We submit on a monthly basis those forecasts in 7 regions in Europe to the local governors. Now, if you ask me what happens afterwards, this is something that this is something that I don't know. This information doesn't come back. I guess that the mosquito control companies are activated, or some messages for the elderly to don't have water pools around their homes and things like that.
I'm asking because we have this mosquito alert project. I don't know if you know about it, but it actually started spreading all over Europe. That it's using also citizen science to massify a bit, the collection of this data, and they do work directly with the governments or like local governments in that sense, and then they do also follow up what the strategy and the adequacy of the strategies are later on. So I was curious to know your case. Thanks.
Thank you very much.
Okay, then let's thank Yannis once more for his talk, and we move on to the next speaker. So I believe the next speaker will be online. It's Michalis Koureas from the University of Thessaly in Greece. He's an environmental engineer, and I hope that you are online now. Can you hear me?
Hear me? Can you see me? Can you see my screen?
I can see you, and I can see your screen, and now it's also in presentation mode. Perfect. Stage is yours. Please go ahead.
Okay, thank you very much for the introduction. I'd like to also thank the organizing committee for the invitation. And allow me to say that I'm also happy that after some years I also see Professor Koutsoukas and his differential equation systems. We had a little bit of collaboration in the past, so hi Yannis. And from the field of communicable diseases, vector-borne diseases, I will pass to non-communicable diseases and adverse outcomes, particularly focusing on the effects of heat and climate change on pregnant women, fetuses, and newborns. So mainly I will present you today some results from analysis of Greek data that were conducted through our participations from the University of Thessaly to a large European, not only consortium, the High Horizon project, but I will also show you some results and outcomes from the collaborative work on this field. So, very quickly, I should say that climate change was practically, and the climate scientists will tell you that was practically never in doubt. It is known that Earth's climate is changing from millions of years. A smaller debate was whether this recent increase in temperature is of human origin or if it is a natural process. And although there was a small proportion of scientists that were pro to these claims, it seems that the issue is finally being resolved and concluding that the human derived climate change should not be addressed as a hypothesis, but as an established fact. And there are many evidence for this. The CO2 from human activities is about 250 times faster than natural resources, and the rate of temperature change during the past decade is 10 times greater than a natural increase after a natural warming after an ice age period. So having this in mind, evidence are mounting that the effects of climate change span through all the stages of life, including the beginning of life, the fetus, the infant phase, the adult phase, and of course there are many evidence documenting effects on the elderly. Like I said, the presentation today is about pregnant women and fetuses. And again, there are many recent studies that address and investigate the adverse effects of heat exposure to fetal and maternal and neonatal health. This is a summary of a very comprehensive study that is reviewing reviews practically. And there are solid evidence about hypertensive disorders, gestational diabetes, many studies on preterm birth, on stillbirths, on low birth weight, hospital admissions, and even mortality of newborns. So evidence are mounting. I will, like I said, present you some unpublished yet results from Greece, because data from Greece are fewer regarding this particular hypothesis. So what we did within our participation to the High Horizon process was to conduct a retrospective analysis on all births in Greece from 1999 to 2021. So gathering a data set of approximately 2.3 million births, and merging this data from birth certificates that were provided by the Hellenic Statistical Authority to temperature and climate indicators derived from the European Center of Medium Range Weather Forecast. What we needed to solve, this is fairly technical, so I won't insist much in this, but we needed to assign heat indices, temperature and other heat indices to particular individuals, and which was achieved by the place of residence, and we needed to transform ERA 5 land and then ERA 5 data to specific municipalities, and then assign the all the heat indices to particular individuals. And once the dataset was complete, we followed two statistical approaches. The one focuses on the exposure during the last week before delivery. So it's 0 to 6 days before delivery. We examined the effects of this period to each adverse birth outcome. It was a time-stratified case crossover study where the controls are artificially derived by moving the case in time and acquiring the corresponding climate conditions of this time. and a conditional logistic regression was made in combination with distributed lag nonlinear models, because as you will see, we need nonlinear models because we have nonlinear relationships, and we expect nonlinear relationships in this context. So this was the first approach. The second approach, which we call the long-term study, because we investigate exposure at longer periods, in particular trimesters, and the Cox proportional hazard approach was followed, where the exposure was the mean values of temperature or other bioclimatic heat stress indicators, the average exposure during the first, the second, and the third trimester. And again, this was conducted in a nonlinear context. Some descriptives at first. This is the preterm birth rates geographically demonstrated in Greece. We can see some clusters with higher preterm births. We cannot directly assign them yet to heat, because preterm births and adverse outcomes have an etiology that includes many factors, and a small fraction, a small proportion of these risks may attribute it to heat. But what we can clearly say about these adverse effects is that they have a seasonal pattern. So, okay. We can see here that the preterm birth rates, and this is the same for other outcomes as well, rise sharply from May until June and remains high in the summer months. And if we examine the autocorrelations throughout the time series, we can see a clear seasonal patterns. Every 12 months, the association is becoming significant. So this can be linked to climate. Of course, from May to July, the temperatures are warmer, but there are some questions that arise maybe automatically if we examine closely this graph, and it is my first question is, okay, we have a rise in hotter months, but why is it falling on August, which is as hot as July? And there are some hypotheses here that it is not only the absolute value of the temperature or of heat exposure, but also the rate of change, how fast are temperatures risings that may be related to the adverse effects. And as you can see here, the rate of change is strongly correlated with the rate of change in the outcome during spring, also in summer, but a little bit less. And of course, the relationship is inversed in fall and winter. Okay, so this is the main results, the graph on the left, when we can see a U-shaped exposure effect relationships in the high temperatures. The odds ratio can translate it as a risk, the danger of giving preterm birth is rising, and it seems that it is rising in a non-linear way, meaning that at high temperatures the effect is larger, but also we see also an adverse effect in lower temperatures. What we see in the right is the difference in maximum, minimum, and mean temperatures within a day. So you can see three curves. and the minimum temperature has a slightly different geometry, which can be translated as a larger effect. So the minimum daily temperature, the temperature at night, seems to be a little bit more important than the maximum. And again, this is the odds ratio for stillbirth and preterm birth for the short-term study, and we can see significant associations which are not seen in stillbirths, probably due to limited study power because we have less stillbirths compared to preterm births. But if we see the results of the long-term study where the effect sizes are greater, we can see that in the third trimester, almost all outcomes are characterized by statistically significant associations, both preterm birth, stillbirth, low birth weight, small for gestational age and large for gestational age. We have consistently higher risk, statistically significant higher risk at the third trimester, and this is from the long-term study, the average temperatures by trimester of exposure. It is again non-linearly in a U-shaped manner associated with preterm birth, and these are also some associations with pollutant levels, PM 2.5 levels, where again we have an adverse relationship and an inverse relationship with NDVI, a greenness index, which shows us that the greener the municipality, the more vegetation it has, the less reduces the risk of adverse birth outcomes. So, because we have 22 years of observations, we can see some exposure dynamic and risk dynamics. So we were here at 2000 in about 1.3 hazard ratio, but we can see as the year passes, the temperature is rising, the heat exposure is rising, and it looks like also the risk of having adverse birth outcome is also rising, and we hope that this curve will change in the future. We will adapt to protecting ourselves from extreme heat, and we will not see this non-linear increase of risk as the years go by. And finally, the results were quite consistent among many countries. Until now, I have shown you the results from Greece, but in all countries document more or less the same magnitudes of effect, and pooled analysis from the short-term exposure gives an odds ratio of about 1.1 and 10% increase in odds. And again, quite consistent results in 4 European countries, Sweden, Belgium, Italy, and Greece, all showing statistically significant and quite large associations between the exposure at the third trimester and all adverse health effects. So we observed in the majority of analysis a U-shaped, like I said, curve. We observed statistically significant associations in both short and long-term exposures. And in general, the third trimester of pregnancy is the most vulnerable periods, providing and resulting in stronger and statistically significant associations. And finally, there are a lot of things that we need to investigate more. We have that, and we can examine the geographical distribution of the risk, can examine the interaction of environment, environmental factors like air pollution with heat. Also, we can integrate satellite data, look at the topographical and socioeconomic indicators, and see how all these factors may increase or mitigate the, I would say, well-established exposure to effect relationship. Of course, the time windows of exposure is, again, a field that people are doing all sorts of stuff for defining what heat exposure is, and it is interesting to look further how different expressions of heat exposure affect the results. And again, if we examine maybe a larger period, we could see trends of adaptation or mitigation of exposure of the effect over time. I want to thank you, and I want to thank all these people who participated to this project and to this analysis from different institutions. And again, thank you for listening, and thank you for the invitation.
Thank you, Michalis. Do we have any questions in the audience? Yes, up there, please.
Hello, I'm from Department of Public Health, from Western region of Greece. It's very interested the research. Thank you. There is actually a research study in Cyprus that has correlated stress with increasing of temperature. Take that into account. We may think about sea. If the temperature, the high temperature or the low temperature produce cortisol, that may affect the birth of outcome, the outcome of birth.
Yes. Thank you for the question. And so when you are referring to stress, you are referring to stress indicator or biomarkers like cortisol or psychological stress? What type of stress?
Sorry. I'm thinking there was this actually maybe a psychological stress due to increased temperatures. Yes. Okay, I don't know about exactly the cause now, but the Cyprus research study, it was a correlation between this and actually some chronic illness that has increased about the outcome. Yes.
It is one of, thank you for the question, it is one of the core hypotheses on the effects of heat to human health. Mental health is also a field of study, and in parallel with this study, we are conducting a prospective birth cohort study when we measure a variety of biomarkers, including cortisol and markers of oxidative stress, heat shock proteins, and others. And in parallel, we are collecting data on psychometric tests. So definitely this is a hypothesis that merits investigation. It's very interesting. And hopefully in a year or two from now, we could also have our own opinion and results on this. So thank you again.
Do we have any questions online, maybe? No? Good. Then I will ask you also a question. So you said that basically a good indicator is how much temperature is changing, and that it's not the absolute heat. Where are we talking about on a time scale here? Is it change between day and night? Is it change between within a week? Is it change compared to the previous season? Where is like the adaptation of the humans not working out properly?
Yeah. Okay. So first of all, I want to clarify that this is a hypothesis by observing the results that there might be, it might be a good indicator. I did not provide evidence that it is a good indicator, but it is something worth investigating. And what we mean is that because we had this sudden rise in spring, and spring, although it has lower temperatures compared to summer, it has more rapid surges, more rapid increases. So the idea and the hypothesis is, for example, within a week, we see the temperature rising by 5 degrees. It may be as important as having a steady temperature at 35 or 37 degrees. So if I could put it in a time window, I would first examine it from daily differences in temperature exposures until probably about a week. So the body has not yet adapted to extreme temperatures, and when this is taking place very rapidly, maybe the human body is more vulnerable.
Okay, thank you.
Yeah.
So then let's thank Michalis and all the other speakers in the session one more time. And then I guess we will be ready for lunch. I don't know, Zoe, do you want to say anything regarding the timing of the next session?
Yes, we're moving to lunch, and then the next session is at 2 o'clock, I see. 2 o'clock, so we have one hour. Thank you.
Perfect. Thanks, everyone.
Good afternoon. I would like to thank the organizing committee for inviting me to give this talk.
Thank you.
Pardon?
Just a moment, please wait a few minutes. Thank you.
I'm not to start again now?
The next session, Professor Koutsioukis had an urgent commitment and unfortunately he will not be able to chair the next session. So I will facilitate the session. Firstly, I would like to introduce our first keynote speaker, who is Professor Emeritus Aristea Velergaki of General Microbiology from the School of Medicine, from the National and Kapodistrian University of Athens. Welcome, Professor Velergaki.
Thank you. I'd like to thank the organizing committee again for inviting this talk. And there are no conflicts of interest in this talk. First of all, I would like to point out a few things and say that although fungal infections contribute substantially to human morbidity and mortality, the impact of these diseases on human and animal health, I'm afraid, is not widely appreciated. Moreover, despite the urgent need for research into the pathophysiology of human fungal infections, it lags behind that of diseases caused by other pathogens. So this talk will attempt to highlight the importance of fungi as human and animal pathogens and address the challenges we face in combating fungal public health hazards as augmented by climate variability and change. Therefore, We can easily call fungi hidden killers, as they can cause devastating infections, especially to immunocompromised hosts, and because they lurk everywhere in the human and animal environment, they constitute a great hazard. The occurrence and the frequency of extreme climatic events render them successful to colonize and infect crops, stored grain, animals, and humans. And as these maps indicate on extreme temperatures and extreme rainfall in Europe, we are in an era where climate is rapidly changing, more rapidly than we can manage it. To that effect, I would like to point out the impact of climate variability and change. Now, if you look here, the climate change affects 5 aspects of human environment, which is depicted in purple bullets and red lines here. And these, in turn, impact other environmental factors affecting 12 separate aspects of human health. Now, the place of fungi here, you can see it's for vulnerable populations and disabled people, but not only, for healthy people as well, because they are involved in weather changes and extremes. They are affecting ecosystems. They affect food security, water security, oceans and coastal waters. And as far as diseases are concerned, there are neurotropic fungi that cause neurological diseases and symptoms, the air quality, and opportunistic infections in turn of the air quality. Lung disease lung diseases are caused by opportunistic fungi, and as well as asthma, allergic conditions, and airway diseases. So they're not to neglect. In detail, we can say that the long-held assumption that human health is independent of the planet's health has been challenged by hard facts. First of all, we have environmental pollution, which affects human and animal immune status and compromises hosts for infections, fungals included, of course. And climate change causes biodiversity loss, and we know the well-studied dilution effect on species variability, and increases fungal disease transmission, as well as climate exacerbates pollution and diversity loss and expands fungal disease geographical and host range. So a lot of hosts are affected, and the geographical boundaries of fungal disease are expanded. Now, there is a WHO summary of the main expected health impacts of climate variability and change globally by the middle of the current century. But we're going to stress what is happening with the increased risk of injury, disease, and death due to fungi. To exemplify that, I'm going to present to you a globally new case of a yeast found in a case of human infection and keratitis following injury with a tree branch. Now, the causative agent was Yamatazima mexicana, a rare yeast not found previously in our region at all. In indeed, it is endemic in tropical and subtropical regions like Mexico, Asia, South America, but not in the Mediterranean region and not in Europe. It can be found in marine environments, soil, atmospheric niches, and inhabits decaying wood, leaves, fruits, and insects. It can adapt to harsh conditions, such as high temperature and low water activity. And this is where the impact of climate change is playing a part. Climate change is affecting our region, of course, and actually it is affecting it quite severely. So it increased the yeast's propensity to colonize our trees. This is the injury it caused here. You see the infiltration of the eye by the yeast. This is a biopsy which shows the yeast cells. The dark blue ones are the yeast cells. And in culture, it grew this yeast, which was not able to be identified by the multitude of MS systems that we possess. And of course, we had to retrieve to sequencing. And the sequences showed that it is the yeast Hematosima mexicana, much to our surprise. But what is more alarming is that the drug of choice used for eye infections, natomycin, was not suitable for this yeast because it had a very high MIC. So the yeast was not susceptible to this drug. And of course, the other drug used very frequently, which is fluconazole, was also quite unsuitable for prescribing. Now, the patient was prescribed this drug, voriconazole, which had a low MIC, therefore it was susceptible to treatment. And the patient was free of infection after 2 months, and after some surgery, which is called keratoprosthesis type 1, implantation 4, according to the terminology used by the ophthalmic surgeons, the visual acuity of the patient was satisfactory, we'll say, because as you see, it's 20/60, which is not a lot. But on the whole, rapid identification of the rare yeast resulted in the patient's cure. Now, the prognosis of what is going to happen in our region is not very good. Actually, it's quite bleak. The climate change will affect extreme rise of sea level in Greece. And here it is compared to baseline, showed on this side of the maps, where the ports are also marked. And this is going to have an economic effect as well, you understand. But the projections, depending on the rate of the ice melting, different rates of ice melting, is not very good. So the sea level is rising, and it's rising quite fast. To that extent, we decided, us and other Mediterranean countries, to test what is going on in our beaches. What is the fungal load and the quantitative and qualitative fungal load of our beaches, and how this affects human health. Much to our surprise, we found very interesting results. regarding common fungi that are also occurring in nature and are pathogenic to humans. But we also found something that we came across in Greece, rather something that we were not expecting at all. We've isolated from the island of Salamis a fungus which is called Parengiododium album, that is a polyethylene degrading marine fungus, as a matter of fact, and it lives in the oceans. It has been isolated from lentic and lotic environments. It is quite frequent in the Great Salt Lake in Utah, USA, and not as frequent in other Mediterranean countries. Actually, I think we are the only country that isolated Parengiododium from our sand. We also noted the temperatures while at each sampling occasion, because this happened at different seasons of the 4 different seasons of in a year, and monitored this. But the isolation of Parengiododium album was not affected either by temperature, precipitation, wind direction, and wind speed. It was there all the time. Now, this fungus, besides degrading microplastics, and which is very useful, of course, it is a biological way of getting rid of microplastics in immunocompromised hosts, causes encephalitis, bloodstream infections, cutaneous lesions, eczema. In dolphins, also causes cutaneous lesions. It also degrades ancient wall paintings, stone cultural relics in museums. It is an oligotrophic fungus, so we can live on practically anything from plastic to tart. The only good thing about this fungus is that it produces, as a product of its secondary metabolism, xanthoquinodin, a mycotoxin which in vitro and ex vivo causes apoptosis in human prostate cancer cells. So that's something promising coming out of this fungus. On the other hand, certain studies show that arthropods could be an important vector of Parengiododium album. So they help to disseminate in the environment. And to corroborate this, fungal spore abundance and frequency of occurrence in indoor air of cultural heritage museums has shown its presence being predominant in these environments. Pardon, is there something you would like to ask?
We can move on and have some questions
thank you.
at the end. Thank you.
Now, fungal diseases and the environment, it's like bringing coal to Newcastle, really, because fungi are very abundant in seawater, lentic and lotic environments, soil, sand, air, and of course in clinical specimens, human and animal clinical specimens. Here I have only included the fungi by the genus. So each genus, you understand that includes many species. So if you count those species, you'll find more than 500 common fungal species found in clinical specimens. But we are going to focus on Cryptococcus because it's a prime example of how this yeast can infect humans from the environment, humans and animals. We have two main species of Cryptococcus. We have many species and cryptic species of Cryptococci, of Cryptococcus species, but we don't focus on those because the most frequent causes of human and animal disease are these two species, Cryptococcus neoformans and Cryptococcus gattii. Now, the natural reservoir of infectious spores of these two species are soil, bird dung, decaying wood, and trees. It is transmitted from the environment through its desiccated basidiospores because they dry out in the atmosphere and air spreads them and drafts when we're talking about indoor environments. Spread them so they're breathed in by humans and animals, from the environment, either indoor or outdoor. Often causes lung, brain, because it's a neurotropic fungus crossing the blood-brain barrier, so it can cause cryptococcomas in the brain, and cutaneous infections. The spread within the organism, human and animal, is hematogenous, of course. Immunocompromised individuals are most at risk, as always, but immunocompetent individuals can get infected by Cryptococcus gattii. Now, Cryptococcus gattii was not previously found in our region either. So that prompted after publishing these results from Greece, prompted our European counterpartners to perform a study in the European, mainly in the Mediterranean areas, but other European countries, continental Europe was included in the study, to see the frequency of occurrence of Cryptococcus gattii. That showed that we have, of course, imported cases, but note that in our region, the Mediterranean region, we don't have many imported cases, and maybe this is because we have our own. And autochthonous cases have been reported in Europe, continental, which is the red stars, and Mediterranean countries. Then we thought of looking into the environment and see, okay, we have patients. The patients got infected from the environment. So we found them in our environment too, and that included trees, soil, many species of trees, from olive trees to eucalyptus, which is not new because in Australia, the prime niche for Cryptococcus in nature is eucalyptus trees. So it was confirmed that the yeast exists here as well. Now, it was of interest to see what was the similarity or difference of our gattii with other countries in the world. And we compared by single-strand conformation polymorphism analysis, which tested only one gene, the URA5 gene, which is a very well-conserved gene within Cryptococcus, to see if there are any similarities. And to our amazement, Australian and Brazilian Cryptococci gattii were similar to our ones. So as this diagram depicts, it is not one health only, but it is one earth as well. So what is endemic somewhere in the world, it can be easily transferred through climatic conditions into other regions. After this, we thought, yes, but what happens to the whole genome? What if we compare local strains with those of other parts of the world? And of course, we confirmed that our strains cluster very well with Canadian strains. And in fact, the Vancouver strain 6, as we call it in mycology jargon, is an epidemic strain. It causes epidemics. So our strains cluster with Canada, Sao Paulo, Brazil, we knew that anyway, USA, Zaire. So that confirms everything. Animals and companion animals in particular are not exempted from cryptococcosis. The mode of transmission is the same. Animal infections can occur from the environment to cats, dogs, koalas, pigeons, but even non-mammalian hosts can be infected, like amoeba in the environment and seedlings. Now, the spores are desiccated and they're inhaled, as you see here in the dog. They can cause pulmonary infections, and there's hematogenous dissemination to the meninges, causing meningoencephalitis, and to skin, because hematogenous spread can cause skin lesions due to cryptococci as well. Cats and dogs are infected because they sniff around all the time, so they inhale the desiccated spores. And this is the clinical picture of cats and dogs, a very typical one of what is referred to as mushroom nose. And to corroborate that, animals are affected too. There's a case in Thessaloniki, North Greece, occurred in a 3-year-old intact female German Shepherd dog, and presented with neurological symptoms, because obviously a hematogenous spread to the brain was had occurred. The lymph node aspirate from the popliteal lymph, which is behind the dog's knee and behind a human knee. There's a lymph node, and the aspirate of that was positive for microscopy for Cryptococcus. You see here phagocytosed by foamy macrophage, and there's some free cells of Cryptococcus gattii 2. Culture grew melanized colonies of the yeast, and you see the details here. In microscopy, we see encapsulated yeast, and this is stained with Fontana-Masson stain, histological stain, but this is a GIMSA, a simple GIMSA stain that revealed the yeast cells in the lymph node. All the same Cryptococcus was isolated from the dog's environment, from the leaves in the barn where it was kept, and from soil with pigeon droppings, you see here, and soil. Another interesting finding in the Cryptococcus European study was that Cryptococcus neoformans hybrid named alpha ADA genotype variant Cryptococcus neoformans 3 was isolated from the island of Amorgos, Greece. from the bark of an olive tree, but it was also isolated from sand, if I remember correctly. Again, environmental conditions were monitored, and there were no, the isolation of this hybrid Cryptococcus neoformans was not affected either in the samples, found in the samples of spring, autumn, winter, or summer. And what is rather alarming is that this hybrid is resistant to the main drug of choice for cryptococcosis, fluconazole. Now that happened in 2018, 2019. In 2020, we've started isolating more and more Cryptococcus neoformans strains from patients in hospitals, either transplant patients or oncology hematology patients, that were resistant to fluconazole. Genotyping of these strains showed that they were indeed the same hybrids. So you see, environment and human health are bound internally together. Now, the CDC in the US has published this disaster-associated fungal infections list that includes representative, I would say, fungi that can infect traumas caused either by tornadoes or tsunamis or hurricanes, burns, or fires and floods. Now, coming back home again, because home is interesting, because what happens at home happens all over the world, as we stressed before. We've had floods, and quite frequent ones, frequently occurring in our region, and fires, which start from March going up to October in our region. This is a recent flood, which had some people traumatized and injured. And these injuries are shown here, having a necrotizing tissue around the injury, hence being black. You see black, therefore necrotic tissue. And these tissues were positive for fungal elements. You see here hematoxylinizing stained biopsy. And cultures grew this fungus, which is a zygomycete, and it's called mucor, causing mucormycosis. And nowadays it is associated with climate change disasters. It is a fast disease progression because these lesions progress very fast, so rapid diagnosis is imperative in order to save as much tissue as we can. And these are tissues injured by burns. Actually, this is a photograph of a fire occurring that occurred 14 years ago in Achaia, in Pyrgos, near Patras. We had several injuries coming from there due to the fire, and people just fell onto the ground in order to extinguish the fire from themselves, and got contaminated with soil and took this fungi from soil. And these necrotic lesions developed. These are pictures after surgical removal of necrotized tissue. And you see the devastating effect that it had. Now, these people need extensive plastic surgery, and indeed they had extensive plastic surgery to make things better, but not perfect with the burns and infected skin. Now, cutaneous disease, because fungi, apart from systemic diseases, cause cutaneous diseases at all. This is a very recent study published in 2024, which shows the incidence of cutaneous diseases in the globe. So you see the incidence is more prevalent in countries with low socioeconomic status, but also are spread all over with different states of chronicity and severity, because in the more privileged part of the world, there is better care and better access to drugs, of course, so that they can be treated. The same happens with the years lived with disability. If we measure that per 100,000 population, we see that it is more severe, disability is more severe in countries with low socioeconomic status rather than others. But there is always a loss of health and a loss of ability to perform daily business because of pruritus or pain on the body and extremities. The epidemiology of cutaneous infections is changing rapidly, more rapidly than we can afford to have it changed. And that is true because of extreme droughts, extreme heat. You see here on this map, which was published in 2017, but it is still very updated. Red shows heat and drought, which means that affects agriculture and causing population to be displaced and go to other places where they can have water and cultivate the land. So, and this is a very recent picture from the Gloria bad weather that hit Spain. I think it was Barcelona that was hit very badly. And that the waves were 7 meters high in that case and caused this very devastating disaster in the beaches. Now the WHO has estimated that 65.6 million people have been displaced between 2006 and 2016, which is roughly the population of the UK. Of course, some people, some 40.1 million have been displaced locally, moving because of drought and this floods have moved in the same country or nearby countries and did not emigrate to European countries. Because, and why I mention this? I mention this because people's displacement displaces pathogens as well. So the geographical distribution changes. And one example is Trichophyton raubiceki, which is a pleomorphic Afroasiatic type of a very common dermatophyte in Europe and other parts of the world, Trichophyton rubrum. It didn't used to be autochthonous in Greece, but we noticed that it became autochthonous in early 2000. This is its picture in culture. It is an arthroconidal fungus, which means that it is very easily transmitted from human to human, as it is an anthropophilic fungus. The more arthroconidia a fungus produces, the more effective it is. Infects body sites, causing tinea corporis mainly, but also causes nail disease as well, but more rarely. And here are some clinical pictures you see are quite severe. But what is alarming again is that many strains are resistant to drugs of choice. So it burdens the laboratory to perform susceptibility testing when this fungus is isolated. Now we know that total climate impact of air flights is estimated at about 4% of global warming. This is a single flight, but look what happens. When this single flight was en route, all these flights are on the air, which means that population is displaced or moved from one place to the other, so carrying pathogens as well. And one of these very new pathogen is Trichophyton indotina. It's a new kid on the block, as we say, but we know little or a bit more, I would say, that we knew a year ago. It is known to be anthropophilic from human to human, but one wonders, only, do we know enough? It is new. It takes time to learn things about the new kids on the block, you know. It occurs within families. In fact, it is very infective. It's arthroconidal as well as it was the Trichophyton raubiceki I mentioned before. It is transmitted by sexual contact. But what happens with schools where a lot of people come together, and army barracks and fitness centers? And if it's so easy to transmit, could it transmit to animals as well? It is, as I said, very infectious, and there is a recent publication which shows that a single masseur transmitted the infection to 17 other individuals in the same massage establishment. So that illustrates how effective it is. This is a Greek case, again, of a patient with Trichophyton indotina, very extensive lesions, most part of the bodies. I show just a few here, but it's almost covered by lesions. So again, surprise, surprise, many strains are resistant to drugs of choice, which is terbinafine. So not only new, but one would wonder, would we run out of treatment in the end with all these quite infectious and resistant strains that enter our lives? Now, most patients report very severe pruritus, which causes them to use corticosteroids topically to alleviate pruritus. And that of course, makes the infection worse because fungi are not actually like cortisone, and they're not affected by it at all. The distribution of Trichophyton indotina today is amazing. It started from India, Bangladesh, and Pakistan, and in a short time, it covered the world, conquered the world, I would say. And now to answer the question, what about animals? Earlier this year, we read that it was isolated in Egypt from a dog. 90 dogs were sampled in Egypt, 47 were positive cultured for dermatophytes, and one companion dog found with Trichophyton indotina. Companion dog, not in the proximity of humans, that is, which partly answers our questions, of course, our question that it can pass on to animals as well. But when it passes to animals, one wonders, can it pass to another dog or another cat? Think about it. In 2022, in my opinion, quite late in our lives, certainly my life, WHO published a fungal priority pathogens list, which is the last in the list compared to the other lists that have been published on viruses and bacteria, mycoplasmas. And this list includes pathogens that we've discussed already in this talk. The critical priority group, we see Cryptococcus neoformans. And in the medium priority group, we see Cryptococcus gattii. Of course, we see a lot of other pathogens like Mucorales, which we've also discussed, which is in the high priority group. Needless to say that this group of, in this list, rare pathogens like Yamadazima that we've discussed or Paragiondodium that we've discussed are not meant to be included. And I hope never to be included, to remain rare, that is. Now, in conclusion, apart from the main conclusion that you can put the globe in one petri dish, or one petri dish can be harboring the whole of the world, climate variability and change is a potent driver of fungal disease emergence, spread, and severity. We've established that, I think. And that human fungal disease is ostally linked to domestic and wild animals and to environmental quality as well. Although neglected organisms, fungi play a very important role. Industrial pollution, agricultural and urban runoffs compromise human and animal immune systems, rendering them susceptible to fungal infections. Fungal infections are termed as opportunistic infections. That is, when they see the opportunity of a compromised immune system, they attack. Because the prime defense is cellular immunity, which is compromised, the first to be compromised when immunity is lost. Immunity integrity is lost. Increasing numbers of displaced populations due to climate associated change and disaster, as well as wars, we mustn't neglect that wars are one of the major reasons for human displacement, human population displacement. Change the epidemiology and change the face of fungal diseases. So far, data show that a global epidemic due to Thracophyton indotina may be currently evolving. So it is important to observe, study, and record what is happening with Trichophyton indotina, because all the signs show that it is an epidemic in evolution. So this is very important information that can be extracted from studying such an event. So collaboration of human and veterinary medicine, developmental biology, ecotoxicology, agricultural science, and policy are imperative to address complex fungal disease public health issues. But having said that, I have to stress that, as this conference proves, collaboration of different specialties in medicine, biology, biochemistry, chemistry, physics has been achieved, and it produces results. But what is not achieved is implementation of policies. And you know, there are many resolutions, WHO resolutions, political decisions that have been made at the global level. How many of those have been implemented? Because climate variability and change and the climate crisis currently occurring is not going to be solved only by scientists. It requires correct policies as well. The scientists, I'm afraid, have not the power to implement. And with this, I would like to thank you and wish you happy holidays.
Thank you very much for your very interesting presentation. Are there any questions? Due to pressure of time, we can have one question.
Hey, Uli Klumper from TU Dresden in Germany. I enjoyed your presentation, especially also the very graphic pictures. So it sounds like a very dire picture you're painting. So animals and the environment are heavily
I'm afraid
involved.
I can't hear you.
Okay. What are we doing?
Can you hear me, maybe?
Yes, I can hear you.
Yes, so we have a problem with the other microphone. Just a minute, please.
Test, test. Hello, can you hear me now?
Yes, I can hear you now. Yes.
So thanks for the presentation with nice graphic illustrations. But to me, it sounded like you're painting a rather dire picture where the environment, animals are involved in transmission. It's very difficult to disinfect fungi because a lot of the transmission is happening by spores. A lot of them are getting resistant. So is the only thing we can really do find new fungicides in addition with trying to limit exposure, which might never be possible completely?
Yes, you're right. And of course, we have to, for new strains and entering our environment, urban and rural, it would be best if we did something to delimit climatic degeneration or to limit effect, the frequency of catastrophic effects of the climate change, because the more frequent they are, the more dissemination of these fungal spores, and especially the new ones we know very little about, will occur. But I agree with you. Fungicides, friendly to humans, because not all are friendly. Mainly biological ways of delimiting fungal activity in crops and stored grain. And of course, better antifungal drugs for humans and animals, less toxic. Any other?
Thank
Have I
you.
answered your question?
Yes, thank you very much. So let's move on to the next presentation. We would like to invite Sophia Schumann, researcher from the Technological University of Dresden, with her presentation entitled Integrating Oxidative and Endocrine Biomarkers to Assess PFAS Induced Stress in Freshwater Fish.
Sorry. Okay. So I'm an ecophysiologist. I'm interested in how anthropogenic impact is actually shaping physiology in organism. And I'm particularly interested in fish. And I would like to show you some results which I obtained during my PhD, which I did in Padova in Italy. And yeah, so I would like to show you and introduce you in a little case study. First of all, why do I do this biomonitoring? So the idea is to get an overview how actually any disturbance we have, like chemical pollution or even light pollution, is having like an impact on our organism. And by this, we are not only trying to understand like physical parameter or chemical parameter while we are like monitoring how much of a specific substances we have in the water, but we are also specifically interested how the response of an organism is. And by that, I mainly work with fish. Fish sounds for most of you probably like a small, tiny group, but fish is actually the biggest group in the group of vertebrates. And we have approximately 18,000 different fish species. So we have to consider when we are doing these biomonitoring studies our species carefully, especially when we are thinking that particularly when you remember maybe from university that higher predatory species are even accumulating more of substances as they are feeding up in the food web. And so also we have to consider that they have like different habits of living or even occupying different ecological niches. And therefore it's very relevant if we do these kind of biomonitoring studies to also think wisely, what are we interested in, and what we want to see. What do? I said ecophysiology. I'm mainly interested into stress. So I look at specific anthropogenic impact, and then I look, okay, what is actually happening? How far is our organism going out of the homeostasis, and how far is the organism actually out of the tolerance range? How much can we see that it's not actually coping with its environment anymore? Okay, So the talk I said is mainly on PFAS. PFAS is not only one substances, it's like 15,000 substances nowadays. We guess that there's 15,000 because there's no actual numbers. And it was actually developed by an accident. There was like this substance which was so nice and so, yeah, it was water repellent and was perfectly what they just found something new and they developed Teflon. And it was one thing and then it spread it and spread it and spread it more over. And now we can find it in many things, like for example, anti-cooking, the Teflon, but also we find it in firefighting foams or even in cosmetics or in shampoos, because it has these properties, which I would like to show you now. No, first I would like to show you the problem of this PFAS. Okay, I said there's 15,000 different substances, but the problem is, okay, we already know that they are very toxic and that they are affecting our organisms, but the regulations are mainly not globally, they just are in some parts of the world. So for example, we have since 2016 that, for example, P4A and P4A related salts are, due to the Stockholm Convention, forbidden in Europe, but this regulation is only in Europe. It's not covering, for example, America or Asia, and this is actually a big problem, because why? It's because of the properties which I would like to show you now. And what is PFAS? So PFAS are perfluorinated aqueous substances. This means that we have this carbon change, which is actually having all embedded a fluorine, and then it has hydrophilic hat and a hydrophobic and lipophobic tail, and this makes it so persistent in the environment that it's impossible to, at least, let's say in a big scale, filter out from like water. When it once enters the water system, it's impossible to move it out in large scales. And it's not only transported by water and by transport, for example, through organisms, or, for example, people moving with shoes with Gore-Tex protection into Antarctica is also transported by rain and by air. And this makes them to call them also forever chemicals, because they are so persistent. And also they have very strong, these bonds between the carbon and the fluorine is very strong. So it's impossible, and also due to the long length of the carbon chain, to break them down. So they accumulate for many hundreds of years in our environment. So let's come to the case study. We are talking about Italy. And here in 2005, this is the Veneto region, was discovered like one of the biggest pollutions worldwide, actually. And we measured up to 1,214 nanograms per liter. And they were released by a fluorochemical plant over many years. And this was only discovered because many people were getting cancer. And they were thinking, where does it come from? And then they found, okay, oh, there is this fluorochemical plant. The plant was closed, but the pollution stayed. And we went actually to 3 different sites. We chose one site with a high pollution, which had like 582.6 nanograms per liter of P4A and 95.5 nanograms per liter of PFOS. And when we had also a low polluted site and a very low polluted site, because you can barely find sites which have no pollution anymore. This was in the mountains, the first site, but there's nothing else where you can find like a controlled site where there's no pollution anymore. We even find it in Antarctica, so it's very sad. And when we also look at the pictures, this last site, the highly polluted site, in species richness and from the environment, I didn't expect that there was the things which we are now going to see, because for me this seemed like a pretty nice river in Italy, but it's not. So let's start. So this is the amount of PFAS we can find in the tissue. I said PFAS is many substances. So what we are normally doing is like clustering them between PFOS and P4A. And we saw let's do first the first graph. We see, okay, there's two species which we sampled, Patagobius bonelli and Squaliocephalus. One is a species which is bentivore, so it's not moving that much. It's always close to his home, like it's going like 5 meters around, maybe 8. And the other one is Squaliocephalus chap, which is moving also 10 kilometers per day or 12. So it's top, we call it Potamodromus, and it's free moving in the river column. And we can see, if we look now at the PFAS level in the different tissues, we couldn't actually differentiate the tissues responses in Patagobius bonelli because you need a lot of tissue for doing this analysis, and the species is very small, so it's like 6 to 7 centimeters, so you don't have enough tissue to do like the specification by tissue. But we see one of the highest concentration generally in both species ever published. So, and we didn't even, if you remember, we didn't even went to the highest polluted sites because they were, yeah, if we see like 1,214, and then there is 582, is less than half. But we see one of the highest polluted tissue samples published. And we can see also one other interesting thing in the second species, in Squaliocephalus. Mainly PFAS accumulates in the liver. Why in the liver? Because liver is one of the most protein-rich tissues. And yeah, that's why. And also, if we now look more into detail in the graph, in the round graph beneath, we can see it's mainly PFOS, which is accumulating in the tissue. In Patagobius bonelli, in the whole tissue, we can see mostly PFOS, and Squaliocephalus in the liver was also mainly PFOS. P4A, even though the concentration, if we remember, were higher, we don't see so much P4A in the tissue. And why? Because P4A is mainly accumulating in the water column, and PFOS is the thing which is super interactive with our proteins. And then, okay, I was interested what is actually happening in the liver. So I did some histology, and this is the histology of the two species. On the top, you can see Patagobius bonelli, and you can see, you have to trust me, here, first there's some, in the first picture of Patagobius bonelli, you can see some white cracks, that's just artifacts. This is, when you do this kind of biomonitoring studies, you're in the field all day, you try to cool down the fish, but when the tissue gets dehydrated, you sometimes see this kind of artifacts. But anyways, we can still see that there's a severe steatosis in the fish with increasing PFAS levels. So first, when we have a low contamination, we even see a microvascular steatosis, and with increasing PFAS concentration, we see even a macrovascular steatosis. In the second species, in Squaliocephalus, we don't see any tissue differences. Like there was not the same pattern we saw in the other species. And normally, when you do this kind of analysis, you do it blindly, so you don't see which tissue. Obviously, the structure of the tissue is a little bit different. But normally you do it blindly, and then you do these ratings, which I put on the top, and then you analyze how much of steatosis you see in the samples. And why we see this actually is because PFAS is blocking the mitochondrial beta oxidation, and this leads to an excess in the fatty acids, and therefore we see this kind of formation of lipid droplets, because the steatosis is nothing else than the formation of little lipid droplets. In my PhD, I was mainly interested in oxidative stress. So what is oxidative stress? Oxidative stress is actually the imbalance between free oxygen radicals and the antioxidant system. So we have here the superoxide dismutase, the catalase, the glutathione peroxidase, and the peroxyredoxins, and they are trying to balance the free radicals, here the superoxide anion, the hydrogen peroxide, and this is all transformed into water, which is not harming our cells. If this process is not working, we have the formation of radicals, and this can lead to lipid peroxidation, protein oxidation, or even in a more severe stage to the fragmentation of DNA. But this takes a little bit more time. While, for example, lipid peroxidation or protein oxidation, depending on the tissue, you can see in some minutes. What we actually saw is that we only could do this assay in one species because I said the tissue is, when you have a 5-centimeter fish, is very small, and you have to prioritize a little bit your research, and I was prioritizing the histology. So we have only the lipid peroxidation of Squaliocephalus, and we can see that with increasing lipid peroxidation, with increasing PFAS pollution, we see a negative feedback, and we see that the PFAS, the lipid peroxidation is actually decreasing. And when we are looking now at the specific genes involved, then we see in Squaliocephalus it was superoxide dismutase, which was highly involved when there was increasing PFAS pollution, while in Paragobius spinelli it was primarily glutathione peroxidase 4. So I was not only interested in oxidative stress, also the main idea was also to analyze stress by cortisol. So cortisol is primarily used in aquaculture. That's where the idea came from for my PhD, and is the primary stress hormone in fish. It's released from the hypothalamus pituitary interrenal cell axis, and is actually directly, where's my blood? It's directly released here in the blood. So it's sent by the brain, and then it's released in the blood. And what you actually can do is what my supervisor, Daniela Bertotto, is doing. She's interested in also understanding the more prolonged response. So blood, the response is very rapid. You see like a response in 30 seconds, even sometimes in some species faster. While, for example, in the muscle, it takes time till the cortisol is diffusing in the muscle tissue. And in the fins, it even takes more time, and in the scales, you can see responses after 10 days, which is very interesting, particularly when you do these kind of studies, because you are interested also to analyze the prolonged response. And what we actually saw, here this is muscle tissue, because we had muscle tissue from both species. Remember, fish 6 centimeters, blood samples are very difficult to get. So we see that with increasing PFAS pollution, Squaliocephalus increased the level of cortisol in the muscle tissue. So the acute stress was there. But in Paragobius spinelli, we don't see any difference between the tissue. Interesting, and between the different level. If we now check in the more prolonged response, we see the same patterns. We see the increase, low, very low, low, high in the fin, and we see in the scales as well. And what does it actually mean? Yeah, we see like a systemic response. So there could be like that the cortisol production was completely disrupted in Squaliocephalus, and this leads to a systemic increase of cortisol. And in Paragobius spinelli, in the Pentivorous species, cortisol is actually not involved. So there is no local, there is no systemic response, so it's more local. Because we saw that it was reacting in the liver, so there is a response, but not in the whole system. And I would like to show you another interesting property of cortisol. So cortisol, normally what is happening is the fish, as us, has a kidney, which is releasing the toxins over the primary urine into the water, and that's what actually normally happens. But not in the case of PFAS. In PFAS, when we have PFAS in the organism, it's actually binding to the albumin in one side, and also the renal absorption is blocked. So the PFAS is actually accumulating in our organism. And what we see, this is now the activity of glutathione peroxidase, the activity of one of those antioxidant enzymes, and this is highly upregulated with increasing PFAS pollution. This is Squaliocephalus, so the big species where we had more tissue. And we can see that mainly glutathione peroxidase 1, if we look at the qPCI data, is involved in our response. And it means, since we don't see any response in glutathione peroxidase 3 or in 4, that is an intracellular response, but it also means, for example, GPX4 is highly related to the production or the formation of lipid peroxidation and malonylaldehyde, so that there is probably no lipid peroxidation in the kidney. What does it mean in an ecological context? So PFAS can trigger like mitochondrial stress and can alter the lipid metabolism in fish, but only in Paragobius bonelli, and it shows a very species-specific response. Why do we see this response? I think it's also related to the behavior of the fish. We have one fish, Schwab, the Squaliocephalus, the big fish with the lot tissue, is swimming a lot, so it has a very aerobic metabolism, and it needs to buffer this oxidative load and to avoid steatosis, avoid the damage of tissue, while in goby, it relies more on the lipid storage and also more on the antioxidant protection, and therefore it has more like a energy saving strategy, and this could be the result that we have seen this kind of fat accumulation. So the fish is less active in the end of the day. But what has this for like ecological consequences? Actually, it has severe consequences, because if one species, CHAP, is stressed, cortisol is also highly linked to the production of steroid hormones and sexual reproduction. So it could interfere with the sexual reproduction. It could also be, with increasing pollution, even lethal. And it could be also that this increase of liver fat droplets is like an adaptive mechanism. So it could be that one species, at least in a short time, could adapt to this pollution, and this would even make the situation in the sense of ecological balance in an ecosystem like a river more dramatically. Yeah. Thank you very much, and also thank you for your attention. And this is my old group from Padova, and now I'm looking forward to spend the time with these nice guys from Dresden.
Thank you very much for your presentation, for this your great research. We can have one question. Yes, please.
Hello. Thank you for your interesting results. I would like to know if you find where you find this substance, the PFH, the poly. Where did you find this? In what tissues did you find the accumulation of this substance? In what organs?
Basically in fish, in all. But it's mainly accumulating in the liver because it's the most protein-rich one, and also because it has a detoxification function. So but also in the blood you can see it. You can basically also measure it in the gills, and in the muscle tissue you also see, as you saw.
I'm asking that because of the consumption of the people to this fish, so they have to be careful what kind of tissues they can consume. The other thing is, I'm going to ask you about the consistency of oxygen in the water that you took these examples. I mean, how much, if there were enough oxygen in the lakes or in the rivers that you took the samples?
Yeah, pH, oxygen, nitrate, ammonium was pretty similar.
Pretty similar, okay. Thank you.
Thank you very much. The time is pressuring us, so let's move on to the next presentation. We would like to welcome Eleni Sazakli, Assistant Professor from the Department of Medicine of the University of Patras, who will present us her presentation entitled Climate-Driven Health Threats, the Next Frontier of One Health.
Okay, good afternoon, and thank you for the opportunity to talk about how the One Health approach can help us tackle health threats driven by the climate change. And I will start with a very representative example, and it's nothing else but the COVID-19 pandemic. It has become one of the most severe global health crises that humanity ever faced. From December 2019, when the first human cases were reported, until May 2023, when the WHO declared that SARS-CoV-2 was no longer a public health threat of international concern, more than 7 million deaths were officially reported, and but the true death toll is much higher. According to estimates, at least 20 million lives were lost around the world. This underreporting of deaths is due to several factors, like pressure on healthcare systems, limited diagnostic testing, and deaths indirectly associated with COVID-19. Beyond the health impact, the pandemic also caused severe disruption to societies and livelihoods, with the corresponding huge economical losses. Despite the vast amount of research on SARS-CoV-2 and our increased understanding in its evolution and epidemiology, we are not yet in a state to declare confident and exactly when, where, and how SARS-CoV-2 first entered human population. There are several hypotheses. Was it an introduction? Was it introduced through a natural zoonotic source as a spillover event? Or it was released by accident from the laboratory? Was it introduced via the seafood market in Wuhan, China? Or it was deliberately manipulated in the lab and then accidentally released? According to the today scientific evidence, the best supported hypothesis is its introduction from a natural zoonotic source as a spillover event, meaning that the virus passed to humans from wild animals, either directly or through an intermediate host. If we take a look at the broader timeline of the emergence of coronaviruses in people and livestock over the past millennium, we can see a clear pattern. In the past 20 years, new zoonotic emergent infectious diseases are occurring, and their frequency is increasing. And in most of the cases, this involves an intermediate animal host. So to combat the next disease, it's not only a scientific challenge, it's a moral and ethical imperative, because understanding the origins of SARS-CoV-2 and how it sparked a pandemic, it will help us to prevent future pandemics, to save lives and livelihoods, and to reduce global suffering. In the end, this effort highlights our shared responsibility to safeguard human health and well-being. We have already seen that over the past 3 decades, new emergent zoonotic infectious disease occur that originate in animals, especially wildlife, and that their emergence is closely linked with human activities. Changes in ecosystems and land use, intense agriculture, rapid urbanization, and international travel and trade all play major roles. And this human-driven influence shows the profound effect that human activity has on the planet, and form what some scientists have called the fifth sphere of the environment, that is the anthroposphere. The term was first introduced by a geologist, Tom Kieff, in 1944, to declare this profound, this very serious impact that human activity has on the planet. And as characteristically Arrhenius said, human beings interfere with and regulate nature, and their activities have become so potent that in some cases the results may be compared with geological events. The Global Risk Report issued by the World Economic Forum in January this year highlights a fragile global landscape. Environmental risks dominate with extreme weather events, biodiversity loss and ecosystem collapse, critical change to Earth systems, and natural resources shortages leading the 10-year risk rankings. A lot of climate-related hazards, heat waves, extreme events, sea level rise, poor air quality, water scarcity, all of these create conditions that allow and promote the spread of pathogens and their vectors. And in this slide, we can see graphically how the climate change impacts our health. In the middle, at the center, we have our physical environment. And there is a ring around it that shows the four main drivers of climate change. We have rising temperatures, we have increasing carbon dioxide levels, we have rising sea levels, and we experience more extreme weather events. And these drivers of climate change influence both natural and human systems and create conditions like extreme heat waves, air pollution, changes in disease vectors, ecology, or disruption of the water and food chain and supply. I'm sorry. And these conditions are the ones that either trigger or exacerbate existing health problems. For instance, extreme heat and poor air pollution and poor air quality is closely related with respiratory and cardiovascular problems, or severe events, weather events, cause injuries, fatalities. And of course, of all these conditions, we have a burden on mental health, stress, anxiety, depression, fear. And in this diagram, we can see that, in fact, this connection between climate change and health impacts has three primary exposure pathways. First, we have direct exposures, the weather events, floods, storms, heat waves, etc. Then we have indirect exposures mediated by natural systems. For example, the change that is caused in disease vectors. And third, we have, again, indirect impacts that act through human systems. For example, limited food production can lead to undernutrition. And in all this line between climate change and health impacts is mediated and shaped by mediating factors like local environmental conditions, social infrastructure, and the strength of a community's health system, and the measures of adaptation that we have taken. And at the bottom, you can see three green arrows that shows that we have feedback mechanisms, either positive or negative, between our infrastructure, our public health system, and the climate change itself. For example, if we strengthen the infrastructure, let's say, if we have a better urban design, in the same matter, at the same time, will succeed in reducing emissions of greenhouse gases. So climate change is not only an environmental issue, it's also an urgent global challenge that poses significant risks to public health through its influence on infections and on non-infectious diseases and on mental health. And the scale and impact of climate-sensitive health risks is already enormous. Today, 2 billion people lack access to safe drinking water. In 2020, about 800 million faced hunger, especially in Asia and Africa, and 600 million suffer from foodborne illnesses annually, with small children bearing the vast majority of this burden. And heat-related deaths hit hardest the elderly. According to WHO estimates, the following 20 years we are expecting an additional burden of 250,000 deaths per year from malnutrition, malaria, diarrhea, and heat stress, and accompanied, of course, with corresponding direct health costs. We said that climate change is not only an environmental issue, is not only also a public health issue, it's a health equity crisis because it does not affect everyone equally. Its impact on human health varies based on where people live, their income, their access to health care, and their social protections. And unfortunately, vulnerable populations are those that bear the greatest burden. Diseases like malaria and cholera spread more easily with warming temperatures and poor sanitation, meaning they affect developing countries more than developed ones. Air pollution disproportionately affects low-income, urban, or other minority communities. So we are inside a dangerous feedback loop. Climate change worsens health conditions. Poor health reduces people's ability to cope with climate shocks, and then that in turn makes the most vulnerable even less resilient. In this map, we can see the global distribution of risks derived from natural hazards, things like earthquakes, tsunamis, floods, heat waves, etc. But we have a tool in our hands to cope, to address these health risks, and it's nothing else but the One Health approach that provides us with an integrated, unified way of thinking and recognizes that the health of people, of animals, and of the whole planet, the whole ecosystem is interrelated. We can use the One Health approach to mitigate climate and adapt by promoting sustainable practices in agriculture, by reducing wildlife exploitation, and by protecting ecosystem. For example, if we conserve forests, simultaneously we will mitigate climate change and reduce possible future zoonotic spillover events. If we integrate One Health into farming, we will minimize environmental degradation while at the same time safeguard food security. The added value of the One Health approach is that it gives us an integrated framework to work with. Instead of looking at the environment, at animals, or on human health separately, we can connect the dots. Examples include joint human and animal vaccination, integrated surveillance systems, shared health laboratories, and effective communication between agencies, between authorities, veterinary, public health, environmental authorities, etc. And to conclude, I will use a real-world example in the topic of wildfires that is a topic that many Mediterranean countries, like our country, Greece, suffers from. Climate change make us experience hotter and drier summers, and these cause more frequent and more intense wildfires. Wildfires provide smoke and has a lot of consequences, of negative consequences on the environment, on animals, and on humans. And we can use the One Health approach to integrate these, to integrate the measures we can take. For example, we can, we can have all these agencies, involved agencies, environmental agencies. They can monitor air quality and as well as the longer effects that air, deteriorated air will have. Meteorological services, they can forecast the movement of smoke. Veterinary wildlife services, they can monitor and take care of animals, either livestock that has suffered from smoke stress or wildlife that has been replaced or was replaced or injured. Public health authorities can issue warnings to people and monitor the hospitalizations due to respiratory and cardiovascular diseases. And this is an example that gives us the picture. One single environmental event, a wildfire, has caused a cascade of consequences across ecosystems, animals, and human health. So, the benefits of the One Health approach is multifaceted. We can achieve earlier detection of outbreaks. We can be more efficient in resource use through collaboration. We can become more resilient to climate shocks. And finally, we can build sustainable ecosystems, meaning we will have healthier populations. The step to move forward is to strengthen One Health by investing in cross-sector education and training, by building climate-resilient health systems, by supporting joint surveillance and research, and by including One Health in national climate policies. And let's hope, but most importantly, let's work to succeed this goal. Because in the end, there is no human health without planetary health. And thank you.
Thank you very much. Are there any questions? I have one question.
Okay.
It's regarding wildfires that we have had also one in Patras in the summer. Are any evidence that wildfires affect also the quality of water, of drinking water?
Yes, that's for sure. Wildfires release a lot of organic and inorganic pollutants. And these pollutants spread out all around the atmosphere, and they finally deposit either via the rain or by dry deposition in all terrestrial environments. So we anticipate to have water contamination, to have soil contamination, and of course, in this deposition, other, especially in urban settings, we have also urban pollutants from the vehicles, from the transportation. So all these finally find their way and go either to the soil or to water bodies and in the sea. So we expect.
Thank you. Thank you very much for your presentation.
Thank you.
Now we are closing this session. Thank you. A great thank you to all presenters. And now we can move on to a coffee break. I know that it's a long day and we are all a bit tired. Let's have a break and then move on to the next session at 4 o'clock. Thank you very much.
Good afternoon again to this hybrid conference. I would like to welcome to the next session Professor Zaharoula Andreopoulou. I hope she's online. She's Professor in Forest Informatics and Technologies for Green Regional Policy Director. And the keynote lecture is the One Health Approach, One Health, One Planet Resilience Approach. Kyria.
Afternoon. How are you?
Yes,
I'm so happy to be here with you. Can you hear me?
Yes, you can. We can hear you. Yes, thank you very much.
Thank you very much for the invitation. Let me fix a little bit my presentation, and I will be. Let's go in full screen. I think we're ready to start. Good afternoon. It's so nice to be here in this conference. We're very interested in One Health, and that is really a bridge towards all parameters connecting that meaning. I'm here representing MEDOIC, as we call it. It's the Mediterranean One Health Innovation Center. My name is Zaharoula Andreopoulou. Thank you very much for the presentation. I'm a professor in informatics and technologies for green regional policy. And I'm also the chair of the scientific committee of Mediterranean One Health Innovation Center. I would like to present to you the center that is the One Health, One Planet approach. Our approach is based on the European Union policy about One Health and One Planet. This is a new meaning, and human, animal, and environment health are interrelated and interdependent. That is a very basic knowledge. People who are in medicine, in biology, in environment, were very well aware of that meaning. We know that we cannot disconnect human, animal, or environment. And what we need to do is to create a global strategy through which the achievement of this objective of sustainable development is achieved. And One Planet and One Health is a part of the European policy and also one based on the 17 Sustainable Development Goals. The Mediterranean One Health Innovation Center is a partnership between public and private carriers aiming to address the regional challenges of One Health in the Mediterranean region. And not only in the Mediterranean region, we're open to challenges, and we try to achieve that through innovative actions. The center, the Mediterranean One Health Innovation Center, is based in Athens, Greece. It's a non-profit organization, and it is a partnership of two institutions. The two institutions are the International Organization for One Health, named Asclepius One Health, and also the ELGO Dimitra, which is the National Research Organization of Ministry of Rural Development and Food, Greece. We try to ensure long-term success, aiming to address interrelated animal and human health challenges, the food supply chain, and also the protection of the environment in which all of them operate. That means all the natural ecosystems involved in human and animal living. We try to deliver immediate and mid-term benefits to human and animal health, and also to their ecosystem, as we say, all the natural ecosystem, that is the One Planet in the European policy, through the effective application and management of multiple challenges, current and future risks, always with the aim of sustainable development of the planet. Sustainable development has been the main target policy for our planet and for European Union, at least the last 30 years. And we know that all strategies, all initiatives, and all funding programs are based in these sustainable development goals. There are 17 of them, but we can see how are the main objective of MEDOI is established. That is the timely and comprehensive response to risks that threaten the health of animals, humans, and the ecosystem in which they live. So we can have here all these 17 sustainable development goals. We can see here the goal about life in land, also good health, also reduce of inequalities. All these 17 sustainable development goals are involved in that One Health, One Planet objective in the European policy. And what is our the area that we need to help, we need to act? It is practically a Greek initiative. However, we have an international character, and we're based in Athens, as you see here. But we need and we want to act throughout all the Balkan area, the East Mediterranean, the whole Mediterranean area, and maybe if we need, we can expand our action. In MEDOI, we try to strengthen the basic and also the clinical and the operational research through the prism of the One Health. And we need to defend public health and the prevention of new epidemics of zoonose and the treatment of AMR. The surveillance systems are needed to establish an effective One Health surveillance systems through early warning. It is very important to proceed in monitoring and early alert whenever we have a risk in health that can be created in between people, animal, or in the ecosystem. And we know that the barriers in the ecosystems are not existing. Actually, there is no barrier, and it's very easy to have that interrelation and interconnection between all these three actors. So another very important topic, it is the environmental protection and our need to protect the planet for climate change. That is mainly a climate crisis, as we can see in this picture. Actually, the Mediterranean region is particularly sensitive to climate change, but also it is very sensitive to the prevailing socioeconomic conditions. The Mediterranean is a very alive area that keeps changing throughout the years. So we need to study the environment. We need to study the ecosystems in the Mediterranean area, the flora, the nutrition, and all this research need to be focused on the well-being and the welfare of human and also of animals. Another important issue for the health of this one planet. So in that objective on One Health, One Planet, it's the food security and against poverty. These are distinctive sustainable development goals and also United Nations goals. So food is very important either for animals or for humans. So food security is very important because that can be a channel for some diseases to spread. And also we need to produce safe and high quality food to feed living in the planet. Also, we have the animal husbandries. So we need to create good animal husbandry practices and environmentally friendly methods, either to feed these animals or to produce food from these animal husbandries for the people in Earth. It is very important to create an interface that is a policy, a benchmarking material between policy and science. These are two parameters very important that we need to combine them to be able to achieve that One Health, One Planet objective. We need to improve the public perception and the One Health approach to the society and policymakers. And also we need to improve the public perception of how the One Health can help our daily lives. This is very important. Our planet have emerged a special risk, not only health risk, but also economic risk and climate risks. And all these can create a lot of problems interconnected between all these parameters. Our main purpose is research, so private and national wealth in science are connected through MEDOIG. Scientists from Greece and from abroad, scientists from the private sector, scientists from government, we try to connect and have some research and development coordination. And that coordination will lead to research and development efforts meeting the challenges of One Health in the region. We need academic research, and that research needs to be transferred to final users, effective transfer of our academic research, and also product development. Research is only theoretical, but we need to proceed to developing capacities and capabilities to accelerate the development of products related to health and to human, animal, and environmental interconnection. And also another very important factor is the geomapping. It is very important to register in a dynamic mapping way the dynamic of the One Health. What are the parameters, the institutes, the carriers that can help towards that objective? So we need to use all this wealth, all this scientific wealth, but we need to have already registered all them where they are, where we can find them in case of need. It is very important to understand that there is a legislative framework that it is different between countries. That is, in Greece, we have a specific legislation. In European Union, we are under the umbrella of the European Union strategies, but other countries around Mediterranean area and around the world have different legislation. So it is very important to try to harmonize all these legislative frameworks that are used to regulate these types of risks, and also all the policies directed from the governments. So we need to be able to create a benchmarking opportunity for a regulatory legislative framework. But what is our main objective? Our objective is to find one of the three pillars of sustainable development, which is the society, it's the people, it's the well-being of the people, the welfare of the communities, of the citizens. Need to create through that policy, we need to create and set standards. Setting One Health standards, which will promote the well-being of people, animals, and also ensure the environmental sustainability in the area. It is really important to work towards the green environments for the citizens. Smart environments, green environments, sustainable environments, societies and cities and communities that are safe for everyone to live in. Through the COVID pandemic, we have experience the paradigm of Greece to be announced as a safe country, and that was our benefit. And when we refer to tourism, and that is a very specific parameter for One Health and One Planet, it is very important to create safe destinations so that people can feel safe when they are visiting there. It is a competitive advantage for the tourism sector and also for the people that work in that tourism sector, and we know that is a very big amount of people. So we have created a big, extensive network of experts, as we say, partners, professionals of high standards, and always strive to achieve excellent results in everything they undertake. So we have people from private sector, for government, for institutes, from universities, either from Greece or from other countries abroad. And we have always filling up our database of participants of our scientific committee with people with similar interests and similar objectives from many countries, from Greece and also around Mediterranean. You can meet some members of our team. I can present myself. I'm the chair of the scientific committee. We have a lot of participants, and I'm very proud to say that we have a lot of scientists, experts in their standards, that they try to be with us, that they want to participate in that very important topic. I will be very happy to present all of you. This is our president of the board, Ms. Annie Pavlidou. She's not here with us today. She's traveling abroad for another venture. And we have a lot of people, and we will have more. I'm sure that we will be happy to share any of our ideas with you if you're interested, if you're a scientist in medicine, in biology, in environment, in informatics. We will be very happy to have you with us. Thank you. Maybe if there are any questions, I would be happy to answer.
Thank you, Professor Andreopoulou, for your presentation and lecture.
I think I was okay with time.
Sorry? Yeah.
I think I was okay in time, because as professors, we can estimate the time remained easily.
Okay, yes. Any questions from the online? Are there any questions, Zoe? I'm just wondering your present work on this, if I understand correctly, this is a bilateral, joint organization between the two institutes. Is that correct?
Yes.
And
that is established through these two carriers, the Asclepius One Health, which is a private institution, and the Elgo Dimitra, which is the National Institute for Research in Agricultural Development, Local Development. But scientists are not only from these two institutions. There are a lot of sciences that have emerged our center, the Mediterranean Center, from other institutions, other areas, private or government or whatever, universities, and so on.
I've seen that, yes. I would like to ask you, what is your feeling about where we are hearing, let's say we have a person that lives in the communities around Europe, etc., and he hears all the time lately about One Health. So it's very, very, well known as a term, the One Health lately. How do you feel that? Do we work in One Health in real things. I mean, how can I say, with results, not just theoretically talking about One Health, all the universities, etc.,
I understand your question. The thing is that One Health is really something that has emerged lately, as you have said. But that is a real truth that lies beyond everything. I mean, when we have an environmental pollution, let's say in the water in a city, then we have a lot of health problems created by that contaminated water. If we have a contaminated type of food, for instance, let's say we have a problem in the milk. Okay, people coming in touch with that will have health problems. We had the COVID pandemic. We have seen how all these problems created from the environment can be included in that chain between people, animal, and ecosystem. This is interconnected and interrelated. That is a truth that we should understand for a start. Because till now, we try to challenge, to face all these problems. The problems of human health, we deal it with doctors for human. The problems in animals, we try to use veterinarians. The problem in a forest or in the water, we use the biological institute, the forester, the environmentalist, and so on. The truth is that we need, first of all, to understand that meaning, to understand that objective. If we understand that there is only one planet that is interconnected, and we cannot take away one of these parameters, that is the start, that is the main objective for now. The awareness of the people, the awareness of the policymakers about the importance of that common treatment. That is very important. Then the policymakers, the politicians, the government, the institute can take the measures, take the decisions towards that perspective, the perspective of One Health and One Planet. So we have a two-stage approach for now. I think that now we are still in the first approach, the awareness approach.
Thank you.
And in the second step, I think we will be able to proceed with more concrete measures. But people in the policymaker need to understand it at first.
Yes.
And conferences as the one today are very important towards that approach. And we thank you very much for the opportunity to present ourselves.
Okay, yes, I understand. This is the reason why we have this project, which is running with the other 3 universities, institutes around Europe, because European Union would like to fund something on workshops and, for exactly the reason that you already said, but taking the fact that, for example, AMR, because we're working, Zoe Anastopoulou, is working with AMR, we still have the highest how can I say, use of antibiotics in Greece, for example. So that means we have not understood what is the problem about.
The resistance in antibiotic, the resistance, that is a main environmental problem, I would say. That is an environmental problem because it goes through the whole environment. It can contaminate the ecosystem itself.
Let me tell you, we're detecting antibiotic-resistant bacteria in sewage all the time because we're doing sewage epidemiology. So what's your opinion about that? Because it's a running problem. I mean, even if you work on awareness now, you need now to solve it, not somewhere in the future. You understand me? So there are some urgent issues that we need to approach, to solve in some countries.
As I said, it's urgent. As you said, it's a crisis. And when we say the word crisis, it means that we need to act now. We need to act yesterday. So all this type of research is very, very important. the resistance in the antibiotics is a very important environmental issue. And we need to face it as an environmental issue because it affects the whole planet, the whole environmental system. As when we say ecosystem, we mean the total thing, the whole chain.
Okay. Thank
So
you.
we need to follow that. That is one of the most important. And I think also the geomapping is very important because we need to know where is our resources.
Okay.
When a risk appears, we need to be prepared and previously know where are the experts, where is the laboratories, where is the research. So all the existing research, similar experts, similar laboratories, similar methodologies, and institutions related should be mapping, should be registered, and also register in a spatial way to know where everything is. That is very important also.
Okay, thank you very much.
Anyway, we're here with you. We can help you in any seminars through our list and database of experts. We will be happy to help you and create that awareness topic, as you said earlier.
Thank you very much. Thank you for your presentation and your presence here. Thank you again that you are in our conference. Thank you.
Okay.
Let's move then to our next speaker, who is on site, not online, in this conference. So, Panagiotis Dimopoulos, a friend, first of all, professor in ecology, chair in the biology department, University of Patras, Greece. Climate change, health of ecosystems and of people, very experienced in climate change. I have heard several recent talks in climate change, so he's gonna transfer to us his experience on climate change, his perception and his opinion on this issue, which is very important around Europe. We all discuss about climate change. We see the results. I'm not quite sure that we understand and we have worked on the solutions on this. But let's hear Professor Dimopoulos.
Yes. Hello, everyone. Thank you very much, Professor Bandarakis, for the invitation. I'm very glad to be here. I'd like more to be on site and not to participate in congresses online. I would like to start now with my talk, which is the interlinkage of climate change, health of ecosystems, and the health of people. Yes, okay. First of all, let's try to clarify the terms. What is the climate variability? This is the variation of the average values of climate parameters, which means standard deviations, extreme values, on all spatial and temporal scales beyond the typical weather systems. This variability can exist either due to natural internal processes in the climate system, which means internal climate variability. And here we have two very well-known phenomena, the El Niño Southern Oscillation and the La Niña, the North Atlantic Oscillation. Here we can see these two drawings for El Niño and La Niña. The climate variability can also be due to external mechanisms, which means a natural or man-made external climate variability. And when we refer to a climate phenomena, the boundary between internal and external processes is relatively blurred, given that the Earth's climate system has changed. An example is the Heinrich episodes in the last glacial period when iceberg clusters broke off glaciers and moved into the North Atlantic Ocean. Now, the climate change. The climate change is the global climate change and in particular the changes in meteorological conditions on a larger time scale. Climate change as a result of global warming is related to long-term weather phenomena on Earth, such as temperature, sea level, precipitation, rainfall and snow, mainly the reduction of precipitation of rainfall and snow, which is one of the main causes of droughts and problems we have, especially in the Mediterranean during the summertime, spring and summertime. And of course, the Earth's climate has changed radically many times since the planet formation. The planet was created 4 billion years ago. And throughout these changes in the climate of the Earth, we had fluctuations between warm periods and periods of glaciation. These cycles have lasted tens or thousands of millions of years or millions of years every time. So there is a difference between climate change and variability. I'm saying I tried to clarify these terms because there are different opinions from some people who still claim that the climate change does not exist. So the difference, it is evident, and that depends on time. In climate variability, parameter values fluctuate around long-term and unchanged mean values. In climate change, there is a continuous and long-term change of the average weather conditions or the weather range. And here we can see the climate variability in the two diagrams. A and C is the climate variability, and B and D are they represent the climate change. So let's see now, after we have clarified these terms, let's see how important this climate change is for the economists. This is from one recent World Economic Forum in Davos, where we can see that the extreme weather events and biodiversity loss and ecosystem collapse, all the green ones, rank in the risk rank of high risk. These are in the top of the list of the 10-year risks. So you realize that the extreme weather events, which are expected to become a greater threat in the future, are among the first risks from an economical point of view for the people for the ones that are gathering in Davos every year, and they're discussing about the future and the economic consequences of the climate change and all other important issues related on finance in the future. And also you see that also the natural resources shortage is here, and the pollution is also among the most important risks for the following years. And it's important to say that even the biodiversity loss and ecosystem collapse is ranked among the most among the highest risks for the future. Which are the causes of climate change? We have the combustion of fossil fuels such as oil, coal, and natural gas, in which greenhouse gases are emitted in the atmosphere. Other human activities such as agriculture and deforestation also contribute to this proliferation. And the problem is that these gases trap heat in the atmosphere, and this is what is called the greenhouse effect. And we must remember that the global carbon dioxide emissions have risen rapidly since the mid-20th century, coinciding with the sharp rise of the plethora of global socioeconomic indicators, a phenomenon which is called the Great Acceleration. And here we can see how the greenhouse gas emissions have increased from 1850, when it is called the industrial era, up to the 2021. And these last 170 years, the temperatures have risen faster than in any other time. Of course, this time that we have all this increase in the greenhouse gas emissions, we have the GDP, which is the gross domestic product per capita has grew faster than the world's population, with an average, the average per person in the world now 4.4 times richer than in 1950. And of course, since 1950, the population of the world has tripled from about 2.5 billion to almost 7.5 billion today. So we see that the fact that the gross domestic product increases and even per capita, although this is the average, you will see that there are also some consequences, some negative effects to the life and the human well-being. Here, this is what we see, that we have this, during this 20th century, we started in 1850 from the world's population of 1.2 billion people, and now we have more than 7.5, and in 2050, it is estimated that the population of the Earth will be 9.4 billion people. Of course, we must remember that without the greenhouse effect, the average temperature of the planet would be minus 18 degrees. However, the daily human activities enhance this effect, causing an even greater increase in the planet's temperature. In 2019, the level of carbon dioxide in the atmosphere was in the historical record according to the World Meteorological Organization, more than 150% compared to 1750. So climate change, of course, affects all regions of the world. Ice in the polar regions is melting and sea levels are rising. In some regions, extreme weather events and heavy rainfall increasingly frequent, while other areas are impacted by heat waves and droughts of great intensity. We see this almost every week all over the world. In one region we have flooding, and in other areas we have dryness and much impact in the life of people. Climate change is a very serious threat, and its consequences affect many aspects of our lives. These are consequences for nature, social threats, threats to businesses, territorial threats. Impact on nature, first of all. We have high temperatures, drought and forest fires, floods, freshwater availability. This is one of the major issues related to the climate change. That is something that also in Greece, where we are a Mediterranean country, we have a shortage of water, especially for watering people or also for irrigation purposes. This also causes conflicts in other areas of the world. Also impacts on biodiversity at habitats and species and level, territories, inland waters, marine environment, sea level rise in coastal areas. Of course, we have an impact in drought and forest fires, an increase in the frequency, intensity and duration of periods of drought. Of course, here in Greece, we have such droughts that are increasing and are most frequent and with higher, and the intensity also increases. We have secondary effects from droughts on transport infrastructure, agriculture, forestry, water and biodiversity. This is because all items are linked in nature and in the environment. Nothing is autonomous, everything is interconnected. Water is connected with nature, is connected with agriculture, is connected with forestry, and you realize that when there is an impact by the climate change, this is affecting also the life of people through the services that are provided freely and abundantly by the ecosystems which are in good state, in good conservation state. Extreme droughts are affecting, of course, agriculture, the energy sector, and public water supply. Extreme droughts are becoming more common in Europe, and especially in the Mediterranean, and the damage they cause is also increasing. The most common and intense droughts increase the duration and intensity of the forest fire season, especially in the Mediterranean, expand areas at risk of forest fire, convert areas which are not currently prone to fire into risk areas. It is widespread the intense impacts and losses and damages attributed to climate change, like water availability, agricultural production, animal and livestock health, infections and epidemics, which are expected to come more and more often in the world. These effects are due to multiple parameters of the natural climate that are increasingly attributed to human influence. In agriculture and ecological drought, fires, heavy rainfall, floods, increase in heat wave phenomena. Here we have not only the agricultural drought, but we have also the ecological drought. So both are important. Of course, the one is more related to directly to the economic sector, the agriculture, I mean, but also the ecological drought means that the ecosystems will not have what is needed for their survival and in order to be conserved in a good state. And this is indirectly affecting the human well-being, and it is affecting, of course, all the other activities related to the preservation of the natural ecosystems in good state. Here we see all the global natural disasters from 1970 to 2023. And we see that as we go from 1970 to 2023, all the different natural disasters are increasing, with most of these, if you see the diagram here, you see that the flood is the most frequent and the extreme weather are the most frequently occurring disasters the last years after 2000. Here we see that what is happening, the global natural disasters at the world scale, at the European scale, and in Greece. Of course, here we have two events. The one is in 1981, that we had these total economic losses from disasters as a percentage of GDP. And here we had this big earthquake in Greece in 1981, and the second one, which you see here, which is it is only for Greece. This is the earthquake of 1999. So all the time, all the natural disasters are interpreted into economic loss. And this is why the economists always are interested in finding how much of the infrastructures will be destroyed in order to substitute these infrastructures. And of course, this means money from the budget of Europe, money from the budget of Greece, national budget. The social threats, of course, because of the climate change, is for human health, but also for animal and plant health. The climate change is unlikely to create many new or unknown health threats, but the existing effects will worsen and will be more pronounced than today. So according to the projections, the most significant health impacts from future climate change will be increase in mortality, deaths, and morbidity, diseases associated with heat waves in summer. At the same time, as it is estimated, we will have a reduction of mortality and morbidity associated with cold in winter. Of course, it is expected that the increase in mortalities will be more compared to the reduction of mortalities. increase in the risk of accidents and the impact of general well-being from extreme weather events, floods, fires, and storms, and the changes in the impact of vector or rodent-borne diseases, or in the impact of waterborne or flood-borne diseases. So we see here how much things will change comparing the 2005 distribution and the 2050 distribution. You see the blue and the red curve in this diagram. Changes in the seasonal, another effect is the seasonal distribution of certain polyallergenic species, the range of viruses, the distribution of pests and diseases. We have also the animal diseases that increase, the challenges for animal and human health in Europe. We have in Greece here, you remember, I don't know the word in English, ευλογιά, Apostole, but this is one of the effects of the climate change. I mean, this is one of the zoonotic disease related on animals, and this is because of course, of the climate change effects. We have also emergent and re-emerging organisms harmful to plants and diseases affecting forest and crop systems. And of course, hazards related to air quality and ozone changes. Of course, these health effects include premature mortality, cardiorespiratory diseases, cardiovascular and other cardiometabolic diseases, sexual and reproductive health, infectious diseases, cancer, respiratory diseases, poor mental health, etc. From 2030 to 2050, the climate change is expected to cause 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress alone. In addition, climate change affects the social networks, socioeconomic factors, environmental determinants of health and health systems, including supply chains and global security systems, as well as the overall resilience of healthy systems. And all these are exacerbating negative effects on population health and health inequalities, because we have to remember that climate change impacts in an unequal way the poor areas in the world and the poor areas even in Greece. The poor regions are more affected by the climate crisis. So at least in 2014, at COP28, the Conference of the Parties, more than 120 countries adopted the Declaration on Climate and Health. This is very, very good. I learned also that some of the medical schools in Greece started having their programs, also some courses related to climate change and health. So the climate crisis is also a health crisis. This is also included in the COP28 decision, and this is important to refer and with emphasis that the climate crisis is also a health crisis, and that people's health can benefit from climate action. The declaration promotes the health arguments through climate action and the co-health benefits of mitigating and enhancing the resilience of health systems to climate change. So they give emphasis now to both crises, the climate crisis interconnected with a health crisis, and that's why they want also to promote mitigation and resilience of the environmental systems, which of course goes also to the health systems. Currently, the effects of a climate crisis are already leading to large health burdens and health care costs. For us, it may be only the environmental issues, but for the countries and the member states of the EU, it is the costs for health care which will increase the following years. And the health systems will be in danger and in risk the following years if not taking measures to mitigate the effects of the climate crisis. Today, the climate crisis is turning into a health crisis. 5 million people die every year worldwide due to suboptimal temperatures. 37% of heat-related mortality is attributed to anthropogenic climate change. The last few years have been the warmest on record and high since we have the possibility to record the temperatures, and the high temperatures claimed the lives of more than 60,000 people in Europe alone in 2022. 2024 was the warmest year in the history of records from 1850 to present. The global average temperature on the Earth's surface was 1.6 above the pre-industrial levels. And imagine that in the Paris Agreement, we had set the target of not having an increase in temperature more than 1.5 up to 2030. But now it is already 1.6 above the pre-industrial levels. And as we realize, after the policies of USA, things will become worse because they do not participate in any agreement for the climate crisis and how we take measures to tackle the effects of to tackle the climate change. So you realize that Europe is doing what is best at a good level, although this is not a union that contributes the highest amount of pollutants in the world. It is China and India and the USA, of course. In 2024, as we said, the World Health Assembly, they talked about consultation and partnership, monitoring science and evidence, building infrastructure to mitigate climate change, and supporting countries to protect human health from climate change by investment and strengthening the resilience and adaptive capacity of health systems, ensuring optimal healthcare delivery in an ever-evolving landscape, promptly address the wide range of health impacts of the climate crisis to ensure human well-being, resilience of health systems after preparation and to respond effectively to crisis, maintenance of their core functions when a crisis occurs, and based on the lessons learned during the crisis, reorganize themselves in circumstances, if circumstances so require. Here we see that these are the schemes that the scientists are trying to offer to the ones who are taking the decisions. This is a schematic summary of the main pathways through which climate change affects the health of the population. So we have moderation and adaptation. See, these are the most always suggested schemes and pathways, mitigation and adaptation. We go on since I'm more than my time. The mental health and the global climate crisis. The climate change also worsens many social and environmental risk factors for mental health and psychosocial problems that can lead to pulmotional distress, development of new mental health conditions, and the worsening the condition of people who are already living with these problems. Mitigation, addressing health, translating the health problems associated with climate change. These are, I'm finishing now, I'm trying to shorten it. The climate science approach is focusing on health. We have some strategies which have the potential to make the effects of the climate crisis more tangible, and they can also prompt stronger action to reduce the pollution that changes the climate and improve resilience through more aggressive adaptation efforts. I had something about the cities, which play a very important role in order to achieve a climate neutral, sustainable, and healthy environment for people who are mostly living in the cities. And the cities, due to their high population density, have many potential advantages after reduction of the amount of travel and the reduction of travel time, reduction of the number of cars, reduction of car dependence, reducing the amount of energy used per person. How easy are all these, of course, but the scientists are always trying to suggest things that the politicians should decide. Limiting the consumption of building facilities and infrastructure and keeping a variety of choices between workplaces, providing services and social contacts, and limiting the loss of greenery and natural areas outside cities, among other things. Here we see that out of this survey of European cities, we have 4 key urban patterns on the European continent. You realize that only the last one, the first one would lead to 1,124 the mortality, deaths per 100,000 inhabitants. But here the most green one, the low density cities, we see that the deaths are much lower compared to the previous other 3 urban cities schemes. Of course, these are nice drawings. It is possible to be made, but not very easy in the cities of our country, which are developed in other areas, in other eras, other periods, and now it is very difficult to be reconstructed. But some good interventions can happen so that we provide to the people, to our people, more qualitative conditions of life. Okay, I'm proceeding. So the loss of biodiversity is an issue because we said we are talking about ecosystems, which includes biodiversity, climate, and health of people. So the loss of biodiversity is an issue of climate, of business, of food security, of security, health, justice, and between generations. We said that the climate crisis affects more the poor, the poorest areas in the world, the poorest areas in a region, the poorest areas in a city. So there is also the climate crisis injustice. The justice of the climate crisis also mainly affects the poor people. And you see that the health is one of the big issues. The destruction of nature increases the risk and reduces our resilience to diseases. Nature has also a beneficial effect on people's mental health and well-being. So these 3 crises are interrelated, and climate change accelerates the destruction of the natural environment through drought, floods, and forest fires, with consequences for public health. The loss and unsustainable management of nature are in turn key causes of climate change. So like all the crises, biodiversity, climate, and health crises, their solutions are interconnected. Nature is a vital ally in the fight against climate change and addressing the health impacts. We have some conditions which facilitate the individual and collective actions, and this is the inclusive governance, the economy and innovation, synergies between climate action and developmental actions, behavior changes which are supported by policies, infrastructure, and socio-cultural factors, and some conditions which, of course, constrain individual and collective actions. This is poverty, inequality, and injustice, economic, institutional, social barriers, skills barriers, and lack of countervailing benefits related to the Sustainable Development Goals. So you see the scheme, which is the government, the civil society, and the private sector, which should cooperate, collaborate, and have synergistic actions so that we go against the climate and the health crisis and the biodiversity crisis. So in order to finish, this is what I believe, on our path to sustainability, we need to look beyond tomorrow. to create a better future, we need to be able to imagine it. Thank you very much.
Thank you, Professor Dimopoulos. It was very extensive and analytical about climate change from the view of someone who works in the environment, and of course, you understand the impact of in health. Any questions? I have a question.
We discuss in Greek, eh? Okay.
No, because we
yes,
have
yes, I know. I'm
online.
joking. Yes.
You said about you connected the environment with health easily. It can be found. This connection can be understood. This connection, but if we say that we are, how can I say, in a very optimistic environment, we are very optimistic all by ourselves. Governments work perfectly, etc., etc., and we change the environment issues. How long it will take to go to results to better human health, to your opinion? I mean, if we start now, doing everything that is needed.
Yes. Okay, this would be it's very optimistic. If we could start now, it means that we could do all the actions needed in order to take measures against the increase of the temperature, but we see the opposite. But if we, okay, it is a hypothetical scenario, of course, because the other way around, the world goes the other way around. As we mentioned before, the USA has now left the Agreement of Paris, so we have all these efforts for the gas and fuels in the seas, in the Mediterranean, even in Greece. So it means that we are on the other side. And now I was reading that the Council of Europe now decided until 2030, until 2040, to reduce 90% the greenhouse gas emissions. But how is it possible? I mean, this is not possible. That's why I cannot answer to your hypothetical scenario, because the real data are on the other side. So it is controversial, in my opinion, at the one axis, European Union, to make efforts in order to have this transition to more green economy and to more green conditions, and at the same time to be in favor of mining and working for research on natural gas and other materials. So I'm not optimistic, although what I have shown here is very, very pessimistic for the ones who have heard me. But I'm really very optimistic as a person, and as a scientist, I'm always trying to encourage my students that we have to try, because the collective efforts should go in the direction that we can change not the world, but we can change some things of the world, especially in Greece, that we have a very important advantage. We have the natural capital, which is the advantage all over Europe. Nobody can realize this. Even our politicians, they say always that Greece has a very good, nice environment, but they do not realize how important this natural capital is for the human well-being in order to stop all the negative effects of the climate crisis. Thank you very much.
I did this simplified question because we tend to say that everything it can be done, we can solve it. It can, even if everything will be done, will not solve directly.
No.
So it needs time, everything. So we don't have the excuse of, okay, we can start later. There's no later on this subject now.
We should have started many years before, and without, sometimes we start something, not in Greece, also in Europe and at the global scale, and then something goes us backwards. And this is the problem. We don't have all the same speed in the direction of reducing the greenhouse gas effects and also to have the same development of wind parks and all photovoltaic or whatever is needed in order to decrease all the other energy sources.
Okay, thank you very much. Do you have any questions, Angelina? No? Okay, good. That goes to the next part, the next session. That is the session about policy. So who is better to discuss about policy from our next moderator, Anna Mastorakou, who is the Deputy Regional Governor for Public Health, region of Western Greece. This roundtable will be run by Mrs. Mastorakou, and also she will be accompanied by Professor Dimopoulos. And the rest of the speakers are online. We have a very significant people working in WHO, in Athens, for example, Thanos Miloneros, Sinaya Netanyahu. And I believe that it will be really fruitful to discuss about policies, because if you remember, all days today and yesterday, we discussed scientifically, but everyone turned to say that we need good policies on that. So, Ms. Mastorakou, you can do it from here if you like. No? Espiro, δεν μπορεί. Από εδώ.
Όχι, γιατί δεν μπορεί να αλλάζει.
Okay, okay. Okay. You can sit here if you like. Yes. You run the round table.
Ναι. Okay. Good afternoon. Thank you very much to Professor Vandarakis for the invitation. Today I will share with you what happened to Patras in August 2025. It was a climate crisis, mega wildfire, who struck Patras on August. So you see the pictures there. Strong shock, no? To the city. First time the city was threatened by this mega fire. Here we see in this map what about the area, the white area of the fire, which was in the margin of the city and within the city. So it was a big emergency for our town. Now, let me share some lessons from this devastating mega wildfire that struck Patras on August 12, 2025, an event that profoundly shaped our understanding of preparedness, public health, and climate resilience. In just a few hours, more than 3,000 hectares of forest and agricultural land were burned. Over 90 homes were damaged, critical infrastructure, local businesses, olive groves, livestock units were affected in this field. We are fortunate that no human lives were lost, but we were confronted with burn injuries, respiratory distress at our hospitals, and widespread environmental contamination. Communities were exposed to dangerous air pollution, compromised water quality, and long-term ecological disruption. Open landfill sites continued to burn for days, causing prolonged and intense deterioration of air quality. This crisis became a powerful reminder that climate emergencies are not theoretical future threats. They are present tests of the adaptability and resilience of our health systems. What worked in the critical hours here in Patras? Data-driven risk mapping using high-resolution climate data and real-time meteorological forecasting informed rapid and helped for rapid decision-making. Civil protection alerts played a crucial role in safe and timely evacuations at the communities. Unfortunately, multiple arson attacks occurred at the same time, stretching response capacities. We have multiple spots at the same time in our city. Despite this, our hospitals, some located inside the fire zone, remained operational and effective, demonstrating strong health system readiness. The government of the western region of Greece declared, of course, a state of emergency. Now, the first problem was that the people were in panic, so we have to have clear, timely, and actionable public health guidance. We have to put public health in front line. That was not easy to do that. So a press release on August 13 about some guidelines for the community, about water safety, air quality hazards, and safe management of toxic ash. Within hours, the recommendations were used. So we said 3 things. Do not drink tap water, because it was a very high possibility to have a damage in the water network from the fire. And we have to repair this damaged network. We have to do superchlorination of water, and then to be able to drink this water. Bottled water was distributed for this community at that time. It was about a week, this problem. In some regions, we have a big problem with water. So it was not told to the people. Could you imagine what will happen? These people will be contaminated with maybe some disease. And this is a very good recommendation for the first days. The second recommendation was to not use masks or remain indoors during periods of heavy smoke. It was a bad situation at that time. And the guideline was to not smoke inside the homes, do not open candles or vacuum cleaners indoors to prevent further deterioration of indoor air quality. The third recommendation was handle ash as a toxic material, requiring protective measures. This was a shock too for everybody. No one can believe that ash was toxic or not water, drink water. It was a shock for the community. So we went, communicated on people in communities, telling about why they have to do this recommendation, and they understand. So we have a good collaboration with community at this time. A One Health approach was essential at that time because we have so many issues. We have water safety, including emergency chlorination of damaged networks. We have air quality monitoring, as the Born landfill released dust particles PM2.5 and PM10. So we have to alert people about this, and we observed that at the evening and early morning we have deterioration of this air quality. So the guidance was to be at home at that time. We have disposal of dead animals, protection of agricultural land, so many things. And we have also the burning of a customs warehouse containing 550 vehicles, which created an exceptional complex emission scenario. And we required immediate petitions for removal of toxic waste. And this was accomplished 2 months later.
from the government. These realities confirm that public health expertise must be central in climate disaster management. Environmental impact. We have to do some monitoring about toxic fire byproduct. It's not only the air, it was dioxin, furans, heavy metals, and other persistent toxic chemicals. We have to map the potential risk areas, covering livestock units, boreholes, and cultivated areas. This was done by our network, government network inside the Western region, collaborating with environmental department, with veterinary department, agricultural department, common health department. We have to do the work to map where is the potential risk areas. And this was very, very important. Now we will have an ongoing study about environmental monitoring and research collaboration with the University of Patras and a research institute in Greece, Democritus, which has the capability to monitor dioxins and the furans and everything. Health surveillance. We understand that we have a problem because it was very, the burden of air quality influence we have the stress in some people. So we decided to do a spirometry program, lung program, on the community. This was done with the pulmonology clinic of the University of Patras. We have in our service in Common Health, we have a experimental program, we have pulmonology. So we work together with university, and we have a community spirometry screening revealed, the first data is that we have an impact of 35.6% deterioration of a small infection on small lung airways among affected residents. And this was very important to detect the affected people, to come to therapy, so to avoid permanent lesions. Second, support for residents and first responders, it was very essential, and help vulnerable people on the first needs. Community resilience is a very critical pillar. Community resilience is as critical as institutional readiness. One of the most strongest lessons was the power of community knowledge. In villages or regions where residents understood evacuation routes and basic firefighting practices, losses were significantly reduced. In many cases, people literally saved their own homes by acting quickly, confidential, and collectively. Prevention, coming to prevention, this is a year-round responsibility from the government, of course. Effect prevention requires investment and year-round action, including fire break zones in forested areas, land clearing and vegetation management during winter, water reservoir for aerial and ground firefighting placed strategically in the mountains, clear evacuation route plans for each village and community. And one must remember that summer is not only fire season, we have to worry about the flash flooding at the winter. So we have to be prepared. Climate crises do not occur in isolation, they occur in a sequence. The lessons here are very clear. First one, the One Health approach works and worked very well at in this town. We are very lucky to have it because we didn't know that climate crises were coming, but we were ready, so it was very useful. Second, clear time public health guidance save lives. I think in a crisis, public health must come to front line, because it's not in front line, it's not under the carpet sometimes. Health system resilience must be strengthened. Prevention requires strong public financing and infrastructure. Environmental impact research is not optional. It is an obligation for our generation and the next generation, because toxic chemicals are out there, and I don't know if you don't know if these chemicals were coming to our food. So it's not optional. We have to have an environmental research. Community training and empowerment save lives. Looking beyond our borders, an European climate change hub must be there. Knowledge, practice, expertise, good practices. The experience of Patras highlights the urgent need for cross-border collaboration, cooperation, knowledge exchange, and stronger European mechanisms for climate resilience. By sharing expertise and best practice, we can be a more prepared and protected Europe. And this was a very viral picture at the fire in Patras. It represents One Health in the field, a human, an animal, and environment crisis, climate change crisis. Thank you. Do you have any question? Yes.
It's great to see an example and that at least certain ones of the responses worked very well. So what would interest me is for how long did these emergency measures still have to go on after the fires? For example, when was water back to normal quality, or how long were the airs polluted, and do you still have any problems with that right now based on what happened, like, was it 2 years ago?
No. The water was repaired in about 1 week in all regions. The air quality, it was a problem prolonged for some times because we have landfills burning for some days. So I would say that was about 15 days. We have this problem. The spirometric program was done in the field of bad air quality. So we see now that all are going to normal. And toxic chemicals we're going to measure from now on. The science told me that it will be prolonged about 1 year, 2 years, or 12 years if you're speaking about eternal chemicals. So we have the time to do this work. Thank you.
Are there any questions?
Just, I know that you are very prepared, so I'm going to ask it just for our public to listen to that. The thing is, we are talking about a region that has the ability to do all these things in a very urgent situation like you described, and you are very sensitive on that as a political person, because you are a medical doctor as well. So the thing is, in other situations, there are not all these abilities to deal with these situations. What's your opinion about every region? I just tell you a sentence. Every region should have a risk assessment protocol for any situation, and very, how can I say, specified risk assessment protocol for the region itself, for the problems and any specific situations that they deal with. We don't have it, if I know correctly, not in region, in general. We don't depend on this. What's your opinion on that?
It's a good question. I think we have to have a action plan in our country, because we don't have that. We have to put public health in the front line. It was not, and it's not the case for our country. Everybody is talking about climate crisis, okay, but public health, where's public health? I struggle very much to put this public health guidance in the front line. So this is not, should not be the case. The case is that everything has been put in a plan for every region of this country, and every ingredient must be placed there. Spirometric program, it was a very good decision, I think. Psychological support is a very good decision in the field. And all this management of water quality must be put in an action plan. I think we are going to work on this and give a letter for the government to take account the experience of this town, because we never seen this before, a mega fire, and the lesson here, I think it's very important to tell everybody. Thank you.
Thank you very much. Now we will move on to the policy panel discussion, society's response to the climate crisis. This panel will be moderated by Dr. Anna Mastorakou. I would like to mention that Professor Tony Holohan informed us that he will not participate due to unexpected illness. But we will move on with this panel discussion. Thank you very much.
Now, working from this point, it is an honor to welcome you to this policy panel on society's response of the climate crisis within the ONE Bridge project. I'm grateful to moderate today's discussion with such an exceptional group of experts. Our session highlights the deep links between climate, environmental, and public health connections that are no longer theoretical but part of everyday life. These realities are shaping our policies, our systems, and behaviors. At the heart of ONE Bridge is the One Health approach, recognizing that human and animal and environmental health are together. In a time of accelerating climate instability, this approach is essential. Climate change increases heat-related illnesses, vector-borne diseases, food insecurity, air pollution, mental health pressures, and ecosystem damage impacts that fall hardest on the most vulnerable people. ONE Bridge brings together policymakers, scientists, health and environmental professionals, digital innovators, and civil society across Europe to co-develop strategies and strengthen resilience and preparedness. This aligns with WHO priorities for integrated evidence-based policies and strong governance. Digital innovation will be a core key, offering tools for early warning, monitoring, diagnostics, and better decision-making. But we must also invest in people, equipping professionals, empowering youth to advance the One Health vision. Here in Western Greece, we see daily how climate change affects public health, agricultural biodiversity, and regional development. As a regional authority, we work to build resilient structures, promote prevention, and support vulnerable groups. But we need strong collaboration and partnerships. In July 2025, we have this mega fire in Patras. The management was very complex situation. So these factors confirm the fact that the public health expertise must be a high priority issue for the climate change crisis. The climate crisis demands shared responsibility across borders, disciplines, and generations. The ONE Bridge project provides a unique space for this cooperation. Our response must be holistic, inclusive, science-based, and people-centered. At this point, I also pleased to announce a significant milestone. Western Greece, as an active member of WHO regions, will host the 2026 annual conference. the first time a Greek region receives this distinction. This honor reflects our commitment to public health and position Greece at the heart of the European dialogue. So I want to thank Bettina Men for this wonderful opportunity and thank all of you for participation in a commitment to advancing the One Health approach. Now it is my pleasure to go to the speakers. Unfortunately, the first speaker, the second speaker is not with us, but I give the floor to Professor Panagiotis Dimopoulos, who is Professor of Ecology at the Department of Biology of the University of Patras. The floor is yours.
Thank you very much. Thank you very much for this opportunity to participate in this policy panel. I'm going to say a few words about the environmental changes in Greece and how this can be prioritized, because we have to take into consideration that Greece is a Mediterranean country, which means a Mediterranean climate, and at the same time it's a Mediterranean hotspot as concerns the vulnerability from the effects of the climate crisis. In Greece, which is, as we said, a Mediterranean country, we have all these problems related on the climate change, and this climate crisis intensifies interconnected risks to human, animal, and environmental health. And this is the core, as you said also, the core of the One Health approach. And of course, this framework emphasizes the holistic strategies in order to address zoonotic diseases, food security, and ecosystem resilience. Holistic strategies, but I want to emphasize the fact that we need implementation, and of course, we need this holistic strategy to be real holistic. So, because everything is interconnected, and if we do not work with one of the parts of this interconnected event, the phenomenon, then nothing is going to happen. So the One Health, the environmental changes that can be related to the climate change should be prioritized in Greece, and this can be ranked by their urgency and multi-phased impacts as the following: heat waves and extreme temperatures. Rising temperatures and are the leading to more frequent and intense heat waves, causing thermal discomfort, heat-related illnesses, and increased mortality. And of course, also these events also stress ecosystems, promoting the spread of vector-borne diseases. And of course, this prioritization is critical, as Greece has seen intense heat waves with projections indicating worsening trends without adaptation. The problem is that many of the scenarios we had for prevention and for prevention of the negative effects of the climate change in Greece were based on old climatic data, and this is one of the problems. Until 2020, it was the old climatic data. So you cannot plan for the future if you are based, if your scenarios are based on old data. So I think that now we have started at least our strategies to be based on more recent scientific data, and this is already a step beyond to face more effectively the negative impacts of the climate crisis. The second priority should be wildfires and air quality degradation, because we said that we are a vulnerable area for wildfires as a Mediterranean country with Mediterranean ecosystems from Crete to the northern Greece. Of course, the wildfire risks increase due to drier conditions. Of course, all these are also related to the agricultural sector, to the primary sector. after these prolonged droughts and land use changes, because in Greece we have additionally to the droughts and the drier conditions, the reduction of rainfall and snow, we have also the abandonment of the countryside, which means that all this makes things easier, so that we have extensive fires because the wood material is increasing after the land use changes in Greece. So this is one of the issues that should change in order that people can stay in their places, in their villages, in order to cultivate and in order to have their animals, which are used as tools for management of the biomass, which otherwise is enlarging, and this is the first fuel for the fires. So the water scarcity also, the droughts, we know this problem, not especially here in Western Greece, but in Attica, for example, as well as in other areas of Greece, because the droughts are impacting the water resources, the agriculture and biodiversity. In Attica, in order to have resources, water resources for people, which is more or less the 50% of the total population of Greece, we need to take resources from other regions of Greece. This is one of the issues that should be taken into consideration, because we cannot affect the resources of one region in order to provide water to another region, because we have, as we said, to take care of the holistic and synergistic actions, which means not to take something from one area for another area, in order to have a balance of the different sectors of the economy, and not only to have the water resources for watering the people of Athens, leaving out the food sector and the food sector, which is related on the primary sector. Of course, the floods is also due to, these are the two edges of the one. In the one edge, we have less water, and that's why we have drier conditions, less precipitation, and at the other edge, we have much water, which is very sudden, and it means that we have these flooding events, which also cause many damages to the infrastructure, which of course has economic loss is much, not only from the point of view of financial, but also to the society and the people who are affected by this flooding. So these are the priorities which are in line with the National Adaptation Strategy of Greece, which identifies health as one of the key sectors among 15 others, but highlights gaps in implementation. This is one of the most important issues, especially in Greece, that we have plenty of national strategies, regional strategies against the climate crisis, but what is still missing is the implementation in order to have effective measures and actions in the different regions of Greece, depending on the intensity of the climate crisis. Thank you very much for this first round. Thank you.
Thank you. Is there any question? Well, Greece suffered for different things, climate change crisis in different reasons. In Thessalia, we have a massive flood informed Daniel. Here we have the mega fire. So it's very important to have an action plan for every situation, and the scientific support for this, I think. Okay.
The scientists always have to give evidence and give results from their research. And then the politicians should take these results and use in a wise way so that the decisions are in the direction of effectiveness, of increasing the effectiveness to face up with the climate crisis impact the societies. This is the important thing, because the changes after the climate crisis always impact the society and the cohesion of the society. Thank you.
Thank you. Now we have Dr. Tony Hollehon was the second speaker. He is a director of a WHO collaborating center in One Health, and he is an adjunct full professor of public health at University College Dublin. But he's not with us. He has to cancel this this presentation, but he had some notes from for us. So I will read some points of these notes. One Health framework integrates data on human and animal health, ecosystem, water and air quality, and social conditions to guide decisions. It links adaptation and mitigation, for example, through urban design that cools cities, supports the biodiversity, and improves health, sustainable food systems, and cleaner transport. However, most countries still operate in silos. Sectors hold different mandates, budgets, and data systems. Professional training remains separate, and communities are often brought in too late. This fragmentation slows recognition of combined risk and reduces the effectiveness of response to extreme events. He suggests some things. Start from place. Map climate risk with local community. This is a very important issue. Invest in integrated surveillance. Combine health, veterinary, environmental, meteorological data for early warning. Third, build relationships before crisis through joint training and exercising. 4, update legal frameworks to enable responsible cross-sector data sharing and joint funding. Strengthen education to train future professionals across disciplines. Leverage international collaboration for shared tools and best practices. Climate policies is health policy, shaping disease, well-being, and inequality for decades. One Health must be operational, not just a slogan, measured through joint assessments, shared data, and community involvement. Ignoring inequality will worsen it. Vulnerable communities must be central to planning. Leadership across government, academia, health services, and civil society can drive integrated action. I think he makes a very good point of the project and the action plan. Now, it is my pleasure to introduce our next speaker. Dr. Sinaya Netanyahu is with us, a WHO Regional Officer for Europe, European Center on Environment and Health, who joined us online. Welcome. You have the floor, Dr. Netanyahu. Thank you.
Thanks a lot, Anna, Deputy Governor. Pleasure being in your interesting conference, and I know that it started a couple of days ago, and it's really sounds. I looked at the program; it's really interesting. Sorry for not being with you, but thanks for the invitation. Good to see you. Good to see partners from the Healthy Cities Network, also colleagues from WHO. You know, today, well, actually yesterday, UNEP just was holding this whole week the UNEA meeting, and they just came up with a global environmental outlook. This is the 7th report. Nothing is actually new. I mean, we know all these things. We know all the stuff that you already discussed, the interlinkages in the environment, biodiversity loss, land degradation, pollution, climate change. the interactions, etc. And they say a couple of things which are very, very interesting. They are inviting us to look into two things about our consumption and how we can change our behavior with respect to consuming so much material. But this also included, products coming from related to agricultural, for example, meat, for example. That's another example. So the consumption, the behavioral change is so needed. And then they also ask us, why don't we hold for a second and think about if we want to measure everything by technological change or technological development and efficiency gains. So I'm not going to continue that path, but this is very good elements to think of how we are going to operate in our economies, because it is so, we understand the science, I believe, and we understand also policy, we understand actions. And the question is, where is the will to change very personal behavior, but also changing the way we measure our economies. So today I want to concentrate on the work that we do and the understanding that we have on One Health. But you asked me actually to focus also on how it's linked to environmental and health policies. How is it sitting there? Why is it connected? How is it connected? What is the focus? You also asked me to focus on climate change, and I will mention climate change, of course, but I want to show the interaction between the other environmental issues. So if I have to stop in 1 minute, this is the key messages that I want you to carry, please, with you. One is really that environmental change is reshaping both communicable and non-communicable diseases pattern, underscoring the need for a One Health approach that integrates this triple thing, the human, animal, and ecosystem. And I am one of the people who are really pushing forward to look at the non-communicable disease in relation to One Health. It's not only the zoonotic diseases. So the second message is that traditional One Health priorities, as you all know, was concentrating around zoonotic spillovers, vector-borne diseases, food safety, and antimicrobial resistance. Of course, they all are intensified by land use change, urbanism, agriculture, environmental pollution, biodiversity loss, and climate change, which also expand vector ranges, alter wildlife, livestock, human contact, and also accelerate the spread of resistant pathogens also in the environment. But let's not stop there, as I mentioned. At the same time, the same environmental drivers that I just mentioned underpin major non-communicable burdens, but they're also affecting us through the food system as well. For example, air pollution or chemical pollution from fossil fuels, the industry, agriculture, they accumulate in crops, they accumulate in the soil, they accumulate in animal species, they're entering our food chain and contributing to diseases. So this is One Health. Also, degraded ecosystems and unsustainable food systems reduce nutritional quality and limit access to nature, also affecting metabolic and mental health. Finally, climate change itself acts as a threat multiplier across both domains. So there's lots of strong elements related between the three things, the environmental pollution, the biodiversity and the nature, and also climate. The One Health lenses enable integrated policies that simultaneously reduce infectious diseases risk, AMR, environmentally mediated not communicable diseases, but also strengthening climate and ecosystems resilience. I love the name, One Bridge to Health, but it's a lot of bridges and a lot of directions that those bridges can take. And I also like the thing that we think about bridges and not breaking the silos among the areas that we are dealing with, because we can really not break the silos. Silos will remain there, and you're trying to build bridges, and this is wonderful. Last, you asked me also to address some policies, and I will address global and regional policies related to the Joint Plan of Action that was introduced by the global quadripartite, WHO, FAO, UNEP, and WUA, where they are pushing forward to integrate the environmental integrity into One Health. And as you know, if you look at the literature until 2022, which was just about yesterday, the environment was the neglected part of One Health. Not much work was done. We did some work here in the Bonn office in WHO Environment, and we are the Center for Environment and Health in WHO Europe, and we highlighted this stuff, and I will mention it today. So the JPA, the Joint Plan of Action, in terms of policy, they are saying, look at biodiversity, look at pollution, look at land use, and look at climate change, and integrate them into your surveillance and policy. Look at them into the different action that you, when you come and deal with One Health. And of course, not during crisis. This is the day in, day out work. As the deputy governor was just answering the question, this is not a time of crisis. This is everyday work. So in a time of crisis, we will be ready to address those issues. So we need to integrate data. We also need to strengthen the capacity of the environmental sector and work with them as the health sector and agricultural sectors. We need, as a health sector, to promote ecosystem protection and sustainable resource use. And we need our convening powers, WHO, and ability to lead within the countries through the health sectors to create multi-sectoral actions and through the government work and to reduce those environmental structures. So it's not just the business of the environmental structures. You already demonstrated in the last several talks how is it so much related to the health sectors and why we as the health sectors need to fight for this together with our partners in the government, specifically with the environmental sector. But also I want also to mention some work that was done in WHO Europe and in the regional committee in 2024 was approved One Health adaptation guidelines. I'll go back to our global policy, our global strategy. You know, in 2020, our headquarters have created a global strategy. And you already see, I mean, of course, primary prevention is the first strategic action, cross-sectoral, strengthening the health sector, building support, enhancing evidence, as was just said, scientists and us must bring forward evidence, communicate them, translate this knowledge into language that policymaker can understand us and the public can understand us, but also make sure that we do monitoring. So this is the areas that we, WHO, are supporting. And now when you fit into that One Health, this is nothing new for us because the One Health is there through the agricultural sector, through the environment, etc. So we work as a multi sectors, or we reach out at least. During COVID, obviously, all of us understood how important nature is, and our headquarters have come out with a prescription, or 6 prescriptions to be exact, on and actionable for green recovery from the pandemic. And guess what? Protection nature was the first prescription. I don't want to go into the other ones because they're all relevant also to One Health, but I just want to bring the environment, the nature as a forthcoming thing that came out of COVID. So we didn't need really COVID to understand that, but COVID actually brought it forward in much stronger way. Coming July 2023, you and us, I mean, with 52 member states, so 53 member states of the European region, we met together. Some of you were there. I can see some faces. We were in Budapest to convene between ministers of environment, ministers of health, bringing forward a declaration, what is called the Budapest Declaration, and a roadmap that serve us for the next 7-8 years, ministries of environment, ministries of health in the region, how we want to push forward the environmental health program. And guess what? Everybody agreed on the triple crisis. People said no more silos. I mean, we do need to bridge among the silos. We need to look in the interconnections. But something else interesting happened. Member states have decided to bring, for the first time ever in the European region, nature, biodiversity, and also implementation of 2 approaches, particularly One Health approach, but also nature-based solution approach. So in the last few years, me and my team we're were responsible on bringing forward those publications on nature, biodiversity, health, on green space, on the role of the environment in One Health, but also nature-based solution, pushing forward this element and how it's related to health. Perhaps you already went through the definition today, but for me, one thing is a couple of things are very important with the OLEP definition for One Health. One thing that I like to always emphasize that it calls for a balanced and optimized health of humans and animals and plants. No sectors can have it all. We have finite resources, budget resources, human resources, and we need to make sure and see how we balance it. We are, economists are saying we are optimizing things. We are maximizing objective functions, giving constraints. So we all have constraints, and we have to see how we live together, the three sectors, building the bridges that you're talking about in order to balance and optimize the health of these three sectors. Another thing that I want to say about the definition was first time extremely clear about bringing clean water, energy, air, safe and nutrition food, etc., and climate change into the One Health approach. So it was not just remaining with ecosystems or environmental, it was spelling out what it means. And this was really a good opening for the work that was done by the quadripartite, the joint plan of action that is actually leading us right now with 6 tracks on One Health capacities, on zoonotic diseases, on vector-borne diseases, food safety, AMR, but a separate track number 6, on integrating the environment. Now, it's not that the environment is not in each of the One Health, but the policy here was saying, or the push for the policy was saying, you should integrate environment to each of the tracks, but also look at the environment as a standalone issue, because otherwise it will disappear and it will just remain AMR, zoonotic diseases, food safety, and we will forget it. But in order to do that, it was very clear that we need also an implementation guide on change pathways, where we emphasize 3 areas. One, that we must build policies. Now, when we talk about policies, it can be a national policy, it can be a regional, it can be local. As you already mentioned, you have many areas that you need to tailor-made the policies and action because of different tributaries, water resources, climatic, topographic, whatever risk, etc. You need to make sure that we look into the legislation and align them, and we need to do advocacy, and we need to look at the budget. Not always we need more budget. Sometimes we just need to see that we allocate it in an effective way. Second thing, we said that we need organizational development, implementation, and sectoral integration. And to create those governance, to create also like a national or regional body that is dealing with this coordination of One Health. But then again, we don't have to move always together because it's too heavy. We can have one group that is coordinating, but then we can have subgroups that deals with vector-borne diseases, or we can have a little group that deals with food safety, or climate and food safety, or climate people that are working with a specific disease. So we need to have this practical solution, and not just very heavy, complex, too formal bodies that we cannot even move on a daily basis. And last thing is data, evidence, knowledge, and bringing the all sectors together. One thing that came out of the JPA is a statement that a healthy environment is essential for well-being of humans and animals and plants, and to conserve ecosystems and preserve biodiversity and reduce disease transmissions across these species is very, very critical. We took it forward, as I said, already a year actually before that, before the JPA came out, and we published this report in our office in Bonn, and we unfolded the role of the environment, which I'm not going to touch on that today, it's a separate discussion, but we also look at the drivers, the land use, biodiversity, climate change, and pollution. So this publication is available, and it's really setting the basic and the linkages on this different threat multipliers that basically exacerbate the health effects of animal-mediated diseases, but also of crops. So if I look again at the JPA and what we did, there is and I don't know how many more minutes I have, but I try to be quick. When you look at the environmental pollution, we have water, air, and soil pollution that cause major health issues, in all those, in the human and animal and plants. We also have, and we mentioned before, the non-communicable diseases, heavy metals, toxic chemicals. They are bioaccumulating in food, in the food chain. We have toxins in animal tissue, etc., which may risk our long-term health for us and for animals. Air pollution from fossil fuels also harms biodiversity, reduce water quality, affect agriculture, fisheries, and the AMR problem. We already know it spread. It contributes to the soil. It's been added to the water and the soil and contributes to the spread of drug-resistant organisms. When I go to land use and land degradation, there's so many evidence. I will just mention one of them. Okay, the land use change is the main driver of zoonotic diseases. If this research was done in 2015, for example, and they are looking at the number of emerging infectious diseases events, and most of the emerging infectious diseases events were attributed to land use change. So every time we forget to do an impact assessment, an environmental impact assessment, and changing land use, we are increasing the chances that we are going to have another zoonotic disease or vector-borne disease. And therefore, the health sector is so critical. It is so critical for us to be around the table of planners at all levels of government and to make sure that we bring the health argument when it comes to land use change. All those contaminations and soil degradation, etc., they all expose us to more toxins, the more risk, and I will not go much into that, except of mentioning that every time we change land use, we create fragmentation, we bring more contact with wildlife and human and livestock, we increase more generalist species, so and we increase the chance for transfer diseases. We unfortunately reduce the dilution effect because we are losing biodiversity when we damage land and natural land. We increase the stress of wildlife, and then they basically shed the pathogens, and then we have this replication and spillover effect, and we also expedite microbial evolution. Furthermore, in biodiversity, there is the dilution effect I already mentioned. We have a decline in pollination. This is a threat to plant reproduction, to food security, which also part of One Health. This is another concern that we have. When it comes to climate, we need to look at the extreme events, of course, how floods and heat waves affecting animals and affecting the environment, but also, how temperature and humidity alter disease dynamics, expanding the range of vectors and pathogens. We find vector diseases and pathogens in places we never thought we find them. So because animals are moving and system and dynamics, ecosystems are dynamic and changing. And we also have the danger of reduced food and feed security and also increasing drug-resistant and vector-borne diseases, and ecosystem reliance decline as climate stress interacts with existing environmental degradation, as I mentioned already before. I guess this graph is really well known, the connection of health risks related to climate change hazards, vulnerable factors, and the exposures, and all the health outcomes that come out of that. This is also a story of One Health, absolutely. So we need to also be able to communicate that to policymakers so they can integrate them into policies. So we need to make sure that we can say those things in an elevator speech to all sectors that we work with. I will not go to more examples. I just want to go back to the JPA, and I will take 2 more minutes if I may. Track 6 talks about, as I mentioned, about the environment, and the rationale I already explained. It's about the interrelationship between all the 3 sectors. It's about the direct and indirect consequences. We need to understand the interlinkages. Many of them are not well understood. Many of them are not well considered. The Track 6 said pointed on 4 actions, 4 areas of actions, which again, behind 1, 2, 3, and 4, there are lots of actions. I will not go into that today, but I will just say it talks about.
Dr.
Yeah.
Netanyahu, we
need to
have
finish.
to speed a little bit. Thank you.
Okay, so let me just finalize with 1 more minute. So it talks about protection, restoration, and mainstreaming environment and integrated data, as I already mentioned. Last, I want to mention the WHO work also on creating an adaptation guide on One Health, and where we emphasize also leadership and partnership, governance, preparedness and prevention, workforce competencies, which is very critical, targeting inequalities, as was mentioned before, also looking into data and research, and also looking into financial investments in this area. But thank you so much, and sorry for taking a long time.
Thank you. We are grateful to Dr. Netanyahu to sharing her expertise on environmental dimensions of public health and for highlighting how integrated policies can strengthen resilience. Is there any question from the public here? No. Okay. Thank you. Now, continuing our discussion, I am pleased to welcome Mr. Thanos Miloneros from the WHO Athens Quality of Care and Patient Safety Office, who join us online. Mr. Miloneros, you have the floor.
Good afternoon. Can you confirm that you can hear me well?
Yes.
Okay,
Yes,
thank you. Thank you. So first of all, thank you for the kind invitation, and apologies on behalf of Dr. Breda, who could not be here with you today. Thank you for the co-panelists for this excellent session, and thank you to the organizers for this nice conference. It's really timely, and very quickly, I would like to comment, Dr. Mastorako, on the photo that you mentioned in your session. It got an award for this year a few days ago as one of the Associated Press photos that defined 2025. So we understand that we're living in times where this kind of crisis define the years we're living in. And also Professor Dimopoulos mentioned a very nice chart before from 1970 to 2023. We saw the scale. And I consider that if we took that picture even 25 years ago, it would be still relevant. And we've seen that we live in this crisis for quite a long now. So I'm going to start and share my screen. And can you confirm that you can see it? Not yet, maybe?
Not yet. Okay.
Okay. So I will be using only approximately 15 slides. I would kindly ask you, because I have some material to share with you, some reports. If you want, I have some QR codes in my slides. So in case you want them, I will also share with you later on. But it's easier if you have your phones ready so you can scan the QR codes directly.
Okay.
So very briefly, this is, I will talk briefly about the work we're doing at the regional level. So this is the second European program of work for the next period, the upcoming period of 2026-2030. There's a typo here, I'm sorry for that. In the WHO European region, we're looking at the mega trends, which is the health security, the climate change, healthy aging, the drivers of health, and data and technology. And also we're looking at how health systems can respond to that and how we can break the silos. So actually, what is exactly on the title of the Joint Action Plan for One Health is how we work together towards that end. And we can see across the European program of work, the second one, that One Health can be found in different elements almost everywhere. So we can see AMR in health security and preventing emerging and re-emerging infection diseases. We can see the response to climate change, of course. We can see healthy aging, and as our colleague Sinaya mentioned, that NCDs is a big part of One Health as well, and long-term care. we can see how we can use data and technology for surveillance, for example, and how we can predict trends in epidemiology and other crises. And we have the drivers of health, which is the food security, water safety, sanitation, and so on. And then how we can prepare our health systems to be more resilient, health systems that themselves do not add to the problem, but they are low carbon health systems, how we can build a workforce not only to respond, but also to understand, comprehend, and communicate issues around One Health, and then how we can break the silos with intersectoral policy making, because health is wider than the health system and healthcare services. And what is the role of One Health in this? So our office, first of all, at the regional level, has done a work on quality of care and patient safety across all member states of the European region. And we saw that about 80% of the countries have implemented an AMR plan, which is great. Still, there's some improvements to make there. And you can find this report in the QR codes on the slide. There's a growing number of countries that focus on multi-sectoral engagement and collaboration through a One Health approach, but there's still work to be done in this area. Now, parts of this, let's say, report, we've seen some countries, and this is a page, let's say, from an overview from Greece, where we see that Greece has a national quality of care plan, has a national AMR plan, electronic health record is in place. There's still improvement to be made in representation in health governance and national patient safety plan. And definitely there are some improvements to be made in misinformation, accreditation for hospitals, and quality and safety. And as we can see on the top right, we have the antibiotic consumption related as well to AMR in Greece, related to other countries in the WHO European region. Now, last year, in around January, the Quality of Care Office, in collaboration and actually supported by the Ministry of Health, Greece, developed the first national strategy for quality of care and patient safety for Greece for the period 2025-2030. And there's a specific action in there, 225, that mentions the One Health approach, and I'm going to read it. It's develop and implement a national plan for infection prevention and control, including antimicrobial stewardship, following the WHO Global Strategy for Infection Prevention and Control, learning from the GRIP and reserve initiatives, and following a One Health approach. I want to just take a minute here to explain that the important part of the strategy, it is that it was not top down. We went across the whole country, all 7 regions. We did 7 workshops, 2-day workshops per region. We consulted with local stakeholders, with professionals, with academia, and this strategy was co-created with all of them. We had focus group discussions on specific elements like patient safety, like protocols and guidelines, and so on and so forth. So it's important to understand that there was a collaborative process behind this strategy. And also there are the collaborative surveillance that we suggest in the previous action. It needs to be done in collaboration with, for example, ODP, with the National Public Health Organization, with other ministries than the Ministry of Health, which is the Ministry of Environment and Energy, and the Rural Development and Food. And here, and as you understand, the Quality of Care and Patient Safety Office looks a lot into what happens in healthcare and what are the indicators and what are the measurements and the performance. And we have great focus on AMR. And I'm going to spend a couple of slides to talk about AMR and how this relates to One Health and our work. So this is a very, I find it a very nice, let's say, picture. It's the antimicrobial resistance Swiss cheese model. And we can see different layers and how this affects AMR and resource allocation. And we have at the very start the One Health context. Our office works in many of that areas. And of course, it's human health, it's vaccination. I'm going to say a bit more about that later. Is stewardship, is public awareness, diagnostics and infection prevention, protocols and guidelines. We work on food safety. And of course, we advise the Ministry of Health on regulation and policy enforcement. And we work a lot on workforce development and building capacity. And we have a lot of work in innovation in treatments and diagnostics. And this is very important for us because usually One Health is not considered to be, unfortunately, part of primary care, but it is a very, very important element. And we think that primary care can play a bigger role in One Health. And this policy brief is actually mentioning that the components of a PHC-oriented health system that actually can help One Health is the multisectorality, is empowering people and communities, and how we can integrate public health functions into primary care. And exactly with that in mind, one of the initiatives we are running now in collaboration with the ministry and for the ministry is the 3PH initiative, which looks exactly how to improve quality of primary care and community primary care by connecting public health and primary health care services and also empowering communities. This project started last July and it will conclude next year. And within that project, we have, for example, we're developing a GIS database, which could potentially be a great tool for One Health. We could add human health layers, for example, epidemiological profiles or access to services. We can add later on animal health layers, environment and climate layers, and socio-demographic and mobility. And what we could do with this information and with this tool is, for example, to detect and monitor hotspots, areas, for example, around farms or areas that are prone to floods and so on, to map high-risk human-animal environment interfaces. We could develop early warning for vector-borne diseases, food safety, AMR, and wastewater, and we know that water now is becoming an issue for Greece, and of course to better prepare for emergencies and then respond to them. Within this project as well, a big chunk of work is how to better integrate public health and primary care. So we try to see how to steer focus from retroactive care to prevention, health promotion, and community outreach, as very well as yourself, Dr. Mastorako, you mentioned earlier that public health is a big component and is in the center of discussions around these issues. So one other element that we're doing as well is that we are coordinating the WHO European Public Health Leadership course, and leadership is a very important aspect of a successful One Health approach, because there are different sectors, there are different levels, there are different actors, and leadership should be among the competencies of people that are working towards One Health. And in the European Public Health Leadership course, we have sessions on One Health and on food systems. And also we have developed this case here that I showcase is developed by colleagues that I believe is part of the conference, Mona Seravesi from WHO in Copenhagen. So we develop case studies for people participating to work on One Health issues, and this specific one is on governance, because governance and leadership and One Health is a very important aspect. Now, on the field and in Greece, we collaborate as well with academia and research institutions on specifically on nutrition and food safety. So we work with the medical school of the National Kapodistrian University of Athens. We work with the Agricultural University of Athens on research and papers on food and nutrition. We work closely with the Hellenic Food Authority, EFET, and we work as well with medical school of the University of Thessaloniki. Apart from that, we have a work on awareness and communication on not only on climate change related health risks, as I showcase here, but we try in different elements around the seasons as well. When, for example, we have crisis of floods, we tend also to keep people aware of the health risks and how they can be better supported and what they need to be aware of. So for the last slide, this is just a takeaway message. I'm happy to share any material you would like afterwards. Our goals actually on Quality of Care and Patient Safety Office is that nothing can be achieved in isolation. And this we take also from how quality of care is being improved, what is the process, how we learn, how we revisit the processes and how we learn from the mistakes, and how we engage with other sectors and actors. And we need to do it in a broader environmental and systemic context. And to ensure resilience in our health system through the One Health approach, we believe that this is a part of a bigger spectrum of interventions closely related to planetary, animal, and plant health, and that quality of care, patient safety, and public health is one part of it. So that will be all. And thank you for again for inviting me, and I'm happy to take any questions.
We sincerely thank Mr. Thanos Miloneros for sharing its expertise on quality of care, patient safety, and how these elements intersect with health strategies. Is there any question? I want to make a question. I think there's a gap between public health and primary health care in Greece. They're not so interconnected, and I think there is a very bigger gap in the private sector. So how do you see this point?
So the gap is actually that what we're trying to do is WHO offices that we're trying to bring all actors together to discuss, and we do that actively. So meaning that when, for example, we have focus group discussions, when we have expert collaboration and meetings, we try to reassure that this is an issue for all of both public and private sectors to discuss. And we understand that these gaps is systemic, historic, and it's much deeper in the history of health system of Greece. However, the roles are big for everyone has their role to play in this equation, both public and private sector. And we can see that there is expertise and knowledge across all the fields and across all levels. So if I may allow, this is a all hands on deck situation. So there's no question about that.
Mm-hmm. Thank you. Now, I'm pleased to welcome Dr. Bettina Mann, Senior Policy Advisor at WHO, Global Public Health Expert and Coordinator on Health and Development at WHO Europe.
Do you hear me?
Yes, I have had the distinct honor and privilege of working closely with Dr. Bettina Mann in the context of region of Western Greece risk and inclusion in WHO Healthy Regions Network, which she serves as a coordinator. Bettina, we're very welcome. You have the floor, please.
Yeah, wonderful, Dr. Masurako, and First of all, let me thank you so much for being part of the Regions for Health Network, but most than all, very much looking forward to the 2026 annual meeting of the Regions for Health. Today, I believe I'm part of this panel because for 19 years, I actually coordinated the work of climate change and health in the WHO Regional Office for Europe from 1997 to 2016, beginning of 2016. And this work is now continued in the Bonn office by Oliver and Dorota and their colleagues, and of course, under the leadership of Francesca and the regional office. So, therefore, my intervention today is I don't have a PowerPoint presentation, but I wanted just to a little bit reflect on some of the issues I heard, but also on some of the assessments and analysis we did with our regions. The first one is in September 2025, so this year, Flanders organized a large meeting for subnational authorities on how to deal, which policy measures are required to deal with climate change. We had more than 140 participants from 26 countries and altogether more than 40 regions, including also academia and the Committee of the Regions and many others. In preparation of that event, we carried out an assessment on what is done in regions, subnational level, what is carried out, and we generated a questionnaire to the regions to better understand where are they, and many of the aspects you were, Sinaya mentioned before, Thanos mentioned, you yourself, Anna mentioned before, and the professor mentioned before, were also highlighted in that assessment. So let me cluster it a little bit. First of all, we heard about governance before. Governance includes also the aspects of legal frameworks. So we have some pioneers actually who have been developing some very interesting subnational plans, strategies or laws. As you will know, in our European Union, a lot of the regulations are depending on the EU directives, etc., slow implementation and so forth. But some of the regions at the regional levels have actually been quite quick in anticipating, for example, legal frameworks. Just to mention an example, Andalusia in 2002 developed its first climate strategy, and which did include also health-related aspects. It has 6 strategic objectives with 137 action points. Or more recently, Flanders developed their first climate and health plan, which is now anchored in a decree on preventive health. It's passed by the government. It has a legal mandate, and it has a 3 million budget, and it is across the whole of the regional government. And this is my first point I want to mention. Dealing with One Health or dealing with climate change, and it's clearly very interconnected. We heard it all over. The issue is that it's a whole of society and a whole of government issue. If we want to act rapidly in time and address all our risk factors. The second point, which came out in the assessment, is actually that many of our regions have been prioritizing the risks. Heat is the cross-cutting, being it in the north, being it in the center, being it in the east, being it in the south. Now, and then it depends on the place where you are, whether it's wildfires and droughts, water scarcity, or whether it's flooding events, etc., or which type of diseases might be becoming more prominent, like the vector-borne diseases. Many of the regions actually are focusing, and this is one of the caveats we found, are mainly focusing on what has already happened, rather than having a proactive, anticipatory, forward-looking view on what is likely to happen. And there are issues, we heard it also earlier on, for example, mental health related aspects. The aspect of, we heard it also, air pollution and cardiovascular or respiratory diseases. very often when climate plans or climate and health plans, risks are identified, they are more looking into the past than rather looking into the future. And this is where I believe the One Health is absolutely important to come much more into the forefront. The third aspect is when then those risks are identified, like extreme weather events, it's very often done in silos. So you have heat health action plans, you have emergency response systems, you have emergency operational systems, but it's not necessarily looked at within a whole of a government, a whole of society in terms of response-related aspects. We did develop, and now it's under a renewal, the Heat Health Action Plan in 2007 after the big heat wave in 2003. And there we actually identified aspects like social care, the taking care of the elderly, taking care of the vulnerable, like the children, not leaving your children in cars. I mean, many examples on where the social system plays an absolutely important role. And honestly, I believe the social system is also a component of the One Health response. So the silos also, when you deal with heat health action plans, or when you deal with flood prevention plans, or when you deal with vector control measures, even though they are of course including the veterinary service, the environmental services, etc., etc. So again, I believe we need to get out of this still silo thinking. I'm not going into vector control, which was one of the other aspects very often mentioned. But one additional aspect which came also out is the engagement, and Anna, you mentioned it in your talk too, or somebody else, is the local level engagement. You will not be able to deal with any of the climate-related risks and also the One Health-related aspects if you don't include an emphasis on your municipalities, on the local civil societies, and on home care services or specific healthcare related associations. So that's one issue which came out quite strongly, and in some of our regions, actually, it came out as one of the core capacity development needs. Then the other aspect which came out strong is the cross-sectoral integration. And there you do have, as Sinaya mentioned, of course, nature, the environment and health, but not necessarily these collaborative platforms are across the whole of the sectors which might be needed to be engaged: housing, energy, the social services I mentioned already. The last point I wanted to highlight is the collaborative surveillance, which was mentioned by my colleague in its earlier talk. Again, modeling and doing collaborative surveillance related to climate change is a huge endeavor if you want to make it right in order to get the various dimensions: mitigation, greenhouse gas reduction, its benefits, its impact on health, as well as the adaptation related impacts, all of them included. Some of the countries, some of the regions actually have been doing this both retrospectively and looking at their adaptation planning retrospectively, but also prospectively. And some of them have been focusing much more on the healthcare system, on the health services, on the health system itself, as we heard before. And here, one aspect which comes out is the training, and you mentioned it before, Thanos, on healthcare professional, the health workforce training. It's a big issue on climate-related aspects, on One Health-related aspects, but also on these planetary, multi-sectoral, across the government, society aspects, which often are not included. I mean, at least in my medical training, I don't remember it to have been included in those aspects. Then last point, many challenges have been identified, and one of them, the complex and evolutionary regulatory landscape, the mismatch of risks between plans and real-world requirements, the need for constant updates of any planning process and external collaboration, not always easy, the gaps in health system, decarbonization of the health system, integration of transport, energy, and other aspects, and difficulty in adapting policy to all care subsectors, and climate and health indicators not so easy to define, unpredictability of extreme weather events, and again, the need for frequent updates. Last but not least, Sinaya mentioned it, the consumption pattern. So more and more our regions are looking at behavioral approaches, behavioral changes in order to protect the people themselves, but also to get a stronger mitigation and adaptation benefits out of what needs to be done by the whole of society. That's it.
Thank you very much, Bettina, for sharing with us your expertise. You have shared with us very good points. I think there is another, the gap between the different levels of government, between government, regional, municipal, and community. So there's, what do you think about this?
Oh, that's a question like, $100, right? I'm joking. I think there are many aspects to be considered. There are some, it's a little bit about what is accountability, because at the end of the day, it's what is your mayor accountable to, what are you as a regional or a deputy regional governor accountable to, and what are the different stakeholders participating in this process accountable to. And that differs very much on the role the region has and the competence, the size, etc., the areas the cities do have. What becomes on to be extremely useful is this citizens forums, citizens, what do you call them? Citizens parliament, not citizens parliament, citizen forums, the youth forums, where you're actually making accountable, where you're asking the responsible officers to be accountable to what is promised to be done within your legislative or electoral framework. How do you enhance a collaboration? This is a big issue. And I used over my 27 years now in WHO, very much the so-called communication engagement protocol. It's not a protocol, but it's a coding, where for every work I'm doing a stakeholder mapping, but I'm mapping those based on the on the influence they do have, and on how the theme I'm dealing with is for those stakeholders. And based on those, I'm doing 4 areas. The ones which have high interest and high influence are the ones I'm dedicating constant communication mechanisms to. And then the others are falling more on like newsletters, information and outreach, inviting them to meetings, discussion panels, etc. The media normally is part of that process from the beginning at the highest level possible. But there are many other ways. I just learned over these days the so-called hypothesis-driven approach, where you say, okay, by 2030, I do not want to have any wildfire related mortality in Greece or in Western Greece. And you say, okay, these are the action points. And based on those action points, you develop the hypothesis on what are the strategies and how to work together on those strategies to get them done across the government, across the society. I mean, now, to be very honest, we all know it depends on the people you're working with, right?
Mm-hmm. Yes, this is right. This is right.
So you need to have a very different approach for every different person if you want to get it into, in particular, those of high influence and high interest. if you want to have an accelerated, let's put it like this, impact.
Thank you. Thank you very much, Bettina. Now, I have the pleasure to welcome Mrs. Desi Papathanasopoulou. It is a great honor and pleasure to work closely to Mrs. Papathanasopoulou in my role as Deputy Regional Governor of Public Health, because she is the creator and has practical community-focused strategies on the cities. So one point to discuss is about the cities, how the cities can respond to climate change. So I think there is a very good discussion about this, Desi, how a region and a city can work together so they can manage climate change crisis. Thank you very much. You have the floor.
Thank you very much, Anna. Thank you very much also for the invitation here in this very special panel, I must say. Thanks also the organizing committee and the scientific committee of this conference and the co-panelists that we are together this afternoon, and the friends, the colleagues from WHO. I will stand in the position of the cities and what decisions we have made in the WHO, in the Healthy Cities movement there. And I will share with you some of this, because the important is the implementation. I heard a lot from other panelists about implementation of One Health approach, and I think that the cities are in the most important place to do a lot about this, with the synergies with the other levels of administration. I will not stand here because others have spoken about this, but is this that I say, advancing the implementation of One Health, the cities are here. Why? Let's see at first why One Health is important. The Earth's population grows. The most of them lives in cities. Our connection with animals and the environment changes. People in the cities live closer together. Changes in climate and land use we have more global travel and trade, and animals now, in our days, are more than food. We live with them very close. What is One Health and why is important in cities? Just a minute. Okay. One Health is an approach that recognizes the interconnectedness of human health, animal health, and environment health. We talk about this. One Health analyzes these three components and how they behave when they interact. It recognizes that it's impossible to take care of one aspect without taking care of the others. And One Health has become more important in recent years, due mainly to the COVID-19 crisis. This approach emphasizes the need of collaboration, cooperation, capacity building, communication across multiple disciplines, including human health, veterinary medicine, environmental science, social sciences, and more, to address complex health issues. One Health is imperative for cities, given the unique challenges they face: dense populations, pollution, close human-animal interactions, shared environmental spaces, heat waves, invasive species, and their role in the biodiversity crisis and their adaptation to climate change impacts. In such context, it's crucial for cities to implement the One Health approach as one preventive strategy. It will increase the benefits and mitigate the negative impacts of this evolving context on the well-being and health of the living beings. As analyzed by WHO, cities are central actors for the implementation of One Health, thanks to their characteristics of action. So we have 3 levels of administrative that have to cooperate: the regional level, the countries, the national level, and the local level. Let's see the local level. I will focus on this today. Locally, communities across the region of European region, women have led One Health initiatives to address health issues at the grassroots level. These actions not only improve health outcomes, but also empower communities to take ownership of their well-being. The political statement of the WHO European Healthy Cities Network on local level policy recommendations, operationalizing a One Health approach on 22 to 24 November 2022. Mayors and senior political representatives reaffirmed their commitment to the Healthy Cities movement and to One Health through the political statement on local level policy recommendations, operationalizing a One Health approach which integrates human, animal, and environmental health. The statement outlines 10 concrete local level policy recommendations related to prevention, preparation, promotion, and transformation. Acknowledging the crucial role of local governments in implementing the One Health approach, the recommendations urge cities to strengthen policies, enhance surveillance, invest in research, and foster partnerships to improve resilience, equity, and sustainability, aligning with the WHO European Healthy Cities Network 6 key themes in the Copenhagen Consensus of Mayors to ensure healthier, safer, and happier cities for all. The 6 Ps under which we create our holistic approach policies in the cities are human, peace, planet, prosperity, participation, and place. Now we decided next 5 years to have a new one that includes One Health approach, that is preparedness. And so the circle that you see, now we have the 3rd circle with seven pillars. So in this statement, the mayors decided to recognize the interconnection between the One Health approach and the key themes of Phase 8 of the European Healthy Cities Network. They built upon they decided to build upon the Copenhagen Consensus of Mayors. They decided to commit to operationalize One Health at the local level. And they also consider that the process of this operationalizing One Health across the European region is an essential step in aligning mandates to strengthen cooperation and coordination between cities and sectors. Also, they confirm their commitment to the values and principles of the Healthy Cities movement. One Health is defined as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. To operationalize One Health at the local level, the mayors put forward the following recommendations. Also, we connect this approach with the Agenda 2030 Sustainable Development Goals. At first, we have recommendations that have to do with prevention. Map innovative and scale up existing One Health initiatives and networks at the local level. Second, increase One Health literacy across all levels. Third, build back better by further investing in research and data across all sectors. In the field of preparation, the guidelines are to strengthen the social component of One Health, build community engagement mechanisms to address the interface between humans, animals, and the environment in an integrated manner. Listen, use, and act on local voices to build trust and co-create community health and well-being. Second, to create urban resilience. Lead in creating urban resilience by collaborating across multiple city departments and working with private sector stakeholders and community leaders. It is crucial to invest and spend in ways that produce population and societal well-being for all, and have infrastructure, policies, and strategies in place to protect and adapt cities against vulnerability, environmental stressors, and uncertainty caused by weather extremes such as heat waves, floods, cold weather, energy shortage, and to prepare to meet increased migration. Ensure the Healthy Cities Steering Committee reflects the One Health approach. Strengthen the intersectoral steering committees that we have in cities by ensuring that the relevant stakeholders and policymakers, health sector, environmental sector, veterinary sector, and food safety sector are engaged. Recognize good practice and increase the visibility of achieved targets and goals. I must say here that in Greece, we in this intersectorality, we put also the civil protection department to be part of this. In the field of promotion, promote change in food systems. Promote and support the shift of food production and consumption towards a more sustainable and equitable pattern. Create and present solutions for producers and retailers to make healthier, more sustainable and local choices easier. Increase awareness by providing information and introducing local food labeling. Second, promote healthy urban planning. Include the One Health approach in urban planning. Enable citizens by making healthy behavior the easy choice and contribute to equal opportunities. Invest in biodiversity by creating high-quality green and blue spaces. Present best practices to city developers to create affordable housing and more sustainable and resilient cities. And third, promote projects and partnerships. Celebrate achievements and milestones reached along the way of implementing the One Health approach. Increase visibility through communication mechanisms and share achievements and challenges within networks to open discussions and gain feedback. And finally, the transformation. Transform collaboration across jurisdictions and on multiple governance levels. Work with all sectors of local government to integrate the One Health approach through multiple levels of government, including local, subnational, and national authorities. We prepare a statement together with the Regions for Health Network, and we gave this statement to the 7th Ministerial Conference on Environment and Health in Budapest on 2023, describing all these decisions. The conference addressed the health dimension of the triple environment crisis while recovering from COVID-19. Focus on accelerated action to tackle climate change, environmental pollution, and loss of biodiversity. Build forward better from COVID-19 pandemic, including actions for urban resilience. Protect vulnerable populations and vulnerable life stages. Implementation strategies and examples in cities. First, governance and planning. Integrated One Health into local policies from urban design. Green spaces for active mobility to climate adaptation. Nature-based solutions using green infrastructure, parks, river bank regeneration, to improve air quality, manage heat, and boost biodiversity. Cross-sectoral networks. Initiatives like the URBAC, One Health for Cities network, support cities in sharing expertise and testing tools. This is a European Union network, funding from the European Union. Data and tools, utilizing tech and data analytics to understand human-urban interactions and stress levels in green spaces. Community engagement. This is one of the most important issues here. Involving local groups in designing interventions like informal sports for health in Lule, the city, or community gardening here in Greece, in Elefsina, that is part of this movement. Key pillars and directions for municipal One Health policy. Establishment of collaborative structures and networks, promotion of disease surveillance and prevention, protection of the environment and biodiversity, community education and awareness, strengthening preparedness and response to emergency situations, promotion of research and innovation at the local level. I must say here that since 2014, the Healthy Cities Network in Greece has big programs, awareness, and sensitize the population for the AMR, working with the school community, students, teachers, parents, with the general population, and so on, and trying to in a big effort to reduce the AMR in Greece. Important considerations for municipalities. Adaptation to local specificities. The One Health policy must take into account the specific geographical, social, economic, and environmental conditions of each municipality. Transparency and accountability. Municipalities must be transparent regarding their One Health policies and actions and be accountable to the local community. Continuous evaluation and adaptation. And also the One Health policy must be evaluated and adapted based on results and new scientific evidence. At least the One Health is a very big umbrella for the cities, under which a lot of the works that a city has to do and policies that has to implement are under One Health umbrella. And now that we work on the 7 Ps, the One Health is under the pillar of preparedness. Thank you very much, and I'm at your disposal.
Thank you, Desi, very much. I want to make a question. You have a very good experience as a national coordinator of the WHO Hellenic Healthy Cities Network. So I want to ask you if there is an example for a Hellenic health city that has integrated One Health policy in its planning. How many cities do you see? Do you have in the network? And one example of good interaction with One Health network.
The cities of the network, member cities are 246 cities and 3 regions. We work for One Health approach a lot of years now, without knowing that is One Health approach, because we implement a lot of projects that now are under One Health approach. As for example, the big awareness programs for antimicrobial resistance. Also, a lot of cities, for example, the city of Ioannina or the city of Edessa or the city of Aspropyrgos are working to renovating their lakes or their rivers under very good plans that they have produced. Also, a lot of cities are working for healthy aging or for healthy tourism now. And all these are under this umbrella. But we have a scientific committee in the network. The scientific committee is intersectoral and from different sciences come the experts. The experts comes from municipalities, are politicians or from the staff of the municipality, but very high qualified. This group, big group, we work together to create policies for the municipalities as guidelines how to make their own policy. We have prepared until now 12. One of them, with very, very clarified guidelines, has to do with Agenda 2030. And now we have started to work on One Health policy, taking using all the tools that we have from WHO, all the bibliography that is until now produced. We use it to create the One Health policy for our cities as a guide, as a guidelines for our cities. So all of these different programs that we have until now, we try to connect, to discuss about this. In the recent annual conference that we had, we have a lot of cities that refer to what they do about the One Health approach. And it's an opportunity that Mrs. Miloneros is here today, because I want to ask from WH's office to make a seminar for the cities. Because cities is the implementation of the One Health approach.
Oh,
Thank you.
I agree with that. Thank you very much. I'm closing now the conference. I think I thank you very much, Desi. I will say some key points. Then I think it's important. Climate change crisis is going very, very fast, so we have to move faster. There is a multi-factor deterioration of all factors together, because there are many factors to collaborate together in a climate change crisis. So it's a very complex problem. Then I think that many times policymakers cannot understand the complexity of this and the future impact. So it's very important to work with the community, to have a culture shift in the community, to all people be aware of these threats, and policy makers can understand the complexity and take the right decisions, because the gaps are in it's a very big situation and very levels, about regions, cities, and government, about the different science fields, and in many aspects. So there is a need to be a national action plan, but I think there is a need to have subnational preparedness very high in the agenda, because different regions and cities, they have different problems. So we have the strength, I think, the power of the people and the power of the region of the cities. It's very important to work together to make One Health approach very big in these levels. That data usage is very good tool, because we have a very complex environment. So AI will play a key role, I think, in the data, managing the data for the decision making. And I think we have to have a plan in national level, but act locally, and act locally with healthy cities and communication, very high level of communication to the people and our awareness of the people. So here in the western region of Greece, we work in this field very hard. And we thank you very much for this conversation. Professor Dimopoulos, do you want to close this conference?
It's okay. Okay, I think
Thank you very
that
much.
all the interventions by the participants of this panel were really very interesting and important. And I think that everybody from his aspect gave the interconnection between the health and with the environmental health and also with the climate crisis and what we have to do in an holistic way, in a synergistic way, and in the different levels, national, regional, municipal, local level, including municipalities and communities, in order that we gain this war against the climate crisis, which influences, of course, the life of people, influences the human well-being. I think that all the experts which participated in this panel are willing to offer from their positions, from their posts, the best to the Greek authorities, to the government, to the regions of Greece, in order to have all the weapons we need to tackle the climate change effects.
Okay, we thank you all for this conversation, very good conversation, for your engagement, your expertise, and your commitment to the One Health vision. Thank you very much.
On behalf of the organizing committee of the One Bridge in Health conference, we would like to thank you for your valuable contribution. And now we are closing this session and day 3 of the One Bridge conference. So thank you very much all for your attendance, and rendezvous tomorrow at 9:30. Thank you very much.